Hi. It really does feel like we're just juggling a lot right now, and that everything just happens to come from different directions all across the board. And I'm right there with you, and we're gonna do something about it. This is the Stream-A-Thon for trans healthcare, and we're gonna be raising $1 million for other trans people to access gender-affirming care. So this is a 30-hour live stream that's gonna end at midnight on Trans Day of Invisibility. And for the 4th year in a row, we are working with a nonprofit organization called Point of Pride, and they've been around for almost 10 years doing this work. They're trans-founded and trans-led, and all of the money, 100% of it, goes directly to a trans person. And you know you can trust them with their money because they are platinum rated by GuideStar, and that's a very big deal. And they've done that for the last 6 years in a row. Do you know how much work that is? But of course they're good at this. It involves a lot of transparency. That's dumb. And if you're interested in learning more about Point of Pride, you can by going to their website, pointofpride.org. If you want to learn about how the money is distributed or how to apply for this help, just go to their website and you can find out more there. This fundraiser started in 2022, where I set out to raise $24,000 in 24 hours, and by the end of the day, I had over $120,000 raised to help other trans people access HRT. In the first 3 years of the fundraiser, we've been able to raise $4.5 million. Over 100,000 people have donated because of this fundraiser, which is about an average of $50 per person. And since their inception, the Point of Pride organization has helped 27,000 trans people. This is a good organization. This is a fun fundraiser. And I'm so happy that we get to do it again this year with you. So remember, you're worth the time it takes to help a stranger. Let's go.
Okay. I've got to make Aiden say a word. And thanks to whoever suggested this, I have to talk and I have to continue to switch accents at random. And I'm so sorry.
All right. Are you ready? Go.
Well, I'm here with you in Mercury Stardust's studio. Top of the morning to ya. She's got a lot of tools, you see. She needs to...
Handy.
Don't you know? She's got to store those tools in something.
A toolbox. A storage unit.
Yeah, toolbox.
Oh, okay,
I was just about to go into Long Island.
Sorry.
So I says to her, let's go get a cup of coffee and you just bring your wrenches.
Talk about Point of Pride in that accent.
In this?
Yeah.
Oh, I'm sorry to my mom if my mom is watching. Cause
Yeah. Oh, I thought you
that,
You gotta go for it.
Okay.
Big moves, money moves, money moves. Ooh.
Oh.
Okay.
I'm sweating.
We just started and it's already so wild.
Yeah.
I keep fucking up the bottom. I'm having the best
Because
time.
I think you think that was a safe bet, but that was not a safe bet.
No, it wasn't. I don't think that one was.
No.
That one was spooky.
Oof.
Yeah.
We got really intense about this.
I know, it got so real so fast.
We were reminiscing and having a good time, and now all of a sudden it turns into, oh shit, we did something.
Yeah, it's getting interesting in here.
Okay.
Oh my god, Mercury. Oh my god.
Hold on.
Yeah. It's moving, Mercury. Be careful.
I know. Baby,
Careful, SpongeBob.
Stop
Careful,
it.
SpongeBob.
Patrick?
Patrick! I'm Sandy Mamas.
You're so...
I'll be
Come
perfect.
on!
Yes!
We got like 5
Yes!
minutes! And I think we had to take a serious look at ourselves And we have to acknowledge that sometimes that in order to help each other, we have to take up less space. Yeah. And they clapped for me. Do you remember that? They yeah, you're right. I'm an asshole. It was so wild. It was the most wild shit.
That's that host privilege, though. That's the privilege you have in a drag performance. You can really tell people about themselves.
When you have a microphone, people do just have the tendency of being like, yeah, you're great.
It's a vibe, yeah. Oh, you're nasty.
Girl, this is going to be
You're
bad.
sick.
This is going to get real ugly real fast, girl.
There's no way. There's no way. You just set me up I think you might be fucked, girl. Oh, no. Not this. Okay, I got this one. Hold on.
Oh, wow.
Yeah.
But yeah, that was one of my favorite speeches I've ever given.
Oh, yeah, I wish I... Oh my God! 3 times in a row is so crazy, Mercury.
I can't believe you
That's so crazy.
You have beat me so bad tonight. I have got my ass whooped.
Tell me. Wait.
You want to be at the bottom of your oval. You know, and if you want to come like out to the side of your oval, this is your drawing. But we need more wigglies.
Another wiggly. More?
All right, so we're up to 4 wigglies.
Okay.
I need you to draw 4 more wigglies.
Oh my God. Are they next to each other?
They can be anywhere you want, but they need to start at the oval and radiate out.
1, 2, 3, 4.
You're doing amazing, man. All right. Tell me what you've drawn.
It's an... Can I look at it?
Yeah. What do you think of your abomination?
Hey. Okay.
What's got a big oval body and 8 wigglies sticking off of it? That was a setup.
A bulb, a flower bulb.
What
like
lives
the
in the ocean and has 8 wigglies?
An octopus.
Yeah.
Jeffrey, walk me through this octopus. Are those the eyes in the middle?
Yeah, you know, I thought there was potential to make a sticker out of this. You got it.
Go ahead.
That means the next one has to be.
It has to be bars.
Yeah.
Yeah, that's our last friend.
You could have opened this for me.
Well, no, I couldn't because I feel like I can only do so much for white people. That's like, you know.
All right, well, I walked right into that one.
Yeah. Yeah.
Okay. Where is the last one?
So our final selection is going to be right over here on the end. Yep, absolutely.
Right here?
No, right there.
Right there.
Yep, there you go. Give her a sip and tell us what you think.
Okay, we have a problem.
You have a problem.
Yeah.
What's the problem?
I can't. That's not Barks.
That's not Barks?
That's not Barks.
That's not Barks.
That's not Barks. I'm really nervous now.
Oh.
Okay, I want to be clear.
That's not Barks? You sure?
All of them taste way too similar.
Okay.
I don't know this for sure, but
Right.
I feel like you might be fucking with me.
I might be fucking with you.
Yeah, I'm a little nervous.
In what way? How would I be
I
fucking
think
with
they may all be,
I'll be the same.
they all be mug. That's what I.
Oh, they might all be the worst tasting root beer in the world, according to Mercury Stardust. I need the chat to clip that. I need it in my inbox immediately. Because that's what would you like me to drop the ice cube in it for you?
Oh no!
Will that make it better?
No, because it's gonna water.
All right. 3, 2, 1.
I didn't take a bite.
I took a healthy one.
Not bad, but I can't play it.
Definitely just like a pickle.
Got me.
You know what? It's like icy, and I actually taste it more if I just like. Oh, do
Got
that
me.
instead.
Got me behind the eyes.
Mm-hmm. It's like when you bite into like a really juicy pickle and it's just all the juice. That's what it is.
Yeah.
I don't hate it.
It's easier to bite it than to act and just swallow it. Than like,
Basil says that was something. I'm gonna start coughing. It says you can eat it frozen or unfrozen. I feel like that
Why
would be
you
even
eat
more
it unfrozen. outro.
I don't like it.
I can't stop.
Here you go.
I got 2 pickles. I got 2 pickles.
Yeah,
Thank
just
you,
pickle
JK.
juice. I mean, thank you. I mean, not. I mean, thank you, but also not thank you. Like, thank you for your actions. I didn't love that.
Not the experience.
Yes.
I'm gonna toss these in the freezer.
Donating, or they want us to shut up. I don't know. It could go either way. We're at $751,000,
What?
everybody. We're at 750.
Smash that goal so fast.
751. I think we got a big donation that I missed in there somewhere. Oh, look at this explosion. Explosion.
Oh, there it is.
Oh my God.
I've been waiting for the wombat, pooping wombat to come back.
Okay, stop it. That's so funny. The poop. Okay.
Gretchen did amazing
Hold
with the
on.
pooping
We have
wombat.
to explain this because folks
No,
are
we
not
don't.
going to get it. They're not going to understand why there's a pooping wombat.
Oh, YouTube already knows. We already told them
Because-
about this.
Oh, wait, YouTube already knows, but TikTok and Instagram have no guidance.
We had a whole conversation
They
about it on
can't even
YouTube.
see this right now. TikTok and Instagram
Oh
can't.
no!
TikTok and Instagram are not getting the pooping wombat. There's a highway
Y'all
robbery.
are missing out.
Poor Instagram and TikTok do not get the
YouTube gets the
experience
wombat.
of a pooping, dancing wombat.
We had a whole conversation, and I looked up the actual reason why wombats poop cubes.
So why? Why do they poop a cooby?
Because of like the amount of fiber and what they eat, their poop dries up inside their body, and then the way that it moves through their intestines after it's already dried up before they poop it out turns it into cubes. The more you know.
Oh shit. Right now, and double tap the screen for as long as you can. We have only 45 minutes left to hit this goal. We're aiming for $800,000. We would love to hit that number tonight. So double tap that screen, comment down below, and share it live. You can actually donate right now by texting Stardust to 44321. That's Stardust to 44321. And we got Jay and Anonymous who just donated money. Oh my God. 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 Basil, did you just see that? Oh my God. Oh my God. We got a $10,000 donation. We got a $10,000 donation, everybody. We got a $10,000 donation. We've never gotten a $10,000 donation during a live stream at any single point. Holy goddamn shit! We got a $10,000 donation from Anonymous. Oh my God. Double tap that screen, comment down below. Now that puts us in. Oh my God. That means we have only $30,000. We're gonna fucking hit this. Double tap that screen, comment down below. You gave us so much chance. Whoever gave us $10,000 from the bottom of my heart. Thank you. Thank you, thank you, thank you. Oh my God. Oh my God.
The impact Point of Pride had on my life was nothing short of amazing.
Hello, everyone, and welcome. Excited to be chatting with everyone today. Thank you so much for joining us. Hello, everyone, and welcome. Excited to be chatting with everyone today. Thank you so much for joining us. My name is Aiden Dowling, and my pronouns are he, him. I am the co-founder and chief advancement officer here at Point of Pride, and we're excited to have you with us for this special conversation, which is part of our Transgender Awareness Week programming. This week is all about uplifting trans voices, fostering understanding, and advocating for greater visibility and access to care for transgender and non-binary individuals. We're grateful to have everyone here as part of this important dialogue. Before we begin, I want to put a disclaimer out that this information provided is for educational and informational purposes only and is not intended as medical advice. Please always consult a qualified healthcare provider for personalized medical guidance. I'd also like to take a minute to introduce those who may not know what Point of Pride is and what we do. So we were founded in 2016, and we are a trans-led nonprofit organization dedicated to providing life-saving, gender-affirming support to transgender and non-binary individuals around the world. We offer direct services through programs such as our free chest binder and GAF program, our HRT Access Fund, our Electrolysis Support Fund, our Thrive Fund, and our currently open for applications Annual Surgery Fund. Our mission is to eliminate financial and systemic barriers to care, ensuring that every trans person has access to services they need to live authentically and thrive. And I would like to happily introduce our guest for today's virtual workshop. Everyone say hi to Dr. Ronnie, pronoun she, her, and any respectful pronoun. Hey, Dr. Ronnie.
Hey, I'm so happy to see your face.
Yes, yes. Dr. Ronnie is an associate professor of family medicine and community health. She practices full spectrum womb to tomb, sperm to worm family medicine and has been providing healthcare for the two-spirit, queer, and trans community for over 15 years. In her clinical practice, she is committed to providing family medicine and
obstetrics.
Thank you. Obstetrical care that is rooted in the foundation of promoting health, equity, anti-racism, and size acceptance. More recently, she has been co-producing and co-hosting a podcast called This Is Probably a Really Weird Question, which focuses on sex, gender, sexuality, and history. You can find it wherever you listen to your podcasts. Thank you, Dr. Ronnie, for being here for this HRT Fireside Chat. For all wanting to ask questions, I just want to remind you that we will have time for questions at the end of this discussion. So there is a little Q&A chat box below. So if you could utilize that. And also shout out to Mel, our interpreter here, as well as Tyler, who is behind the scenes at Point of Pride, and will be dropping some information in the chat as needed. So hey, Dr. Ronnie, how are you doing?
I'm good. I am going to be Dr. Mom for a second here and say goodbye to my child.
Oh, yes.
One second.
Do it. Because what I'm going to say is I want to talk to you about what HRT is. So this fireside chat is going to focus on hormone replacement therapy, also known as HRT. It's a crucial aspect of gender-affirming care for many transgender and non-binary individuals. HRT involves the use of hormones such as estrogen, testosterone, or puberty blockers to help align a person's physical characteristics with their gender identity. The journey of HRT can be deeply personal, offering relief from gender dysphoria and empowering individuals to feel more comfortable and confident in their bodies. Hi, Dr. Mom.
Hey, I'm back.
Welcome back. Again, thank you so much for joining us. I know that some people here may have seen you from our annual TikTok-a-thon, so it's great to have you back. How are you doing?
I'm hanging in there. You know, it's been, I love my job, and sometimes weeks like this are hard because people are really scared and stressed. And so I've been doing a lot of problem solving with folks this week.
Yeah. Well, that feels real. I'm sure some people here can relate to everything you're saying. So, you know, I really wanted to jump off this fireside chat with kind of asking you, like, you know, you've been doing medicine for so long, like what inspired you particularly to start working with transgender and non-binary patients? And specifically, I know you do womb to tomb. So what inspired you to work with our community as well as your specific approach to working with our community?
Yeah. So, you know, I took kind of a slightly non-traditional path through medicine. So I actually started out in college as an English major and, you know, had one of those classic 20-year-old caffeine-induced frenzies in the middle of the night where I decided that English major wasn't going to help me change the world at all. So I ended up switching my major and starting to try a pre-med track. And I just got weeded out. Like the kids in that program were really intense and really competitive. And I felt like kind of my journey to medicine was going to take a different path because I just didn't feel like they were my people. So I managed to graduate with a few major changes. And then the person that I was dating at the time, we moved out to California together, and they were going through a gender transition. and this, I am old, so this was a long time ago. And even in the San Francisco Bay Area in the mid to late 90s, it was really hard for him to get the care that he needed. And so I kind of watched that process, watched him struggle and try to get through barriers and hoops. And I decided that I worked in the healthcare system for maybe like 5 or 6 years, and then kind of maxed out with what I could do. I was working basically as a medical assistant, and felt like the next step for me would be management. And I did not want to do that. And I really wanted to do direct patient care. So I went to medical school in Philadelphia specifically because it was a city where I could get a lot of training and have a lot of community around me at the same time. And then when it was time for residency, I wanted to go, I don't know if any of you know how residency works, but it's basically like a matchmaker, right? You make a list of all the places you would like to go and you rank it. And then all the programs rank you as an applicant. And then this magic computer in the sky matches you. And on one day you open your envelope and it tells you where you're going to go. You don't get a choice. So at the time I still have quite a bit of medical school debt. And I knew that the places that were doing this training were New York City and San Francisco and Chicago, all places that were really expensive. And also Madison, interestingly enough. So the clinic where I work now has a really, really long history of providing trans healthcare, mainly because of one person, right? One person can make an enormous difference. One person at our clinic sometime in the 80s looked around and said, this is a population that needs this service. There's nobody doing it. So he just started doing it. And so we became known within Madison as a really safe place to practice. And it became a way for me, it was kind of a door to all sorts of things, right? So I do a lot of just kind of sexual health and reproductive health care, and a lot of times gender care really meshes well with that. And I think the way that my practice has changed over time is that I have gotten more comfortable with being unsure, and I've gotten more comfortable with that are maybe off the beaten path. And so I've gotten a lot more comfortable really honing in and individualizing someone's care, because that's really the cornerstone of what we're doing, right? If you know like one trans person, you know one trans person, and your goal as the person taking care of them is to listen and help them the best that you can to help them live their best life and feel like they're achieving their embodiment goals the best that they can.
Yeah, no, I love that. And I love hearing that story. And it sounds like there's a matchmaker that may or may not be a great match for some people out there in the medical world.
Right.
Happy you found where you're supposed to be. I
found my people.
Exactly. I think that's really, important. So I'm, based on your podcast, I love you because I think that you have such a relatable approach. And again, anybody who has questions, please feel free to drop them in the Q&A. So I kind of want to start off first. A lot of people in this talk are maybe they're interested in HRT, or maybe they've just begun, or maybe they're just not sure if it's correct for them or not. Do you have any advice for people who might be unsure?
That's such a great question. I think everybody deserves a good therapist, number one, right? Regardless of who you are, regardless of what your personal journey is. Especially right now, we're living in a really stressful time. And I think having a good therapist is essential to help work through maybe some of that ambiguity. I also think that it's okay to not be sure, right? Sometimes I think people get into this headspace because of the way that the healthcare system has operated in the past and treated trans and non-binary folks in the past. They feel like they have to come to the table with this story that fits in a really nice box of like, I've known since I was 3 that, I always wanted to play with Barbies. I never wanted to play with G.I. Joe. And I got caught wearing my sister's dress and my parents got like that. You don't have to prove that you're trans enough for hormones. At least your doctor or your clinician should not be asking you to do that. So uncertainty is okay. Everything in life includes risk, including not doing anything, right? Inaction also involves inherent risk. And so doing your homework, if you can, doing some research online. One of the best resources I think is there are 2 that I really love. One is UC San Francisco's Center for Transgender Excellence. They have a really robust and well-researched medical site that talks about risks and benefits of medications. It's a little bit geared towards clinicians. So if you want something that's geared a little bit more towards patients, Planned Parenthood of Michigan has a phenomenal website about gender affirming care. And they have these little topics that you can just click on. And it goes through most of the questions that folks have before starting hormones. And also remember that like nothing is etched in stone. If you start and it doesn't feel right, it's okay to stop.
Yeah, I think that's a great point. I think so many people think you've got to keep going, so to speak. How have you seen people use HRT to get the, those secondary characteristics that they're looking for?
I've seen all sorts of things, some of which are, in the textbooks, as we like to say, and some of which are not. Sometimes people will use hormones indefinitely, right? And I have, because I practice, womb to tomb, I have trans folks that are 10 and I have trans folks that are 80, right? So I see folks across the lifespan. And so some people use the medications for as long as they need them. And that could be until the end of their lives. And that could be for a short period of time. So sometimes people will use testosterone, for example, for a short period of time to achieve 1 or 2 things. That could be their voice dropping or achieving a certain pattern of hair on their face or body. And then they decide that they would like to stop, and that's fine. Sometimes people want to really go all the way to the other end of the gender spectrum. And so we try to like maximize their doses of medication within safe parameters, right? So we're monitoring labs and making sure that they're feeling okay. And not everybody has that goal. Sometimes people want to use topical medication, so like creams or gels, either like on their chest to develop breast tissue or on their bottom parts to like help with bottom growth, or to help with discomfort. Like if people are having pain with erections, sometimes people have heard about, oh, I read about this thing on Reddit, right? I have learned a lot about Reddit. And I've got no skin in the game, right? Like I think when I was a younger doctor, I would have felt a little huffy about it and be like, what do you mean you're doing your research on Reddit? And now I just don't care, right? Like we've been crowdsourcing information in our communities for decades, and Reddit is a way that we do that. So we talk about it, right? We talk about whether or not that's a reliable source and whether or not the stuff that I know from other sources aligns with the things that they've heard. My goal is to keep people safe and alive so that they can enjoy their bodies, as they become more congruent. So my goal is to just like help people feel better in their bodies. And I'm always really honest with folks that I'm probably not going to be able to make someone look like Marilyn Monroe overnight, right? There's a certain amount of genetic building blocks that you're going to have, and that you're going to be able to achieve some things with medication, but it might not be everything.
I love that. I have a follow-up, but I want to check in on Mel, our interpreter. Technically, we were supposed to have 2 interpreters, so Mel could get a rest. So Mel, if you want to drop the name of potentially the other interpreter you think is supposed to be here, and I can check the attendee list, I'd love to just pause for a second to do that. Fantastic. I'm searching here to see if we have this person here. Unfortunately, I do not see them here, Mel. So I do have transcription on as well. So take time that you need. I think most everybody would understand and respect that. Okay, awesome. So Dr. Rani, that actually brings me to another thing is, can you explain how hormones like kind of work on the body? And maybe a better way of asking that is, you were just saying you can't turn someone into something. It's all based on their genetics. So how do you explain that to people when they have specific expectations? Like they might say, well, I want a full beard, or they might say, I want to get rid of my beard, right? How do you manage some of those expectations? What are some of the things you advise for people to know?
So one thing that I talk about is, if you lined up 100 cis women in a row or 100 cis men in a row, none of them are going to look exactly the same, right? So some people are really curvy and have a lot of hair, and some people are not. Some people are really thin and willowy and don't have much hair. And sometimes this is even more complicated because sometimes people don't know their families of origin, right? If they were adopted or otherwise estranged from their family, maybe they don't know. So, and I would say not everything depends on genetics, but that definitely plays a role. So for example, what we call male pattern baldness or androgenic hair loss, that gets passed down. Yes, it's a sign of having a lot of testosterone receptors in your scalp.
A sign of maturity and growth.
Yes, exactly. So if you happen to know your mom's dad, and if he was very, very bald, and you start testosterone, you're probably going to lose your hair, right? And that's that's a genetic piece. Some of the other stuff that matters is what medications we're using and things like that. So, and I say that kind of almost verbatim in the consent that I'm doing with folks. I'm like, I don't know what's going to happen. And for some people, that's really exciting. Sometimes it's like you're opening a present little by little and you're figuring out what you're going to get. And for some people, it's incredibly anxiety provoking, especially if someone's goal is to pass, right? If somebody says, I want to be stealth and I want to pass, that in between time feels very, very stressful. So, I let folks know that what we know on average, right, is that most trans femme people can get about like a B or a C cup from medications alone. And if they want more breast size, then oftentimes that involves some sort of surgical intervention. Hair on the face especially takes a really long time. So people start getting hair like on their bellies and their backs and their butts and their chest, and their beard can look really sparse. And it can take like 3 to 5 years for people's facial hair to really kind of come in. And all that stuff that people used to tell you about, like, if you shave, it's just going to make your beard more coarse. Like none of that is true. What makes hair grow is time and the hair follicles and those little hair follicles getting changed by testosterone. And, I am fortunate to be able to spend time with folks, and we check in and we adjust things if we're going along and that people aren't feeling like they're getting the results that they need. We adjust as best we can.
Right. And so would you say you adjust the opposite too? Like if people feel like it's moving too fast, are they able to slow down, for lack of better terms?
Absolutely. Yeah, absolutely. And sometimes, and we can do that for all sorts of reasons. Whether somebody is not safe where they're living, maybe they feel like things are moving too quickly and their voice is really dropping and they're getting clocked in public as a trans or non-binary person. Sometimes it's because they're just still figuring it out, and none of that makes them not trans enough. And I have folks that have stopped and started based on where they were in their lives and what they needed and their access to medications. The other thing that I think is really important is that if you're gonna start this journey of medications, be really knowledgeable as you can be about your family history, because things like heart disease and stroke and hormonally sensitive cancers like breast cancer and prostate cancer, all those things are really important for us to be able to create a regimen that's as safe as it can be. And also being honest with whoever is prescribing you about your own medical history, that also helps us keep folks safe.
Is there any, if you are somebody who's interested in starting HRT and you've kind of gone through that emotional part and you know that this is the right choice for you, are there any, like with surgery, there's certain surgeons who, you have to be a certain BMI or they won't work with you, or then there's some surgeons who specialize in that, in that. So is there any precautions that a trans or non-binary or gender diverse person might need to take if they want to make sure they're, for lack of a better word, like ready physically in their body for hormones?
Yeah. So, I approach a lot of these things from a harm reduction standpoint, right? I think probably one of the most important things that anyone can do for their health is quitting smoking. Smoking is really bad for your heart, bad for your lungs. It significantly increases your risk of having a blood clot somewhere where it's not supposed to be, like in your lung or your leg or your brain, which is a stroke. So quitting smoking is one of the most important things you can do for your health, hands down. That being said, in my own practice, because I have a really harm reductive approach, I have very few hard stops, very few things that would cause me to say to a patient, you are not a candidate for medications. Because I feel like I've been doing this long enough that we can find ways to help people get the hormones that they need and also, again, keep them as safe as we can. I think other things to know about it and talk to your clinical team about is the other medications that you're on, right? So there are some blood pressure medications that you cannot take with Spiro. And there are some anti-seizure medications that will become less effective if we start estrogen. And so really knowing your medications, and patients don't have to know that, right? Like I don't expect people to come to the table and say, well, I know that I'm on such and such anti-epileptic drug, and this is what I want to do. But I need to know what I'm working with, and then I'll figure out what's safe. So, and also like being healthy is not a moral imperative. And that sounds kind of weird coming from a doctor, but you don't owe anybody your good health. And some people have a lot of barriers to health, right? If you are poor and uninsured and homeless, like you're just not going to be able to access the gym in the same way, right? Or fresh fruits and vegetables in the same way. And that doesn't mean that those folks aren't entitled to gender care. So I would say you're worthwhile people, and you should be here, and you deserve to be healthy and well cared for. And so whatever you can do to care for your body will serve you in the long run. But really, I think, doing all this stuff that people always tell you to do, right? Like move your body in a way that's meaningful for you. You don't have to go run a triathlon, but if you can get out and walk around the block and get some fresh air, that counts if that gives you joy. Eating in a way that nourishes your body, if you can. Those are, and, working with whoever is your primary care doctor on getting whatever medical issues are also in play under as best control as you can, right? Like if you have diabetes, working to make sure that your blood sugars are as under control as you're able, same with blood pressure or things like that. So taking care of yourself as a holistic person is really important.
Love that. What misconceptions about HRT do you find yourself addressing most often?
That's such a great question. I think the a lot of misconceptions come from I hear a lot of concerns from parents specifically about young people. And I don't want to go too far into the weeds with pediatric gender care because that's not a huge part of my practice, but I would say right now, especially, misinformation and disinformation is at a frenzy. And so it can be really hard to know what's accurate and what's not. So some misconceptions I hear are, if I'm a trans femme person and I start estrogen, that I'll start having monthly cycles, like without bleeding. And I don't think I think there are ways to create a hormone regimen that is cyclical, but that's not automatically going to happen. Sometimes I hear that, what other misconceptions have I heard? We used to talk a lot about irreversible changes. So changes that will never be reversible. And I've started really shifting my language around that and calling it harder to reverse and easier to reverse, mainly because there are very few things that are completely irreversible. So for example, we used to say, if you start testosterone, once that voice box enlarges and your voice drops, that's irreversible. And while it's true that your voice doesn't go back if you stop testosterone, there are things that we can do, as you know, after your voice training, Fireside, that there are things that we can do both through speech therapy to help pitch the voice up. There are also some surgeries that you can do to actually shorten the vocal folds that also pitches the voice up. All those things require time and money, and some of them are very invasive. But having your voice deepen isn't truly irreversible. The thing that I consider almost completely irreversible is bottom growth. So if you start testosterone and you get a lot of bottom growth or clitoral growth, that doesn't go back if you stop testosterone. And also, I don't know of really any surgeons in this country that are doing things to make clitorises smaller, unless you're an intersex kid, and then then the bar is open for surgery. But yeah, so I think in general, I think that whole idea of completely irreversible changes is a little bit of a misconception.
Yeah, that makes sense. So one thing that there's a lot of in-person doctors like yourself, which is amazing, but there's also a lot of people who don't have access to in-person doctors. So they've been utilizing telehealth in replace of that. Is there anything, and this is kind of related, I guess, to telehealth, but also to in-person, is there anything that we, should be asking our doctors? And I think I just mentioned the telehealth because I do think that people tend to not engage as much because it is through a computer or a phone or something. So is there something that we should be asking our doctors to make sure that they're a good fit?
Yeah. Sometimes people don't even have that privilege of trying to find someone who's a good fit, and they just have to take who's available to them. But
very good.
But I would say even before you get into the either virtual exam space or the real, or the in real person, in real life exam space, is word of mouth. If you know folks who have had good experiences with clinicians, then I would feel more comfortable seeing them. And obviously not every person has a good experience with every single doctor, right? But if you know that person is trans-affirming, that's a huge step in the right direction. I think asking what haven't I asked you that you think is important for me to know can be really powerful. When I meet a new primary care patient, if I have time, I really like asking people, how they want their relationship with their doctor to go. And people usually have never been asked that before. And so it takes people a little bit by surprise. But maybe asking yourself that question before getting to the appointment, like what's do I need and want from my relationship with my doctor? And if it's, for example, I need to know that if I send you a portal message that you'll respond within 24 hours, then ask for that. And if they can't do that, then at least you know that you either need to go somewhere else or that expectation won't be met. So kind of having an idea of what your needs are going into it can be really helpful. I think it's fair also to ask, do you have experience doing this? And if not, how are you gonna increase your knowledge? Because you as a patient should not have to educate them. There are a few online services I think are amazing, right? Like the Queer Doc group is fantastic. Plume, I think, is also quite good. And if you, even if it's online, sometimes you can build a relationship with folks that feels more authentic, even though it's 2D. I don't know if that answered. Did I answer your question? I kind of went off on a tangent.
No, I mean, I think you did. I think you did. Everybody who's here, we're going to get to questions in just a few minutes. So if you have any questions, you can drop them in that Q&A. But I wanted to ask you, Dr. Rani, can be a tough time in this moment. A lot of uncertainties some people may be feeling as we move into 2025. But if we stay on a positive note, what are you actually like the most excited about as, HRT has become more accessible, people know more about it? I'm sure your practice has changed drastically from 10 years ago. So what are you actually excited about in the world of, HRT?
That's such a great question. So I just went to the WPATH conference a couple months ago, which is the World Professional Association of Transgender Health. And I was feeling a little jaded about it. Like maybe I wasn't going to learn a lot, but I learned a ton. And I'm really excited that there's actual research being done, right? For a long time, we were doing this work without a net, and we were doing this work without any sort of evidence or data. And we were just going based on kind of consensus opinion. And now we're getting more and more actual data and research about, for example, can we get the same blood levels of estrogen using injections and using patches? And now actually somebody's studying that. And so we can start advising folks based on the data that we have. There's a lot of really cool data coming out of Scandinavia around being neurodivergent and trans. And that I think that's a new area of research that is going to explode over the next 5 to 10 years. But I also kind of nerd out about identities. And so maybe that I'm particularly excited about that. And, I'm excited for the young folks coming up. Like when I was applying for residency, like I said, there were only a few places in the country where you could learn it. And now medical students that are coming to interview for residency positions, it's almost like a litmus test for them, right? Like if they can't learn how to do gender-affirming care, that could be a game changer for them. That could be a hard stop and say, I'm not going to apply to your program because I need to learn how to do this. So I'm really excited about the young folks that are coming up and demanding this training and demanding this knowledge.
That's cool. That's exciting to hear also as somebody who just celebrated their 15 years on T. And, finding a doctor was very difficult. So much appreciate all of that. And so before we begin questions, if you do feel inspired by today's conversation, we do encourage you to make a donation to Point of Pride. Your support allows us to continue providing free gender-affirming services like HRT access to trans individuals in need. Donations can be made at the link Tyler just dropped. Thank you. Or you can text the word trans futures to, you know this, Dr. Ronnie, 44321. Every contribution makes a difference. So now on to questions. So I have my questions pulled up over here. So if you see me looking over here, I'm just looking at questions. So as a reminder, you can drop questions into the chat in the Q&A. You can also hit the thumbs up button if you want to answer, kind of vote up a question. So I'm going to go with this very first question we have for you. So Dr. Ronnie, I am currently receiving hormone treatment from my PCP that was carried over from Planned Parenthood. I think the dose may be too low for my size. How do I determine what is the correct dosage? I'm on
spironolactone. Mm-hmm.
Yes, and estradiol.
Yeah.
Dial?
Estradiol. Mm-hmm.
Estradiol. Okay.
Yes. So I'm going to just like remind us all of that disclaimer at the beginning. I am a doctor. I am not your doctor. But that being said, let's first give a shout out to Planned Parenthood, because Planned Parenthood all over the country is providing gender affirming care to folks who are uninsured and who need it. So thank you, Planned Parenthood. So the dose based on body size, I think we use body size a lot to talk about birth control, particularly, and efficacy in preventing pregnancy. So there are some birth controls that become less effective with a bigger body size. One of the ways that I determine whether or not a dose is working for a patient is talking to the patient first, right? Like hearing how it's going, hearing like what changes are they noticing that are welcome? Are there any changes that are happening that are unwelcome? Like, is spironolactone completely destroying your erectile function? And that's actually something that you would like to maintain. And I do monitoring labs with some regularity. So when if we consider day 0, the day that we start medication, I'm checking labs every 3 months for that first year. It's pretty busy. So I would say I am not married to the numbers, and I encourage people also not to get married to whatever the numbers are for their blood draw, but it helps guide us, right? It helps tell us if we're trying to suppress testosterone and increase estrogen, what is that balance? And could we work more on suppressing testosterone so that you could feel like your estrogen was having more of an effect? And so there are also sometimes changing the way that you get estrogen into your body can make a huge difference. Like if you've been on pills for a long time and you feel like you've kind of plateaued, sometimes switching to either patches or injections can actually get you back into that pattern of changing. So I would say determining the correct dose is based on you and how you're feeling and whether or not your goals are being achieved, and then also blood levels.
When you say goals being achieved, I think like we're also caveating that with like, you want like I always go back to a beard as a trans man myself. Like if you want a beard, you do need some time, right? So your goals might take time to get to your goals, but as long as you're on the trajectory, right?
Right. Exactly.
Awesome.
Yeah. And sometimes people have goals that are really vague, right? Sometimes people have goals that are like, I just want to feel better in my body. And maybe they will be on a dose of hormones that make their brain feel really good, right? And make it finally they feel like their brain is functioning right. They feel better in their bodies and in their minds. And maybe nobody on the street would know that they're taking any medication, or maybe even somebody that they love wouldn't know necessarily, but they feel really affirmed and better. And sometimes people have really specific goals, like you're talking about, like I want to be able to have like an evil villain mustache that I can twirl. But so sometimes we have to readjust our expectations, but we try to move as much as we can towards those embodiment goals.
Thank you. So our next question, this kind of goes into what you were just saying about if you were taking, a pill, maybe you're going to start a patch of some kind. Anonymous attendee asks, what are the benefits and drawbacks of gel versus shot for testosterone? And I'm actually curious because like I've always heard that, oh, if you take the gel, it's slower. If you do intramuscular, it's faster. If you do sub-Q, it's in the middle. Like, and I'm always just like, I don't know I don't know. Do you know?
So I would say what we do know about injections alone, right? If you're comparing intramuscular and subcutaneous injections, they are equal. So you get the same serum levels of testosterone. You have the same outcomes. So I'm almost exclusively recommending subcutaneous, mainly because it's way less stressful for people. And we could use a smaller needle. And that, I think sometimes that motion of having to like get a needle into your muscle can be really stressful for people. So subcutaneous tends to be a little bit of a smaller hurdle to get over, and sometimes people are like, oh, I had to do insulin injections for my cat. Is it basically the same? And it's exactly the same, right? So sometimes that feels like something they can really get their arms around. And I would say what I hear from folks anecdotally is that they feel like shots work faster. Faster isn't always necessarily better. And I can get people wherever they want to be with whatever, right? If I feel really confident that we would be able to find a regimen with topical gels that achieve someone's embodiment goals. It might take a little bit longer, but I'll get them there. I think the big things to know about gel is that you could unintentionally share it with somebody. So you have to be really mindful about skin to skin contact. And you need to give yourself enough time to let that gel soak in. I usually tell people about 3 hours. So if you're going to be having skin to skin contact with anybody, sexual partners, kids, pets, whatever, you need to either have it covered with an article of clothing or hop in the shower and rinse off. Some folks are, I think there was one slightly underpowered study that looked at people who were doing laundry of someone who was using topical testosterone and that they got a little bit of exposure that way by just like picking up the laundry. So if you want to be extra cautious and kind, I would say maybe do your own laundry. And then the other thing to know about gel is that there is gel that you can get at like Walgreens, for example, like a standard pharmaceutical gel. And then there's also compounding pharmacies. And a compounding pharmacy is basically like potions class, right? They'll make you whatever you want. And so if somebody is non-binary and they're like, I don't want to masculinize a ton, or it's really important to me that I go really slow, we can actually use a compounding pharmacy to make something that's a little bit less potent than what you can get at Walgreens. So we have a lot of like that dial to adjust the dose is really finely tuned if we're using topical or compounded products, because I get to decide what the concentration is as opposed to the pharmaceutical company who decides what the concentration is. And similarly with injections, we only have 1 or 2 concentrations of that oil. And at some point there's just like a minimum that is practical to draw up, right? You can't draw up a drop of testosterone. It's just not practical. And so there's kind of a bottom limit of what the dose can be with injectables. And we can go below that minimum if we're using gel.
Awesome. So we're going to answer just a few more here as we're coming to time. Are there any hormones that work better than Can you help me?
Yes. Well, you could even just call it Spyro.
Okay, Spyro.
Yeah,
That
Spyro
reminds
and
me of the
estradiol.
game from PlayStation. Spyro and estradiol.
So I would say yes and no. Everybody's body is really different. Spironolactone is a very effective T blocker. It works very quickly. It works very well. The way I think about hormones as they're like keys looking for a lock, right? And so your hormone receptor is like the lock and the hormone is the key, and it's trying to get into the lock to do its job. And spironolactone blocks that lock, so the key can't get in. So, but that lock is all over your body. It's not just in one place. And so you also have hormone receptors in your breast tissue. And so there's some people are a little bit concerned is that if you start with spironolactone, that you could be blocking some of those estrogen receptors in the breast tissue, and it may inhibit breast growth. I don't know if that's actually true. I think physiologically it makes a lot of sense to me. So if someone has an embodiment goal of, I really want to maximize my breast growth, maybe don't start with spironolactone. Maybe just start with estrogen, for example. And then there's progesterone, which is another sex steroid. And I think the data is pretty mixed on progesterone about whether or not it's necessary. I do a lot of shared decision making with folks. And if it's something that is important to them, I'm happy to prescribe it. I usually just tell folks the main risk is that it can make you very sleepy. And so take it at night. And I have a couple times seen it make depression way, way worse. And so we just have an agreement that if your depression is getting really bad, that we stop it, because the most beautiful breasts in the world are not worth your life, right? And so I would say there are lots of combinations of medications besides spironolactone and estradiol that you could potentially look at.
Ooh. Great. So, last question here. Sorry to everyone. It would be impossible to get to everyone's questions, but I thank you all for asking them. I know you talked a little bit about this, but it was brought up again. So I think that maybe we could talk a little even more. What's the best way to address the transition goals question when starting HRT? And maybe you don't exactly know yet beyond not this.
Yeah. What a great way to phrase that. And I would say it's an iterative process, right? So you might start on something because you're like, I don't know what I want. It's just certainly not this. And then as you start, things clarify, right? Because I've had a lot of people say, I don't know, maybe it's not right for me. And we start something and they're like, oh yeah, this is it. And I want to keep going. I want more of this. And sometimes that doesn't happen, and that's okay too. And we have other work to do. There's this really wonderful, I'm sorry, I'm looking away from you because there's a, I can't remember this person's name. There's somebody who does these great videos about gender therapy. I'm not gonna be able to find them now.
Well, what you can do is you can email me.
I'll do that.
We're gonna have a replay of this, and I'll put all of your links as well in there.
I love it.
Yeah. So.
And if I type answers to these questions, will those be able to go to attendees or no?
I don't know. You can experiment.
Okay.
Okay. Cool.
Maybe I'll just copy and paste them all and send them to you in a document.
Yeah, I love that. I love that. Well, all in all, thank you, Dr. Ronnie, for this awesome event. Thank you to everyone who asked questions. And also thank you all for your attendance today. If you'd like to stay connected, I will drop Dr. Ronnie's information in the chat. Or actually, I'm lying. Tyler will drop that in the chat. But as I just mentioned, we'll also have this event on replay on our blog at the end of Trans Awareness Week, which will also include Dr. Ronnie's information and all the resources mentioned here today. I do encourage you all to stay connected with Point of Pride by following us on social media at pointofpride.org and subscribe to our newsletter to get information about all of our programs and when they're open for applications. Remember, if you'd like to support our work, donations can be made at the link in the chat or by texting Trans Futures to 44321. Before you all leave, I want to remind you of another program continuing actually in just a half of an hour. We will be having a breast augmentation and orchiectomy. Am I pronouncing that correct, Dr. Ronnie?
It's actually orchiectomy.
Orchiectomy.
It's
Oh,
like
thank
an
goodness.
orchid. Yeah.
Okay, because I was about to go into that with the wrong words off the get. So thank you. For our orchiectomy, that'll be starting in just a half hour. You can still sign up. Just go to our blog or our Instagram. And if you want to see all of our programming for the week, again, you can check out our socials and our blog at pointofpride.org. Mel, thank you so much for being here, putting in that extra work. Tyler, thank you as well. And as always, Dr. Ronnie, it's a pleasure to see you. I hope everyone has a fantastic Transgender Awareness Week. Bye.
Thanks so much.
So same man. How do I say your full name?
Jeff Main.
Why is it Sam? I've known you for a whole year.
You called me Sam last year.
I did.
And everyone was like, who's Sam?
I don't know why. You strike me as the same, apparently. I'm here with one of the co-founders of Point of Pride, Jeff Main. Hi, buddy.
Hey, how are you? Good to see you again.
Yeah, I know. It's like we haven't seen each other since maybe like 45 minutes ago. So, okay, let's jump in. How did you get involved with Point of Pride? How did you jump in here?
Yeah, so I had been working at a queer organization on Long Island. So it was a small local community center nonprofit. And Aiden and Jenny Lee, also his wife, also worked there. And so we just became quick friends. And at the time, he was working on 0.5cc, which was the clothing company he had designed to be able to afford his own top surgery and then pay that forward to folks in the community. And he was like, hey, Jeff, I heard you build websites. Would you like to build a website for me? And I was like, sure. I thought it was going to be this, one-off project. And again, we became fast friends. I got more and more involved in the business. We were really partners, and we realized that it was the least profitable business ever.
Yeah.
As I'm sure he shared, all profits went right back into the hands of people that needed it. And we said, this shouldn't be a for-profit t-shirt company or apparel company. It should be a nonprofit organization that really hones in on access to healthcare.
Were you doing, what was your involvement within the trans community? What were you doing anything prior, or was this
Yeah, so I had goals that I wanted to do something sort of similar to what the journalist Aaron Reed was doing at the time.
Yeah.
Creating some sort of a searchable database or directory of resources for the community. So I was working on this side project, and I was active in other volunteer groups and spaces, but nothing like this. So as things were, developing, I was getting very excited about this being that opportunity to be able to give back.
I find it so fascinating that this is always the journey of a trans activist. It's always I'm trying to find a resource that it should exist.
Right.
Doesn't exist. That's almost always the path that we find ourselves in.
Yeah, and then we got to go out and build it ourselves.
Yeah,
right?
Because there's so much, again, not having a lot of elders that are still around within our community. Yeah. We've had to kind of make the infrastructure that I wish a lot of us would have had when we were coming out.
Yeah.
So,
absolutely.
yeah. So you get involved with Point of Pride. At what point did you think, oh, yeah, we got something here. This actually might really start working?
Yeah. I mean, I had that feeling really early on, even when we were a small, I say small but mighty team, we were all volunteers up until 2023. So we founded in 2016. Those first years were myself and other dedicated folks working nights and weekends. We had so much passion, so much lived experience. I myself had issues accessing healthcare, even though I'm white, mask, cis-passing in New York City. And I was running into barriers. And so I was really galvanized about wanting to help people that had so many more obstacles than I did. And so I felt like we had a real special team from the get-go. And in fact, our board treasurer, Rob, has been with us since day one. Many of our board members have been there for, 5+ years. And so, yeah, I think I knew we had something special early on.
It is such being in a room with all trans people talking about this stuff is every single year. I feel like it's a reunion that we come in here, and we're all trans. We're all fighting the good fight. We're all like every single one of us has a story about being mistreated medically. Yeah. Every single one of us has a story about not being able to access that care. Right. Yeah. So like for you, when you were first starting to do this, like, do you remember the first person that you guys were able to help with surgeries?
Yes. Yeah. So, I mean, Aiden might have shared this, right? The first grant award that we gave out was like less than $1,000,
Wow.
And so we were ecstatic. That felt so major, right? And to the person on the other end of that check, like it was major. It was the difference that little oomph that they needed financially to be able to get surgery. So yeah, I mean, it sounds cliche, but I'm touched whenever I look at any of our recipient profiles and I see the people we're serving, and I feel so grateful that we can serve hundreds of people, get them grants towards surgery.
Have you met many people in person or anyone in person that you've helped yet?
I've met a couple. Yeah.
Okay.
So
it's a wild experience.
Yes. Yeah.
This year was the first time that's happened. Right, I've ran into people,
Mm-hmm.
like I ran into a few when I was on book tour, but being in presence with someone that you've been able to directly impact in that way, that's like a wild feeling.
Yeah. So a couple years ago, pre-COVID, we were at the Philly Trans Wellness Conference, and one of our surgery fund recipients was just there in attendance, and her name is Charissa. And it was so wonderful to meet her because the procedure that she needed was vocal feminization surgery. And I remember that in her application, she was talking about how she loves to sing and how she wants to connect with people, right, through language. And she felt like she was literally silenced. And so when she came up to us and she was talking to us with her feminine voice post-surgery, like it just felt like such a special moment that we could like witness her and witness her joy and hear her voice. And it was just, that was probably one of the best moments I've had doing this work.
Yeah, it's an interesting perspective for us to have.
Yeah.
Right? Like, being so public, even for me, like sometimes I'm looking at numbers.
Yeah.
And I'm seeing numbers constantly, like, 3 out of 4 people that you guys have been able to help have been people who have been experiencing housing insecurity. Like these numbers that I say constantly on the live stream every year, but then turning it into like a person who have been able to, I remember meeting someone down in Texas that I've helped get binders. I remember meeting people in, I think it was Philadelphia. But I met people kind of everywhere.
Yeah.
Every once in a while we'll find people at a book signing that wants to say hi. And it is like, there is like, I don't want to say spiritual, but it kind of feels like you're very connected.
Yeah.
And then there's the other aspect of how many people who donate.
Yeah.
You know what I mean? Like we've had 100,000 donations in the last 2 years alone. I'm saying this right?
Yeah.
I'm like, you're the fact daddy.
Right. No, yeah. Last year we had well over 40. The year prior was nearly 60. Yeah, we've had 1,000 donors, right? I mean, and I think that grassroots power, like when things feel really tough, right? I think about the hope that is found when community comes together, and something I reflect on often is trans people aren't just resilient, we're really empathetic, and we care about each other. And just goes full circle to what we were saying about like, we want to create those resources for the community that don't exist. We want to help one another thrive.
Yeah. I think that it is a matter of just bringing the right gears together to make the clock work, like it's all there. It's all the gears are right there. We just have to kind of click it all together.
You need a trans handyman.
Oh, that was good. You brought it back around.
Put it all together.
Way to go, Sam. No. But all of that being said, like, so you get involved, you make it happen. There was a point where you're like, this is too much. Like, this is just so stressful. And this is such a big responsibility. I mean, it's a huge responsibility.
Yeah, I mean, I don't know that I ever thought it's too much, but I say something. So every grant making cycle, I say something. It's a bit of a cliche, and my staff makes fun of me, that this work is the hardest and the most rewarding thing we do. Because it is, like you were saying, every application we get, there is a real person on the other end that has real needs and is feeling really hopeful and that they'll be chosen for funding. We have finite resources, and so to have to make those decisions about who gets grants and who doesn't, it's just so hard. But I reflect on who we are able to help, and I think I get then more galvanized of like, we got to get out, we got to get more resources, we've got to help more people year over year.
How did you guys get to the point of like, this is how we're going to choose applicants?
Yeah, so great question, and thank you for asking. So in the early days, all recipients were chosen by our board of directors. We're an all trans team, we were all volunteers, and we read each and every application. In 2016, I read 800 applications, and it broke my brain.
Wow.
And
that's also a lot of like, we know a lot of these stories are heavy. These are heavy stories to intake. And then you're making the decision because you got a finite amount of money.
Yeah, and we had far less resources then. And so now what the process looks like is that every application gets reviewed by our grant-making fellows. And so these are specially trained volunteers, trans-identified, that donate their time and their care to reading these applications. We have processes in place to try to keep everything as equitable as possible, and also protect the privacy and security of the people that we're reviewing. So everyone goes through this standardized process, and we then our board of directors reviews scores, and we make decisions from there. Each step is just so hard as we whittle down an applicant pool to who our recipients will be.
From the moment that the application closes to the moment that they're chosen, how long is that?
4 to 6 weeks. Wow. Yeah. And it's emotionally taxing work, but we're able to make those decisions so quickly because of the dozens and dozens of volunteers that we have that support this work.
Here's a fundamental question. Are there things that give people an advantage to be able to get the money? Like, is it like, first come, first serve kind of mentality ever? Or is it just like, it's like whoever applied and trying to weigh what those aspects of their lives are?
Yeah, so great question. So with our garment donation programs, those are first come, first serve wait lists. We accept everybody. So we're working really hard to get more support packages out so people don't have to wait so long. And we're sending out hundreds of packages a month, which is excellent. With our financial aid programs, each program is a little bit different. There are no advantages if you can write really well, right? Or just like there's no disadvantages if your English is a second language or things like that. We try to standardize the process. What our reviewers are looking for is financial challenges, right? So can you demonstrate the challenges that have gotten in your way, whether it has to do with insurance or employment or any of these factors? What are the financial barriers in your way? And then some of our programs have specialized funding priorities. So our electrolysis support fund primarily seeks to help trans femmes of color, Black trans women who are seeking hair removal on the face and neck. Because for that program, the goal is not just trans joy, it's also safety. We want to make sure that our recipients, can have their beard removed so that they can access employment opportunities, they can get around feeling safer just in public. So in that way, we're tailoring what we're looking for.
Yeah, that it's such a. Last year we were talking about this on the live about how their electrolysis especially is such an interesting one because I think a lot of people don't understand the importance of it, especially with surgeries, right? Because a lot of surgeries will also require you to have some type of electrolysis or hair removal beforehand, right? And I think that it's such all of these aspects of transition, from the Thrive Fund to HRT to electrolysis, all of them are really important in their own ways.
Yeah.
And it's such a huge responsibility to award that.
Yeah.
So what's the average amount of money that comes from the electrolysis fund?
So, like our grant.
Yeah,
award,
yeah. Like, what does that look like per person?
Right. So our recipients get $2,000. And because we know that everyone's hair removal needs are different, we have built-in opportunities for our recipients to apply for what we call renewal awards. So folks can receive $2,000, $4,000, $6,000 so that they can get their needs met.
Yeah, that's great. Yeah, we've talked about this before, of like not having that opportunity prior to be able to do that, and now you have the chance to continue to help them.
Yeah. And thanks to the donors that make this possible, we've been able to do that with the HRT Access Fund as well, so that folks, when they reach the end of their grant period of a year, they can renew for additional care, because they're ongoing services folks need.
What's the largest donation you've ever gotten?
The largest donation?
Yeah.
So, I mean, we are unique in that the support of individuals funds our mission. The vast majority of our revenue comes from folks that are chipping in $45 or less.
Yeah.
We are fortunate that we have received, some funds from different philanthropy groups. So the largest gift is about $25,000.
Yeah, I've told this to other people that like other fundraisers do not have this. Like this is not to have this much individual donors and not have any corporate. I don't think you have any corporate, do you?
We've partnered with like some small like corporate teams, PRGs where we'll.
But no Fortune 500.
No.
Yeah,
and no, Yeah.
Yeah, and that's
an investor coming down. Right?
And I don't think we probably never will. We're always such a very touchy subject matter, and a lot of corporations, especially right now, don't want to be even seen in a photo with us. So it's so important that we can come together for this, because no one else, as I've said many, many times, no one is coming. Yeah. We can be, yelling all we want, but we're the only thing stopping them from us is us. Yeah. So it really is about community. Yeah. So now that you've been able to expand it and everything, what is the next steps for all of you? What is their goals now?
Well, we're obviously keeping a really close eye on politics, on this current political moment, on legislation, not just on the federal level, but on the state level, since we are a national nonprofit. And so what we're trying to do is be as proactive as we can, and also think about changes and expansions to our existing programs so that they're more comprehensive if or when folks run into trouble accessing care. So I could give you an example.
No, you're doing great. I mean, Aiden literally looked at me with deer in headlights like, don't know. I'm the visionary, not the fact daddy.
He's the donation daddy.
Yeah, he's a donation daddy. Yeah. And I'm the donation mommy. But give me an example, friend.
Yeah, so like our HRT Access Fund, right? We anticipate that there might be major changes that impact telehealth, telemedicine, Medicare, Medicaid, that would make it really tricky for trans people, but for many other people, right?
Yeah.
To access care. There might be requirements similar to what's happening in Florida, where folks have to go to a medical doctor and they have to travel really far to an in-person clinic and all of that. We're getting ready to put more people on buses, on trains, planes, automobiles, so that they're able to access that care.
Yeah, because I was talking to Aiden about this, but it's changing every week.
Yeah.
Well, I mean, more than that. It's changing almost every hour. It's like something will just, and there's so many of these anti-trans bills that it is really hard to always catch every single one. Like there was 4 in Madison within 1 week. I missed one. I got the other 3, but I completely missed the other one because it just snuck right through. And that it's really hard. It's very hard to keep. So how are you keeping a track of all of this? Like, is there someone on the team that is generally like, oh, there's another one. We can't do this anymore in Arkansas,
Yeah, it's hard. And I'll say, in addition to just the information overload, it's also mentally taxing and draining. We are a trans team. Our staff are trans identified, or, so to have to process all of this, it feels like you're playing a game of whack-a-mole.
I call it whack-a-troll.
That's a good one. Our director of programs, Tyler, is incredible. So he does have like a very keen pulse on what's going on and is tracking things. Aaron Reed, the journalist I mentioned earlier, is doing incredible work. There's a couple of other organizations that are really tracking and mobilizing. So we're in close contact with them. We try to network with, local ACLU chapters, Planned Parenthood, just to resource share.
If I'm donation mommy, Aaron is fact mommy.
Yes.
Yeah, Aaron knows so much. I was at a lunch with Zoe at one point, and Zoe just like text Aaron to get information, and like boom, came right out. Like no one's business. Yeah. And that's the thing. We're so keyed in. We're so like connected. The ones who are doing the work are like, we're maxed out. People will ask me to talk about this subject matter or this subject matter, and I've been very steadfast of like, I'm going to focus on Wisconsin politics, and I'm going to focus on gender-affirming care, and I'm going to, when I need to, talk about it on a global scale or national scale, but it gets to be a point where it's so much for me and it's so much for my audience. I don't want to like lose them. You know what I mean? Like, it's like, I got to make sure I still attract more people. It's such a double-edged sword. Do you ever feel like you're always walking this line of like trying to get more help, but then always feeling like maybe you're asking too much?
Yeah. And I think that, like even what you just said about trying to focus in on what you can focus in, like what you have the capacity to absorb and then like speak out against, right? I think that's so important. And a lot of people will write to us and be like, what can I do, in my local communities or for the trans community? And I think it goes back to identifying, like you said, where can I show up? What does that look like? How do I protect my peace while I do it?
I think it's all our jobs to show up, right? Like if we're already doing it and we already can, we need to show up. And I think that's the thing. Like if I'm the only influencer that's speaking up on this stuff, right? I'm not. But like if I was, that's more of the issue than being able to talk about every single thing. Every single person, regardless of how many followers we have, should be talking about this and bringing up the hard subjects, because it is very much a crisis right now. Like as we're recording this right now, 821 anti-trans bills. That's an insane number.
It's wild. And it's an escalation that, has built on past years and is going to continue.
I remember when it was like 528, the first year that we did this together in 2023. It was like 528. I remember looking at Jory and be like, it's just an astronomical number. I cannot, like, by the end of this year, that number might be a way higher. It's such a wild ride. Yeah.
But, trans people show up, our allies show up. And
we always do.
We're fighting those bills. And, I think there's a lot of power when we come together.
I agree. And that's what this all is, collective action, as you have said so many times. So thank you. So wonderful, Jeff. I appreciate you so much. You didn't think I knew your name, did you?
I was waiting for Sam. I was.
I thought that bit has run its course. I don't want to be a jerk, But anyways, thank you so much for all the work that you do, for coming on and talking to me, and for being here this year. It's like a little mini reunion every time.
It is a family reunion. I feel like I was just here, right? I don't know where time goes, but But I really do want to say thank you to you. I mean, you're a powerhouse, and the donors that make this possible, this event, it has completely transformed the way we're able to fulfill our mission. So I just want to express that gratitude. I
just feel like all I am is a really loud spotlight, and I like, you guys have done all the work. The audience was so much ready to do it. My staff wanted to do it. You know what I mean? All I had to do was point a light at it, and boom, it happened. I didn't really have to do a whole lot. I mean, the 30-hour live stream is a lot. I'm not going to lie. That's a lot. Doing that part is a lot. Yeah. But like, doing the videos and stuff, it does take a mental toll. But at the same time, it's nothing compared to having to read 800 plus, entries and more now, like it's nothing compared to that.
I'm so happy though that you were able to meet some of the recipients whose lives you've touched, through this work, because
that was one of the coolest things I've ever done.
Yeah. I mean, you've touched so many people, and then, I think about their partners, their children, their family, their friends, like that now can have a deeper relationship with someone because they're more fully themselves.
Yeah.
Like, it's this ripple effect that's really beautiful, and I hope you feel that.
Yeah, I do. I definitely do when I'm in the room with them.
Yeah.
Like that's a really wild feeling to like sit next to someone that you've had that kind of direct impact, to sit in the same couch as that person, even if it's a binder. I mean, it's still like a wild experience to be like, able to be that person who helped them access that, I don't know what the percentage is of how many more people you're able to help now, like since the work that we've been doing. Do you know that percentage?
Well, I mean, I know that last year we awarded more in a single cycle of our surgery fund last year alone than all of the past years combined.
Wow.
Yeah.
That's an insane. Wow.
And I mean, across all of our programs, we've really scaled up tremendously, and it's because of you, and it's because of the donors that, chip in and make this possible.
Yeah. And Jory,
Yeah,
me and Jory, I think that team, man, we're 1-2 punch right there. And being able to do that all, it's kind of a wild trip to where we've been, and I'm really excited to see where we can go in the future. I think that now that we have a goal that feels reasonable with 1 million, and I think doing that every year, that's going to make change in its own right, So hey, thank you so much for being here.
Thank you.
Let's go and raise some money and maybe eat some chicken. One of those two.
Yeah, I'm hungry.
Are you chicken? Are you a chicken guy?
Yeah, I'm a chicken guy.
Yeah, good. I'm a chicken gal. So, all right, let's get going.
At Point of Pride, we know that navigating the healthcare system can be overwhelming, especially when you're trying to access gender-affirming care. Hi, I'm Abby, and my pronouns are she, her. As the care coordinator here at Point of Pride, my job is to make sure every recipient has the support they need to access their grant and get the care that they deserve. I provide a safe and welcoming space where our recipients know they can come to me with any challenges they're facing and trust that I'm here to support them. I have open office hours where I meet recipients one-on-one through video calls, and together we navigate challenges, explore provider options, and address any life obstacles that might be standing in their way of them using their grant. My goal is to offer guidance, support, and a space where they feel seen and heard. Unlike many organizations, we don't just hand out grants and walk away. We provide personalized, ongoing support to help recipients navigate the process every step of the way. Accessibility is really important to us. That's why we create resources like how-to videos, worksheets, and guides to make things as easy as possible. We also recognize that not everyone has access to Wi-Fi, a computer, or a stable living situation. We work around those barriers with creative solutions to make sure no one is left behind. Another very rewarding part of my job is hearing stories of resilience from our recipients and seeing them grow. Let's take a minute to meet some recipients that donors like you have helped. Connex is a 25-year-old trans man and dedicated human rights activist from Malawi who has devoted his life to uplifting his community. After losing his mother and facing homelessness due to rejection from his family because of his transgender identity, Connex remained committed to advocating for transgender and intersex rights across Southern Africa, despite his own personal hardships. Because Malawi has no access to gender-affirming healthcare, Connex made multiple attempts to save money for top surgery abroad, but each time his savings were depleted by unexpected family and financial challenges. Recently, Connex received a fellowship at a well-known prestigious university, offering him his first ever chance to travel to the United States. With support from Point of Pride's 2025 Surgery Fund, he will finally have the access to a life-changing surgery he has fought so hard for, affirming his identity, strengthening his advocacy, and empowering him to continue serving the LGBT community throughout Africa. Meet Summer, a 2025 Surgery Fund recipient and 47-year-old trans woman living in a rural conservative area. After losing her long-term job and facing serious health setbacks, including a partial foot amputation, Summer's dream of gender-affirming surgery fell out of reach. But she never gave up. She worked closely with her doctor, losing 80 pounds and dramatically improving her health, determined to qualify for surgery. Despite her struggles, Summer continued volunteering to help other trans folks navigate their transitions, even when hers felt uncertain. She's currently in the process of scheduling her gender-affirming surgery and looks forward to a future of living confidently and authentically. Andre is a 22-year-old trans man and one of our 2024 Thrive Fund recipients. After losing his job, Andre faced serious financial hardships. Despite this, he managed to legally change his name and gender marker, a huge step towards affirming his identity. However, he didn't have the resources to update other critical documents like his birth certificate and passport, which are essential for his safety, employment, and peace of mind, especially living in a state with increasing anti-trans laws. Thanks to the Thrive Fund, Andre now has updated documents, ensuring he's protected, affirmed, and prepared for the future. For so many trans people, the road to gender-affirming care is full of obstacles like financial barriers, lack of local providers, unsupportive environments, and even laws designated to make it impossible. But no one should have to fight this hard to just be themselves. We at Point of Pride are more than just a grant provider. We're a community that lifts each other up and makes sure no one has to face their journey alone. You can help us continue this life-changing work today on Transgender Day of Visibility. Show your support by making a donation. Text Stardust to 44321. Every dollar goes directly toward affirming care and helping trans folks get the support they deserve. By donating, you're helping us make a difference in the world.
Hello, everyone. Welcome, welcome. Thank you so much for joining us today. My name is Aiden Dowling. My pronouns are he, him, and I'm the co-founder and chief advancement officer here at Point of Pride. We are excited to have you with us for this special conversation, which is part of our Transgender Awareness Week program. And so happy Trans Awareness Week, everyone. This week is all about uplifting trans voices, fostering understanding, and advocating for greater visibility and access to care for transgender and non-binary individuals. We're really grateful to have everyone here as part of this very important dialogue. Before we begin, I do want to introduce those who may not know what Point of Pride is and what we do. So we were founded in 2016. Point of Pride is a trans-led nonprofit organization dedicated to providing life-saving, gender-affirming support to transgender and non-binary individuals around the world. We offer direct services through programs such as our free chest binder and gaff program, which very excited we'll be announcing probably sometime this week that we have just given away our 22,000th garment, which is really exciting. Also our HRT Access Fund, our Electrolysis Support Fund, and are currently open for applications. I will be putting this link in the chat in a minute, our Annual Surgery Fund. Our mission here is to eliminate financial and systemic barriers to care, ensuring that every trans person has access to services they need to live authentically and thrive. So I would like to introduce our co-hosts for today's virtual workshop. So everyone say hi to Ray Hill, pronouns they, them. Ray is a trans non-binary fashion designer and founder of Origami Customs clothing line in Montreal, Canada. It is a line of swimwear and lingerie for folks of all genders, specializing in gender-affirming pieces that fit all bodies and abilities. Origami Customs runs a parallel community program that supports gender affirmation for folks with limited access. This program operates globally through a network of nonprofits like Point of Pride to provide life-changing items to folks facing barriers to intersectional oppressions through a mutual aid framework. So hi, Ray. Welcome, welcome. Awesome. Next up, we have our other co-host, which is Michelle Castro, pronouns she, her. Michelle was born and raised in Southern California. She graduated with a bachelor's in women's and gender studies with a minor in sociology from the California State University in Long Beach. She now resides in Philly, where she works as the Minister for Community Life at Trinity Memorial Church. She is passionate about feminism oh my gosh. She's passionate about feminism. Oh my gosh. I'm so sorry, Michelle. She is passionate about feminism, that's right, and trans rights, and hopes to help other trans people in their journey of transition. In her free time, you can find Michelle reading, binging Netflix, or shopping. So welcome, Michelle and Ray. Thanks, everyone, for being here. I just want to let everyone know that we will be having time for questions at the end of this discussion. So feel free to ask them into the chat or the Q&A box at any time. I will be monitoring and making sure that we get to those questions. Realistically, we might not be able to get to all of them, but we will do our best. So I am going to stop talking and hand it over to Ray.
Thank you so much, Aiden. This is so exciting. I'm so glad that you're all here. As Aiden said, I'm Ray. I use they, them pronouns. I'm the owner of Origami Customs. We've been making gaffs and binders and all sorts of other things for nearly 15 years. So I'm really happy to be sharing my experience with all of you today. So we will be covering today the basics of tucking, the different options that we have on the market. And we'll be talking as well about the difference between gaffs and tape, as well as ways to keep yourself feeling safe, healthy, and confident. Michelle is also here to tell some of the best tips and tricks from years of personal experience, because I'm not a gaff wearer, and but I'll be able to speak from my career designing and making these products over the past 15 years. So one little quick note before we start, I wanted to say that I will be using anatomical terms to describe body parts, but we do honor and respect any words that you choose to identify for yourself. So you might just want to switch that out in your head. Yes, and the website's down in the chat as well. Thank you so much for that, Aiden. So tucking. Tucking is the practice of creating a smooth crotch contour by positioning the genitalia out of sight. There's lots of reasons that people choose to tuck. I'll just name a couple of them, but it is infinite. They might include aesthetics, alleviating gender dysphoria, navigating social spaces, and safety. So tucking is not necessary for femininity, but it's an option for those who are seeking it. When we tuck, the penis is pulled back, and if a person has testicles, they may also be pushed back and moved into the inguinal canal. This is just a very brief overview, and you can find so much more information about specifics online. You will want to start when you're doing this very slowly and listen to your body. This should not be a painful process at all. And while it will feel a little bit uncomfortable at first, the discomfort will slowly alleviate. However, if you have any pain, it means you might be doing something wrong. So back up, listen to your body. But you might find that over time, it's going to get easier with practice. As well, being on hormones for a while due to shrinkage, it might make this an easier process for you. So going a little bit more into some of the reasons why people might choose to tuck. First of all, safety. In spaces where being recognized as trans could lead to violence or discrimination, it would absolutely make sense. We want maybe some more feminized features. As I said, tucking is not a necessity for a trans femme identity. You should only tuck if it makes you feel amazing and affirmed, but babes have bulges too, and that's amazing as well. So a variety of people across the board choose to tuck: trans women, non-binary and gender non-conforming people, cisgender men who perform in drags, cisgender men who experience body dysmorphia. There's lots of different reasons why people are choosing to use a tuck. Some people tuck daily for a sense of safety, a smoother appearance, or better mental well-being, but others just tuck occasionally for special events, maybe if you're going to the pool. Some femme-centered individuals also choose not to tuck at all and have no interest in it, which is incredible. And you don't need to have dysphoria in order to tuck. So I'm going to talk a little bit about the different ways to tuck. There's two main ways to tuck. One is using tape, and one is using what's called a gaff. So I'll start with tape. Using tape on the genitalia offers a very tight tuck without the need for garments. With the taping method, you can't really pee unless you undo and redo the tape every time. So some brands of tucking tape have tape that can be undone and redone a couple of times, which is really helpful, but this is a major thing to keep in mind. There's another method that some people call the X marks the spot method, and we're going to put a link to that later so you can look it up as well. It allows for a little bit more flexibility when you have to go to the bathroom. You can also purchase kits like something called the unclockable kit, which comes with tape, how-to guide, and some safety pads, which might make it a little bit more like user-friendly. Tape works best when you have a shaven area, so this might not be a great option for you if you don't like to shave. Tape also isn't great for long periods of time because it can't often withstand more than 1 or 2 bathroom breaks, and the breaks should be taken often when you're taping. But tape is awesome because it doesn't show under most outfits and might be really, really good for events like performing or swimming. Gaffs, on the other hand, gaffs are a really great everyday option because they can be taken on and off really easily when you're using the restroom. It's kind of like just a plug and play, you know, you're just pulling on a pair of underwear. So they're essentially, if you're not familiar with gaffs, they're a compression underwear. They can come in all different types. There's so many now on the market. There's boy shorts, briefs, cheeky, thong. Depending on the type of gaff, they can also be really, really comfortable. We'll talk a little bit more about that after, but it's really important that you measure yourself before buying. While your size might be similar to your pant size, many gaff brands use slightly different measurements, and it's really, really important that you're getting a really good fit, or you could have some discomfort when you're using a gaff. Also, when you want to take into account if you are on hormones and at what stage. If you're early on, just make sure to take into account that your hips and your butt might change shape over time. So a gaff might not fit you throughout that gender transition, and you might have to end up buying new ones. So gaffs can either be used by themselves as a simple smoothing compression or with a tuck. Gaffs can be worn with or without a tuck. And when you're ready, you just slip on your gaff like normal underwear. You make sure everything's secure, and then you're good to go. They can be a lot faster than options like taping. While some people use regular underwear to tuck and some swimwear, gaffs are specifically made with tucking in mind. So they take into account the compressive nature, the long wear time, and the breathability that's necessary for a safe tuck. Not all gaffs can be worn with or without a tuck. The gaffs that I make are made out of a flexible material so that they also fit really well when you're untucked. But you'll want to make sure that you look for this when you're buying it. You'll want, if you do want to wear it untucked, you want to look for a gaff with a little bit of give in the front, a stretch material that has elasticized edges. So if you plan on wearing it without a tuck, that's going to prevent spillage off to the sides. Gaffs are adjustable throughout the day, and it makes it easier to take a moment to readjust if you're feeling any discomfort. If something feels off, you're going to be able to just pop into a bathroom and readjust in a much more accessible way. Flexible gaffs often are going to also give you more relaxed comfort. You can more easily take them off and take breaks. You know, if you can be home for a few hours and your gaff is feeling uncomfortable, you can just like switch into some sweatpants until you have to go out again, which can be really nice. Gaffs with non-stretch materials can be harder to get a good fit, and often these materials are less breathable. So make sure to look for something with really good airflow. We use a material called power mesh. I just saw this comment. Yes, I realize that I'm going through a lot of material. You will have access to this video afterwards, so absolutely. Okay, so I'm gonna quickly go over a couple different types of gaffs that's gonna help you decide when you're picking these out for the first time, and maybe you've already got some experience with these. So a few pros and cons of the main styles that are on the market. We've got full coverage gaffs. These are amazing if it's your first time using a gaff or tucking in general. We usually advocate for younger folks to try more of a full coverage or like a hipster style. The gusset's a little bit wider and more accommodating, especially to the back where the penis is gonna go, making it a bit more beginner friendly. But a classic is the thong. For us, we sell way more thongs than anything else because they do have a better tuck. People love them because you don't have panty lines, and you can pull up the sides for more vertical compression, so like a tighter tuck. And it's a little bit more adjustable in that way. And the V shape of the thong sides can be really euphoric for some people in emphasizing the roundness of the hips. Another main category is the high waist gaffs. Sometimes they're in the shapewear category, something similar to like what Spanx would do, but like specifically with a gaff in it. So we make a couple of these styles as well. And they're designed to give you a smooth sculpted silhouette. No matter what your gender, these are just going to feel really euphoric in a lot of ways. People often call them shapewear, and Spanx kind of made that famous, but there's tons of new options on the market now. Typically, they're made from a blend of spandex or nylon. They can often focus on areas like the hips or the stomach to give you more of like a full body contour. And they're really, really awesome if you're wearing something like a dress or a high-waisted pants or skirt, because the soft waistband sits at the natural waist and not down on the hips. So it gives a very lovely silhouette. Lastly, one category that we can talk about very briefly is swim gaffs. Some people will use a tight swim bottom as a gaff alternative. The stretch materials do offer some compression if you're in a pinch. Many of these swim styles can help you out, but we and some other brands also create specific swimwear that comes with a built-in compression liner for moderate compression. So you can wear those as a gaff while you're swimming, and you can also wear a normal gaff underneath of those swimwears, because all of our gaffs are swim safe, and those together provide like really amazing coverage if you're wanting to tuck and swim. So next I wanted to talk a little bit about the importance of proper sizing. One of the most important parts of safe tucking is getting a really, really good fit. A too small gaff can cause health issues and long-term damage, and a too large gaff will not compress you properly. So getting a custom fit is optimal, making sure that you're wearing a gaff that fits you perfectly and you can wear for a long period of time, and making sure that materials don't stretch out. We do custom sizing on our gaffs, and I'm sure there's tons of other places where you can get that, but it's something just really important to keep in mind. And if you want help taking your own measurements, we'll put a link later for you to access a guide where you can follow along with some videos to take your own measurements. So lastly, I'm going to go over a few best practices with tucking. These are just some things to keep into consideration, but of course, you know your own body. Listen to any signs that you're getting during tucking and gaffing process or with tape. So tucking should not be painful. Any discomfort may be normal at first, but definitely stop and take a second if you're noticing pain. Begin by tucking for short periods of time and building tolerance. There are some potential health risks that you should keep in mind. Increased temperature in the inguinal canal can impact sperm quality and fertility. So if fertility is something that's on your mind, I would definitely do some more research on that and making sure that you're making the right decisions for you. There's also some risks of skin irritation, infection, what's commonly called jock itch. You can prevent that with taking breaks, with getting materials that have more airflow, and with really simple things like antifungal powder. So also just make sure to wash your gaffs right away after you wear them. It's just like underwear, so just one wear and then that's it. Some warning signs that you would want to get some medical attention are like persistent discomfort, any blood, pain, or signs of infection. That's some more serious stuff. As well, you'll want to make sure that you at least shave or trim the pubic hair a little bit to reduce some discomfort. I mean, obviously that's a personal choice, but some people do find that makes it a little bit easier. If you're using tape, make sure that it's sports or medical tape that's designed for the skin. Please do not use duct tape. Do not use packing tape. I know it's really tempting to use things that feel like they're going to give you the most euphoria, but there are so many really great products on the market now that are designed for this. As well, make sure that you use the bathroom before you start tucking. Limit your tucking time to 4 to 8 hours if you can. Stay hydrated, but be mindful of the intake if the taping restricts your bathroom use. And avoid staying taped for extended periods to prevent UTIs and discomfort. So those are just some things you're going to want to keep in the back of your head. Again, I realize I'm going through all of this information super fast. We have so much we want to tell you, and we want to make sure that there's time for questions at the end. So I'll leave it there. You'll be able to go through this video afterwards, and we're going to drop some links where you can find out more information about the stuff that I have been talking about today. So I'm going to pass it over to Michelle, who's going to share some more personal experience using these products.
Thank you, Ray, and hi, everybody, and welcome to our webinar. As Ray said, I will be explaining my personal experiences from tucking and advice that I have. I am someone that tucks every day, so I have plenty of experience. Uh, Before I go over everything, I really want to reemphasize what Ray said, in that you need to listen to your body when you're tucking. It will be uncomfortable, a little uncomfortable at first, but it should never be painful. When I first started, it was a little uncomfortable. It felt like, if you cross your legs the wrong way and you kind of accidentally like squish, something down there, but it was never painful. Over time, when you get used to it, you won't experience discomfort anymore, especially when you are on hormones for a long time, if you are someone that eventually takes hormones. I no longer feel any sort of discomfort now when I do it. Now, when it comes to how I tuck, it all depends on what I'm doing that day. So on everyday sort of tucking, I use gaffs. I love gaffs. Gaffs are amazing. They're so comfortable. I have 3 here to show you guys that you can see an example of what they look like. This one is from Tomboy X. As you can see, it's very much like normal underwear. It compresses everything. You put your testicles back into the canal and you hold your penis back as you put these on. I wear these all day. They're easy to take on and off. They're easy to use the restroom. I drink a lot of liquids, so I have to pee a lot. So this is really helpful. That is an option. This one is from Origami X, actually, which Ray made. This is actually my favorite one. And I'm not just saying that because Ray's here. This truly is my favorite one because it's really comfortable. And then this one is from Gaffs. I think it's just the name of the company. This is more of a thong type. This one is my least favorite, and I'll explain why in a minute. But I bought this when I first started tucking and when I first started HRT. And I didn't measure myself because I thought, well, I have a small waist. Why do I need to measure myself? I know what waist size I am. Turns out, when you go on hormones, your hips and your butt get bigger. And this super elastic stuff right here, it ends up really like chafing into your groin when it's not the right size. So just to really emphasize how much proper sizing matters, when you do measure yourself, you want to measure your upper hip area, your lower hip area, and then your buttocks area. And each product is different. So when you look on their website, you look at the different sizing that they use. Now, when it comes to tucking tape, I personally use unclockable, which Ray talked about. Unclockable is really easy to use. I didn't think it would be. I often will use tape when I'm going to a special event, if I'm wearing a tight dress, if I'm going swimming, because unclockable is completely waterproof. Just to show you guys what it looks like. It's wrapped in this really easy like wrapper that you pull off. So it comes with a cotton pad that you put over your penis to protect it so you're not getting like that sticky stuff all over it. And then this is the tape. So this top part goes right above your penis and it's stretchy. You can't tell because there's paper on it, but it's stretchy so you can stretch it all the way back to your buttocks. When I do wear this, I often will wear it about 4 to 5 hours. And that's only when I'm in water. So that just shows you how long it's able to last. And it's extremely easy to take off at the end of the day. As long as you're following the directions that it gives you, then you won't have any issues. As Ray said, it is a lot easier to trim your hair, your pubic hair, so that it doesn't get caught on it. But I am someone that I don't like to totally shave because I'm a feminist and because you know what? Hair is natural. So I just trim it a little bit and it tells you on the directions like how short you should have it. And so I just make sure to trim it really short so it doesn't get caught as I'm pulling it off. I also really want to emphasize that you're putting this in the right area, the pad, when you are taping. I made the mistake of not watching where I was putting the tape over the first time I wore it, and it wasn't fun when it turned out the tape was stuck on my testicles as I was pulling it off. So this is your friend. Just because something is uncomfortable doesn't mean that you're getting the best tuck. I know, like with beauty standards and stuff, we think like, pain is beauty. My most comfortable gaffs and the times when I've been most comfortable when I've tucked have also been the times when I've had the best and the tightest tuck. So just because it's uncomfortable doesn't mean you're doing something right. It should feel good. Your body should be letting you know that everything is okay. And that is about it on my end. So Aiden, I'll call you back and we can answer some questions.
Awesome. Hey, everyone. So as mentioned, everything we talk about today will definitely be in our replay. So our replay will be hosted on our blog. So make sure you are following our newsletter and checking us out on social at Point of Pride ORG. So thank you, Michelle and Ray. Before we get to questions, again, if you have any questions, you could drop them in the Q&A. If you feel inspired by today's conversation, we do encourage you to make a donation to Point of Pride. Your support allows us to continue providing free gender-affirming services like binders and gaffs and HRT access to trans individuals in need. Donations could be made. I will drop a link in the chat, or you can just text the word trans futures. That's one word, trans futures, to 44321. Every contribution makes a difference. So I'm going to kind of just be the question person. I will just be kind of like saying the questions and letting Ray and Michelle answer them. But again, if you have any questions, please drop them into the chat, or there's a little Q&A box as well. So let me get to some of these questions. So do you have any tips for washing or the maintenance of gaffs to preserve the elasticity of the fabric for as long as possible?
I can totally take this one. Yes, I wrote a whole blog on this. I mean, first off, check the care label of each individual gaff because they're going to be made out of different materials. There are some brands that use like a cotton front, and that might be a bit different, but in my experience, they're usually like nylon elastane type materials. And like I said, you do want to wash it every time you wear it, but I would wash it in cold and I would hang it to dry. Besides that, there's not too much that you have to worry about. This is like very sturdy material. Like it's got a lot of tension on it. It can take a lot of wear and tear. So it's not necessarily something that you have to hand wash. Like that's really overkill. And I wouldn't even say that most gaffs would need to go on delicates. Unless it's something a bit fancier where, some brands might have like a little bit of like lace along the top or like a little bow or like, something that you would normally put like in a lingerie bag in the washer. Michelle, did you have anything to add to that?
Very much agree with what you said. I put all of mine in a gentle wash cycle on cold water, of course. I will sometimes put them in the dryer, but that's because my dryer has a gentle cycle on it. But just as you said, air dry is better. And plus, they usually air dry pretty quickly. So it's not like you'd be waiting a long time.
Yeah, I would say that those materials don't shrink in the dryer. So like if they go in the dryer, it's not a big deal, but it's only like over time the materials will break down more. But if they go in once, it's like totally fine.
Awesome. So the next question is geared towards you, Michelle. How has wearing a gaff impacted your confidence and comfort?
Oh, it's been like astronomical. So when I first started presenting as a woman, I didn't tuck because I was worried about how uncomfortable it would be, and I didn't want to like have the hassle. But it was a very common fear and anxiety for me that people would see my bulge. I personally did not want it to be present and shown. So wearing gaffs has made me extremely comfortable and confident in my identity and makes me feel a lot better. And as someone who has dysphoria, it has helped it quite a lot.
Amazing. Thank you. I'm trying to drop the questions in the chat at the same time so people can see. So the next question is, how has wearing a gaff impacted during physical activities like the gym? Do you go to the gym, Michelle? Have you ever worn anything like running, or I'm assuming this is related to like.
Wow, putting Michelle on the spot.
Yeah, I know. Sorry,
You go to the
Michelle.
gym, Michelle?
So I don't exercise very often, but I mean, I will get active sometimes. So I will say that yes, you are able to wear gaffs to the gym in sorts of activities. Yeah, I think nothing is wrong. Nothing, you won't have as much slippage. And as someone who also wears leggings a lot, like exercise leggings, even though I don't go to the gym, even though I will wear exercise leggings, I am able to get a really flat tuck wearing a gaff. And when I'm moving around, I live in the city, so I run around quite a bit. When I'm running around in the city, I don't have any issues.
Amazing. I feel like that question is going to come up. We have a binding event after this. I feel like that's definitely going to be a question. Okay, so I think the next question is a little more geared towards you, Ray.
Sure.
What should someone do if they can't find a gaff in their size?
Yeah, that's super real. For a lot of reasons, many brands are like limited in their offerings of size. I mean, there's a few things you can do. I mean, I'm gonna like shamelessly say that my brand doesn't have a size cap. We cater to everyone, and it's been like that from the beginning. And I think that's probably one of the reasons is that we've done pretty well is that you know, we carry standard sizes from extra extra small to 6XL. But if someone can't find the right sizing within that, and they don't fit the standard like body proportions of those sizes, we custom make everything for the person. So I'm not sure how many other options there are out there that do the custom sizing, but it's really great for a number of reasons. And with us, it's always free with your orders. Yeah. I mean, besides that, you could like try out different brands and see if each one fits differently. That might have more of a financial contribution aspect to it. Might be a bit expensive to like try a bunch of different ones. Michelle, have you had that experience? Do you want to speak to that?
Oh, I mean, I have noticed that, yeah, like every company that I look at when I'm ordering gaffs tend to be very size inclusive. So, yeah, hopefully that's not an issue. The only way I could see that really being a big issue is like if you get sold out of a size.
That's true.
But that's why thankfully there's a lot of different brands, so they can definitely walk around.
Yeah, again, I'll say that checking the sizing chart is really important with each brand because between brands, it really varies. So make sure that like you know your own body measurements and you're taking those at the right places on your body so that you can compare across brands and you know what size you fit in different brands.
Yeah. Awesome. Why do some gaffs have a ring on it?
That's a great question. There is a particular style of gaff that has a ring on it. It's meant to help you with pulling the penis back towards the back. I don't have a ton of experience with these particular products, so Michelle, feel free to jump in if you want.
I don't even know. I have to admit that question stumped me. I was confused.
It's a less common style of gaff. There are some on the market though. There's like kind of a small rubber O-ring that like fits over the penis with like, then there's kind of like a string that helps you pull the penis back. I imagine to like assist with holding it while the front fabric of the gaff keeps everything in place. But we'd have to yeah, do a little bit more research to give you more specific details about those brands.
Yeah.
Amazing. I'm assuming this is a little more geared towards you, Michelle. When did you know it was time to tuck? I feel a bit nervous to start.
So I noticed it was time to tuck when I realized that I had much more bottom dysphoria than previously thought. So, you know, at first I think it was more of a experimentation type of thing. Where I was like, let's try this and see how I feel. And so I think, you know, take small steps. You don't have to like wear it or like tuck for the first time and then go out, you know, in public. I think you can definitely start at home, see how you feel. If you have a trusted friend, I think that's always great to just be around them while you're tucking for the first time. Yeah, I think it's always up to you. I don't think there's any wrong answer or wrong time when to start. Um, Everybody's going to be different. Also, like, not everyone has body dysmorphia or dysphoria, and that's totally valid. And you don't have to have dysphoria to tuck. So everybody's going to be different.
I love that point of like, if you have someone that you really trust, having them there with you to kind of walk you through it. I think that would be like a very special moment. And yeah, I hope we all have community that can give us a little bit of advice along our paths.
Yeah.
Thank you. So maybe both of you can give a personal and then more of a designer aspect in this question. So I'm worried about tucking hurting. How can I avoid pain or discomfort?
Yeah. Did you want to take that one, Michelle?
Yeah, it's okay if I start.
Yeah,
I'll
go
say
for it.
that start slow. Yeah, start really slow. Read up as much as you can about instructions on how to do it. I know it can be pretty difficult because if depending on how involved the instructions are, it might be harder to find, especially since we're dealing with genitals. But yeah, start slow. If it's hurting, you're doing something wrong. So listen to your body. If it's uncomfortable at first, that's normal. Um, but start off in short increments too. Like if it's your first time tucking, I wouldn't recommend like going for like a 6 to 8 hour tucking time. Start very small, I would say.
Yeah. That's absolutely what I would say as well. I think my only other suggestion would be like, if you want to try a couple different things and see what works best for you, like try to find a couple brands that are more affordable so that you can figure out what's going to work best for your body, like maybe a gaff and a tape kit. Especially if you're starting out, a kit might be an easier, more accessible place to start. And with gaffs, like you might be able to get one through a program like Point of Pride. You might have a friend that would like let you try theirs on, but it might be nice to just try a couple different options while you're getting a feel of what works best for your body.
Fabulous. Next question. I'm scared of the future and I'm trying to pursue an orchiectomy or more. And I've been considering my fertility. I've been trying not to tuck as regularly as possible just to regain fertility. Did you say tucking can affect fertility? Is that a myth?
It is not a myth. I'm not a doctor, but from my research, it does increase the temperature of your sperm, which can reduce your fertility over time. I would say if you have a care provider that you trust, definitely talk to them to find out more if that's the road that you want to go down. And I totally hear you about like fear for the future and wanting to make the right decisions and wanting to put steps in place now to, to keep ourselves safe and healthy and feeling fulfilled down the road. It's certainly a consideration with sustained long-term use of either tape or gaffs. So I would certainly talk to your doctor more.
Awesome. There you go. I'm like so many buttons just to come back. Fabulous. Okay, so if anyone has any more questions, I do have another question here, but if anyone has questions, please feel free to drop them in the chat.
I think there was one more in the chat here that we might have skipped over. How can I get a hold of tape that is safe? Where do I go to get it?
Yep, I love it.
Yeah.
So boom. How can I get a hold of tape that is safe? Where can I go to get it?
I know that medical tape can be pretty easy to find. You could probably find it at your local pharmacy. Sports tape, I'm not sure. Probably in the same area. Ray, do you happen to know?
Yeah, I mean, medical tape, there are some specific brands that you can get, like trans tape, and other like of similar products, but different brands of it that are more available on the market now. I've been noticing that a lot of sex toy stores, especially online, are carrying tape that you can get in the big rolls, and then you can like cut smaller if you want. So if you have a sex store that you trust, maybe, yeah, it's something that you can also buy online, which is nice. Some people will use K-tape, which is more like the physio tape, but I have heard, and I'm not totally sure, I haven't personally experienced this, but I've heard that the adhesive can be quite intense, and not totally made for sensitive areas. So I think I would avoid that one. But there are a lot more brands on the market now. So just like give it a quick Google.
And I will say, I know a lot of companies online will do discreet packaging if like you're not out to any people you're living with and you're worried about that.
Yeah, 100%.
Amazing. How could you account for potential hip change from HRT if I'm trying to get a gaff before HRT?
Okay, I've got a really good answer for this one. Most of the gaffs that we make will take into account both your high hip and your low hip measurement. The high hip measurement is basically at your hip bones, and then the low hip is like the biggest part of your butt. So while both of those measurements may fluctuate, the way to reduce the how do I phrase this? The way to buy something that might be more useful in the most types of situations as your body changes is to get something that only touches at the high hip. So for example, like a thong, like it's got this really skinny band at the top, right? So it really just sits on the hips. Whereas something that's like a boy short or a hipster, like it covers the bum as well. And so then if the bum gets bigger, then like that part of the gaff will fit too tight. So if you're just looking at one measurement, there's like less chance that you'll outgrow it faster. And especially with the thong, you can kind of raise where you wear that waistband up a little bit higher if it's becoming too tight at the place where you would normally wear it. So this is something that I definitely recommend people if they know that their body is going to change. Also, just make sure that you're buying something that is made of stretch materials to account for that, so you can wear it for longer.
I will also say too, like if you're trying to gauge maybe how big your hips and butt will get, look at the women in your family. So like look at your mom, or if you have a sister, like how big their hips or butt tends to be. So if you kind of tend to have like curvier women in your family, which I do, which is is nice, but when it comes to sizing, is not always nice. That's something to keep in mind. And so maybe get one more size up. That's what happened to me. I used to wear a small, and now I have to wear a medium. So.
Awesome. Next question. Just to return to the gym question, I like to run, but also dance, like at concerts where I get really energetic. Should I use a smaller gaff or shapewear on those occasions, or just keep what's normally comfy to me?
I would suggest not sizing down in general, because it's not just creating like a stronger tuck, it's really gonna like cut into the body in a way that could be really uncomfortable. I would just make sure that you've got either a gaff or tape that you feel really comfortable using, that you know is gonna provide a really good tuck. And if you don't have one that you feel is gonna keep you really safe and like smooth and under something like leggings, then maybe try a different brand. And because I'm sure that there are brands out there that would work better if you're not already finding that really good fit.
Yeah, 100% agree with what you just said, Ray. From personal experience, the gaff that I showed that is too small. If I've worn it on days where I've been most active, I've actually gotten like rug burns like in my groin area. So especially if you're going to a concert or running or something, definitely don't size
Yeah,
down.
that doesn't sound fun for you.
Awesome. So we're getting to the last two that I have here. So if anyone has any more, here's your opportunity to drop it in the chat or the Q&A. What is something you wish you knew before tucking for the first time?
That it's not that hard. I thought it was like extremely difficult. And would be something that I have to think about on a day-to-day basis, like when I'm tucking. Tucking is kind of like it's become so normal to me, that it feels just the same as when I put on any other article of clothing. Um, I'm more worried about what I'm gonna have for breakfast that day than when I'm tucking. So yeah, I think that's what surprised me, is that how easy and how integrated into my life it's gotten to be.
Amazing. And then I will drop in the chat also what I think you're going to be talking about, Ray. But how do I measure myself to find the right gaff size?
Hey, it's my specialty. You can learn how to measure yourself. And on my website, I do have a measurement guide that's not specific to my brand. You can use that and you can take those measurements and you can take them to any other brand and make sure that you're fitting within their sizing system as well. But it does have a lot of information and drawings and videos to walk you through that process. Again, it will break down the measurements that you need for each different style of gaff. But with other brands, you're mostly looking at what we call the high hip and the low hip. And I will also note that process of taking your measurements sometimes is a lot easier with a friend. So if you can grab someone else especially who has done it before, if you're confused about the first time taking your measurements, ask and see if someone will help you with that.
Agree.
Amazing. Well, we got another one come through. Since we have a little bit of time, I'm gonna put it on the both of you. What design gaff would reduce chafing the best?
Yeah, go for it.
I was just gonna say, I would say like boy shorts or briefs. Usually, the one that I showed was a thong that chafed me the most, and so I'm thinking either way that would probably lead to chafing the most. That would be the design that would lead to chafing the most. Also, I don't like thongs. Sorry, that's a whole nother rant. But thongs are not comfortable. I don't. Yeah.
Different styles work for different people.
Yeah, everyone's different,
definitely. From a designer standpoint, there's like a lot of like body architecture math that goes into like the stretch ratios and like where the tension is of different designs. So a thong really relies on things being like really pulled up, and that upward V is like definitely where you're gonna get chafing, like along kind of like the sides where your leg hits your body. Do you know what I mean? So things like a boy short and the gaff rely more on like a sandwiching from the outside, which can really help alleviate the pressure on those like hot spots where the seams can lie. Oh yeah, some people are also saying in the chat that deodorant really helps with that. Absolutely, if you're getting some chafing. That's a good one.
Yeah.
There's lots of good products on the market right now for that as well.
Awesome. Well, thank you, Ray and Michelle, for this awesome event. Thank you to everyone who asked questions, and just in general, thank you all for your attendance today. If you'd like to stay connected, I did drop Ray and Michelle's information in the chat. We'll also have this event as replay on our blog, which will also include all of the links and resources that were mentioned here today. I encourage you all to stay connected with Point of Pride by following us on social media at Point of Pride ORG, and to subscribe to our newsletter to get information about all of our programs and also when they are open for applications. I did put in the chat also where you can get a free gaff if you are in need of one. Remember, if you'd like to support our work, donations can be made by texting Trans Futures to 44321. And if just a reminder that we do have our annual surgery fund open right now. So if you are looking for some type of gender affirming surgery, you can go to our website and apply before the end of this month, November 30th. So again, thank you, Michelle. Thank you, Ray. Before you all leave, I want to remind you of our other programming continuing throughout this week. So right after this, we actually have a binding event that's happening in, I believe, 40 minutes from now. So if you know anybody who or yourself would like to learn some more safer ways about binding, chest binding, you can check us out. We'll also be hosting tomorrow our facial masculinizing surgery topic with Dr. Fake. okay, from 1 to 2 p.m. Eastern. Actually, that's a lie. It is at 6 to 7 p.m. Eastern. So if you want to see all of our programming for the week, you can check out our socials or our blog at pointofpride.org. Thank you to our ASL interpreters also for joining. Super helpful for everyone who needs that. And yeah, I hope you all have a great rest of your Trans Awareness Week.
My name is Alex, and I'm a proud trans man from Myrtle Beach, South Carolina. I'm a drag king, a community leader, and thanks to Point of Pride, I'll finally have the top surgery I've been dreaming of. It wasn't easy saving for my surgery. 5 years of working hard, but now it's finally happening. I cried when I found out I got the grant. I read the letter and I could not be any happier. I told my close friends and family, and they are so happy for me. Top surgery to me, it means I will be free, and that I'll be more confident in myself. It will feel like I have no barrier. I'll feel like I can be myself, and I'm 2 inches, 3 inches away to feel I could breathe. Drag is the form of art where I love showing my confidence. I love representing the drag king and the Hispanic Latino community. Last year I became Mr. Pride Myrtle Beach 2024. It's times like those, moments like those that remind me that you can be visibly proud, loud, and represented in any way or form, no matter what. I can't wait to stand tall and confident, both on stage and in my everyday life. Thank you, Point of Pride, for making this possible. This isn't just a surgery, it's freedom, it's everything, and I'm ready for it.
I'm here with the co-founder of Point of Pride, Aiden Dowling.
Hey, how are you?
Pretty good. How you doing, friend?
You know, we are chugging away over here,
Let's-
putting in the work.
Let's talk about the beginning of Point of Pride and how that all became to be.
Yeah, well, it all starts with gender-affirming care, right? So I came out in 2009, which makes me feel like an elder. I've been on HRT and medically transitioning for going on 16 years. Oh my gosh. October will be 16 years.
Oh boy.
I know. And I needed my own gender-affirming care, which was top surgery. And it's expensive. And lots of insurance, especially in that time, do not cover top surgery. And I needed to find a way to make money, extra money, so that I can save it and get my top surgery. Because I had been wearing a binder for like 3, almost 4 years, every single day. It just became excruciating to, wake up every day. And I mean, you wake up every day and you know who you are, and you look in the mirror and you just don't really see that person looking back at you, And so I started coming up with different ways to make money, which most people do. So taking on extra shifts at work. I tried everything. I used to wood burn, and so I was like wood burning people's names, like other actual YouTubers' names, and mailing it to them in hopes that they would showcase it and I can sell that. I'm a baker by trade, so I was having bake sales. I was doing all of the things, and I actually had an opportunity to do a special for MTV. This was back in the day, and they paid me $250. And I remember getting that check and being like, I have to somehow turn $250 into, at the time, it was $6,900 for top surgery. Now that is doubled. The average top surgery is $12,500.
Wow.
If not more, to be honest. And I was just thinking of ideas, and at the time, there was t-shirts out there that were like, gay is okay, right? All these different affirming things for being LGB.
Mhm.
And there was no t-shirts that were like positive and empowering for trans folks. And so there was a special on a home kit screen printing It was like literally, I think it was literally like $199 and like $50 in shipping. It was like exactly how much this check was. And so I bought it and I started screen printing t-shirts. That was like a Superman symbol, except instead of an S, it was a T. And it was supposed to be, yeah, it was supposed to be like empowerment, right? Like I can be trans and I can be proud of who I am. And it could be my superpower if I let it be. And so I started selling them. I had my YouTube channel, and so I had a little bit of a following. So people would buy a shirt for $20. I had no shirt, so I would get the $20. Then I would go to Walmart and I would buy a $3-ish t-shirt. Then I would screen print it. Then I would ship it, and the shipping then was only like $5, something like that. And then I would keep whatever was left. And after about 6 or 8 months or so of doing this, I was able to raise the money to get my top surgery, which was so incredible to be supported by the community like that, right?
Yeah, that's absolutely wild.
Yeah, it was really cool. I mean, we've always been mobilizing like this, you know what I mean, to support each other.
So after you did that, did it kind of seem like you needed to pay people back? Is that where that idea of Point of Pride came from?
Yeah, so the clothing company was called 0.5 cc, which is the average amount of hormones that a trans guy takes.
Yeah.
And the first logo was a syringe. And like to the point that people were like, I don't really feel comfortable wearing a syringe. And I was like, why not? It's just
needle sharing. Get on board.
I know. It was like, very quickly I was like, okay, maybe this is not the best way to like, you know, position this brand. And I wasn't a company or anything. It was just an idea, right?
Mm-hmm.
And so then I was like, well, I'll come up with a name, and that's where I came up with 0.5 cc, and I, you know, started, you know, continuing to screen print because people were like, are you good? I want a shirt. Like, are you good to stop? And it felt like I was supported by the community, and I wanted to continue to support them back, right? Like they helped me, and I wanted to help them. And so I kept the company, I turned it into a company, I kept making shirts, and I would, you know, pay all of the overhead, so like the cost of the ink and all of that stuff, and all of the extra I would put into a little one of my bank account, right? And then at the end of the year, I would give that money away to the community. So like the first check was $800, which is a lot.
Yeah,
you know,
it is. It is funny now knowing the big numbers that we're getting now.
Right.
800 just is a wild.
I know.
It's such a wild trip doing this fundraiser every year because we are doing a fundraiser for trans people by trans people, which is very unheard of. And we're raising millions of dollars to do it.
It's wild.
Did you ever, when you first started that $800 check, was there ever a moment where like, yeah, it's going to get big?
No, I mean, it was really, it really was just a way, like, I wish I could have thanked every single person. But I couldn't, right? I wish I could have like given them their money back because I knew that these were trans people supporting me, and that $20 is a lot, you know what I mean? And I knew I couldn't, so at least this was my way of being like, okay, well, I'm just continuing the cycle of us sharing as a community and resources.
It's community care. It's that mutual aid, community care kind of environment that trans people have just so much been used to.
Yeah. So I mean. Yeah, so the first check was $800, the next was $1,200. Like it just slowly built up, and I remember. So that was like the first program. I didn't know it was a program. It was just me, you know, saving money and giving it out.
Yeah.
And then the second program that I didn't know was a program was, so back in my day. Okay.
Woo, Aiden! Wow, you were dating yourself, buddy.
Back in my day. I am the elder in the room.
Wow. Well, not by much though.
I know. I like
by like a year.
Months.
By
no,
a
I
year.
think it's like months.
Is it months?
Yeah.
How old are you?
So I was born in '87.
Oh yeah, so was I.
Yeah, exactly. But I was in July.
Oh well. Yeah,
yeah, exactly.
We don't talk to people who were born in Q3.
Why?
I don't know. I just want to.
It's like
I wanted to sound official and corporate for some reason.
So people used to, you would get top surgery and you would take your binders and you'd have this binder burning party. It was a very popular thing. And so
yeah, I remember this. I went to it way back in the day.
Exactly.
I went to one.
And you'd have a little party and you'd burn your binder because you were just like, I'm free. I don't have to be bound.
Yeah.
Like I was, and so many people were for so many years. Right. I binded for 3 or 4 years. People bind for 8 years, 10 years. Like,
Yeah.
I mean, a long time. Surgery is very expensive, and it is not something. It's something that you have to save for outside of all of your regular expenses. You know what I mean? So it is a really big privilege to be able to afford those type of things. And so whenever I saw people burn their binders, I was just like, oh my gosh, like in my mind, in the smoke was just like money, especially then, because binders now are around $30 to $45. Binders back then were $65 to $80.
They're somehow way less accessible.
Yes.
Yeah, like even gaffs. Gaffs were really expensive back in the day too. And that's where you got the whole take a nylon stocking and cut it up and use a sock, and that's how gaffs were made. I literally watched how to make a gaff like well before I came out because I wanted to understand, and I remember watching and being like, wow, this is the way that we do this?
Yeah, and like people would bind with duct tape or with yeast bandages, and that's so bad for you. Like even the way you're talking about like tucking, it's like it's just so bad because it's not, the distribution of the compression is not correct. Like, you're using duct tape like on your chest or below, like that's really bad.
So it became important for you to try to help people to do this safely too.
Yes. Safety, and I knew that there were people who could not afford binders, and they were literally on the other side of that wall were people burning binders, and that to me felt like, what are we doing? Like, what are we doing?
It also can be one of those things too, where like either making it or trying to spend money on it can be an obstacle for people too.
Yes.
Like you feel like you're making a commitment to it, but where what you're able to do is you're basically giving people access to it for free, and to be able to help them just like no stress to try to explore this part of their identity.
Yeah, it's a first step for so many people, right? It's a first step, and it's like you either put the garment on and you look in the mirror and you feel better, or you don't. And that's a really big clarifying moment for people.
Yeah, it's huge.
Yeah, and so I think and like being trans, non-binary, it's so different for so many different people, that the way we express ourselves through our bodies, like what's good for someone might not be good for another person.
Absolutely.
You know what I mean? And so with the garment program started as just binders, and I just literally was like, mail me your used binder. If you have a binder that still works, wash it, mail it to me, and I will give it out. And so then it was like, you would buy a t-shirt and I literally just had a list of the size, and like, it was like extra large tri-top binder white, like small full length binder black, and I would put it up on the website. People would place the order, tell me what binder they wanted, and then I would have to go onto the website, delete it, you know what I mean? Add to the list.
Wow, this is manual. This is very
this is old school.
Yeah.
And so people would get top surgery and then mail in their used binders, and then I would mail them back out. So then you would pay $20 for getting a t-shirt and this $60 binder, right? And the money that you donate, like you gave to purchase this, would then go to someone else, right? So it was this very big circle of like community and mutual aid. Like someone accesses top surgery, they mail in their gently used binder. This person can't afford a $60, but they can afford a $20, right? They get a t-shirt that's affirming, they get a binder, and then the extra money goes to some other person who needs gender affirming care, right? So it was like this continuous cycle, and then that person gets top surgery, then they give their binder, and it was like this circle.
So with that cycle, how did that go to the next step? How did you go from garments to now we're going to do surgeries? Like, how did you make that jump?
Well, I mean, I think like, so I had the clothing company, and then Jeff, right, the co-founder, he was helping me make designs, work my wife was like, you can't do this. I know someone who can help. Like, you need help, and I can't help you, but I know someone who can. And so that's how I met Jeff. We were both working at an LGBT center. I was driving the minivan, which was picking up the youth and bringing them to their events and driving them home. And she was working in the building. And so she introduced me to Jeff, and Jeff was, I don't think Jeff knew what he was getting himself into. I think he was just like, oh yeah, like I'm gonna help this guy like make his website better and maybe help him with a few like designs. And then, you know, however many years, 13 years later, you know, here he is. So
wild.
But I think when I had Jeff's help and the company started to grow and grow and grow, and I realized that I was not very good at making money. Like, I was not a good businessman because all the money I made would just go away, and I would just give it away or buy things and give it to people, and you know what I mean? Like, so that is when like Jeff and I eventually were just like, this is not a business, right? Like, we are a nonprofit, we just don't have the status, so we need to become that. You know what I mean? And then, you know, again, those checks were only $800 and $1,200, so it was never really about getting someone a full surgery. It was always just about helping push someone over the edge, right? Like, I had worked so hard to save money, and I knew what $800 could do. It could be that defining factor of like not having enough or having enough. You know what I mean?
Yeah.
So there was no like specific. I never imagined being able to actually get someone a full surgery. I mean, that wasn't ever the goal. It was just to help someone.
Do you remember the first person you helped get the surgery?
Yes. I'm not as good. I'm not Fact Daddy, so the names are not as good with me. Jeff is better at that. But I do remember it was a top surgery. Because I was trans man. I am a trans man. My community was mostly trans masculine, so it was founded in a very like trans masculine centered world, and then we were able to start branching out. You know what I mean?
Yeah.
So.
It starts with what you know.
Exactly.
You know what I mean?
Yeah.
Like, it is
in my community.
And also, like, there's a huge difference between something so grassroots like this, and then like an organization that was given a grant.
Yeah.
And then, because if I remember correctly, I don't think Point of Pride has any government funding.
No, we have no government funding.
We never have, right?
We never have. We only have individuals who donate. So we have gotten grants from like other LGBT, but that's not government. But we have gotten like smaller grants, you know, like we've gotten like Love Loud grant, like that. Concert like has donated 10,000, and this other small grant has donated 5,000, and we have gotten larger. We just got a big grant for, I think it, again, Jeff would know better, I think it's 50,000, and we were able to purchase, we got for our garments, we got a storage unit, and we got a system in which we can track and manage how many we have, like an inventory system. That's the word. You know what I mean? And those things are like, it's a lot of money to buy an inventory system, you know? Because, I mean, this year alone, from January 1 of 2025 to now, Transgender Day of Visibility, we've given 2,000 garments out.
Already. In the first quarter of the year.
Oh, yes, you're quoting in the first quarter of the year. Yes. But I mean, and historically, 27,000 garments.
Wow. That's so...
I know, like, when I think about that, and I just think of me in my garage, you know, like my mom just the other day was like, it's crazy to think that here you are, and I was helping you put those binders in those bags, or however she said it. You know what I mean? Like, in my garage. And I'm like, yeah, like, because that's how it started, in my mom's garage, like screen printing, in my living room, in my garage. Like, that's how this all started.
I feel like all great stories start with
In a
someone
garage.
starting with someone's garage.
Yeah.
I feel like so Point of Pride basically started with just having a few binders.
Yeah.
And then that leading into being a multi-million-dollar nonprofit.
Yeah. Yep.
So at what point did you realize that you had something? Like this was something that was going to make a big impact?
We had an opportunity to get $5,000 from a corporation and come in and speak. And I couldn't do it because I wasn't a nonprofit. And that was the moment Jeff and I were like, we missed $5,000? Like, that is life-changing for someone, like.
Yeah, at the time it's like 3 or 4 people's HRT for the whole year.
Yeah, exactly. You know what I mean? It's a numerous amounts of garments. It's potentially 2 to 3 people's HRT for an entire year. You know what I mean? It's $5,000 is 2 electrolysis grants and then a little bit more. So to think that we didn't have those programs at the time, but just to think of $5,000 and what we could do with it for the community was like enough to be like, okay, like we have to stop this. Like, we have to become a nonprofit. What other money are we leaving on the table? Because we just don't have that status.
So what year was this for you? Was this year 1 then, technically?
So yeah, this was the beginning of year 1. So we officially
10 years ago.
Yeah, we officially became a nonprofit in 2016. So 10 years will be next year, which is exciting. And then, so I would say it was somewhere in probably 2015 that we missed that, because it takes time. You have to build a board. You have to fill out paperwork for the federal paperwork and IRS.
You and I are not we're not the brainiacs.
We're not those people, no.
That's not what we do.
That's
we're like,
not
we have an idea. Let's make this crazy idea happen.
Yes.
This is why we bond.
They call us the visionaries.
Yeah. Or some people would call us insane. It depends on how you look
I
at
think
it.
that they ride very closely together, those lines.
Yeah, I agree with you. So at what point did you think that, I need to bring on more people? Because now, how many volunteers do you have now?
Well, we have a board of about 5, and we had a larger board, but Jeff became staff, I became staff, our program director Tyler became staff. So some of our board members transitioned into staff, and you can't be both.
Yeah, and us, we're always transitioning.
Yeah,
so.
Yeah. We don't like to be in one place at one for too long. So we had to build a board, but we were for the first 7 years, we were fully volunteer.
Yeah,
everything we did
when
was
I first started
volunteer.
working with you,
yes,
you were
we
100.
Yeah,
I think you only started not being that way because of the fundraiser.
Yeah,
like we were able to actually build infrastructure out.
So most nonprofits, the first person you hire is your executive director. We didn't need, the first person to be hired did not need to be an executive director. It needed to be a program director. We were caring for so many people that we needed somebody who woke up Monday through Friday, 9 o'clock to 5 o'clock, cared about the recipients and made sure that they were getting their financial aid paid for, all of the things needed.
Yeah, that's their whole job.
Yeah, so we did everything very non-traditional. So we did not hire our executive director first. We hired our program director first because that was the most needed thing. So we hired him first, then we had our first fundraiser. Then we hired Jeff.
Okay.
Then a whole year went by. Then we hired me, and we also hired a care coordinator because we need someone to actually be able to meet with the recipients and help them fill out the paperwork, research a surgeon or care provider that they're looking for, someone that they can get support from. You know what I mean? And now we have they're not fully full-time, but a financial person, because we're paying all of these different people. We need to make sure someone is keeping track of all of the money and stuff.
There's so many different regulations that are going into this, and so many different hurdles that are popping up like as we speak right now. Like, how does this change what you guys are doing year to year? Like, it has to be different for the program director every single year from what surgeons would be willing to do the work and where and everything like that.
Yeah. So we have we are constantly watching what legislation is coming up. We are constantly having to keep track of each state. So like even with our HRT, like in certain states, you have to have your first meeting has to be in person. Then you can go to telehealth, right? So like we had to start giving out the programs are forever evolving based on the political climate and making sure that we are abiding by state and federal laws. So it's this year has been very difficult with all of the changes and all of the potentials and making sure that we are not, abiding by anything preemptively, but also making sure that we are taking care of the people that we have promised and made promises to. That's the most important thing, is that every single year we are caring for hundreds of trans people across all of our programs, and they are depending on us to pay for their HRT, to pay for their electrolysis, to pay for their surgeries. Like, they are relying on us, and we need to make sure that we are constantly following the laws so that we can care for this multitude, this community that we have of Point of Pride people.
And I feel like we're very much like in the front lines of that. It feels like there's not a whole lot of organizations that are big enough to do the work that you're all doing.
There are no other national nonprofits that do what we do.
That's the thing. Like, that's always such a hard thing to talk about, because people will sometimes say, none of these organizations do this or do that. None of them are actually able to help people. That's not actually true. That it's very specific. And this is such expensive work to do. That, like, I mean, we've talked about this, that with how many people apply every single year, we would need an astronomical amount of money every single year.
So just for the surgery fund of last year, everyone who applied in 2024, if we were to award everyone, I think it's about $49 million.
Yeah, so our 2 million here, our 1 million there.
I mean, it's impactful.
It's so impactful because we spread it out, right?
Right.
We do HRT, we do binaries, we do electrolysis, we do it all. And that helps to help as many people as possible. But it is a hurdle. It is a huge hurdle.
It's really hard. You know what I mean? And it's even harder to be somebody who needs it.
Yeah.
Because you don't know if you're going to get it.
Yeah.
And it's very...
The letters, the emails saying that, like, they're not able to get help and, they've applied before. Those are heartbreaking.
Yeah.
But I want to be clear. We know this, but I need to articulate it for those who are watching, that this is a problem that is created by a system that we have no control over. We can't prevent those prices from increasing every year, and they are really radically increasing every year. And depending on what region you're in, depending on all that stuff is really in topsy-turvy land right now.
We shouldn't have to exist.
No, for real. We've talked about, I would love for this to not be a thing.
Like Point of Pride should not have to be here. Our healthcare system should take care of us, and it doesn't. And our biggest dream is that one day we don't have to have a fundraiser. One day we don't have to. Like, my biggest dream is that I don't have this job. Not because I don't love it, but because that means that we have created a system where trans people are cared for, and the things that they deserve, they get. You know what I mean? And so, like, that's the dream, right? That is the dream, is that we're gone, and what we do is it's not just expensive, but it's so impactful because it's direct service. So we are directly caring for trans people. We are not, doing anything. We are letting other nonprofits who do it better take care of fighting the legislation, right? Like taking care of protection, like legal protections. We don't do that well. That's not what we do well. What we do well is meeting the actual trans person on the ground, caring for that person.
As close to mutual aid as you possibly can. We've talked about this before, where like this is as real mutual aid as you can get at a scale this large.
Yeah.
Right. And if you want to do it in a way where you can vet people and make sure the people who are the most vulnerable in our community this is the way to do it.
Yeah.
You know, I can't imagine doing GoFundMes and trying to sort through every GoFundMe.
Yeah.
You know, I must get like 3 to 7 GoFundMes a week, maybe probably more. I only ones I'm aware of, you know.
Yeah.
And it's again, it's like we're all helping, we're all passing the same $20 around.
Yep.
And we're all doing the best that we can. And that's why allies are extremely important.
Yeah.
And I think that this fundraiser really, I would like to think in my mind's eye that the people who donate the most are allies, right? I would like to believe that is true. And I would like to people who donate the least are people within our own community who are donating what they got.
Right.
Right?
Exactly.
Because 8,000 people donate every single year that are doing less than $5, I believe, right?
Yeah.
$5 or less.
I think it's actually 10,000 somewhere around.
I think
the
you're right.
10,000 mark.
I think it is 10K.
It's like I just did this math the other day. It's something like 10,000 is under $20 or something.
But that's not something that happens for other fundraisers. That isn't a thing on a national average, right? Like, you know, people don't donate very tiny amounts for a lot of fundraising.
No,
right?
And I think that just proves that the people who donate, you like what you say, like donate what you can with what you got, right?
Yeah.
Because at the end of the day, think of it. If 10,000 people give $25, that's a lot of money. You know what I mean?
It is. It
is a lot of money for some people to give $25. But when you know that it's being combined with all of these other people, right? Then it turns into this really big thing that everyone can be really proud of.
Yeah.
You know?
I mean, we've had 20,000 donations in the last 2 years. They're $5 and less.
Mm-hmm.
That's somewhere between, you know, like $20,000 to $100,000 raised.
Yeah. Yeah.
That's a lot of money. That's a lot of people still. And that's a lot of people helping each other.
Mm-hmm.
And I think that's what this whole fundraiser is about, by bringing our community together and making this happen. Are there plans for Point of Pride to like continue to do other things? Like you have several different funds now.
Yep.
Do you want to expand out?
So we just did our Thrive Fund because of
Yes.
these fundraisers.
Yep.
So last year was our pilot of Thrive Fund. And so that it was $53,000 to people who, as we were saying earlier, gender-affirming care looks different for everybody, right? And it doesn't always mean surgery. It could mean fertility preservation, right? It could mean a wig. I mean, high-end wigs are very expensive.
They're like $150, $250, right?
They're more than that.
Are they more than that?
They're like $1,100.
Jeez, that was up. I'm talking about drag queen wigs,
Yes,
apparently.
exactly. like high-end,
Wow, like human hair.
high-quality wigs.
Wow.
Exactly. You know what I mean? And so these are, you know, name changes, passports, all of these document changes. It can cost $900 to get your name changed. It can cost a lot.
It cost me a decent amount.
Lots of money. And so we were able to launch the Thrive Fund, which was our newest program. And so we continue to shift our programs based on the needs of our community, right? And so, you know, we started covering some additional costs with surgery fund for like over the counter, like Advils or you know, gauze.
Yeah.
Some of our electrolysis fund, you can get an HRT access fund. There's different stipends so that you can get an Uber ride, you know, to and from the labs, because maybe you can't afford to go like drive to the labs. Maybe you don't have a car. You know what I mean? All these different obstacles.
Yeah.
So
when you're working with a community that is very disadvantaged, right?
Mhm.
Like disproportionately affected by various different aspects of the economic world, then you kind of have to take it into account every single aspect.
the average trans person makes less than $10,000 a year.
That's,
you know what I mean?
yeah.
So these are, and our goal is to reach those who have the most barriers to accessing care, whether that's systemic barriers, right? financial barriers, and even location barriers, right? So as we know now, like, which states are you living in and where are you living in those states? You might have to drive 12 hours to get to a local person who could do HRT, right? You might have to travel over state lines to get someone who will actually care for you if you need surgery, right? So it's like, those are the people we're trying to our best to reach those people, you know what I mean? And so I think when you were asking, like, are you going to continue programs, we also, one thing that I think has led us to do really great work is that we are laser focused on doing the programs we have as best as we can and as efficiently as we can. And so we won't continue to just add more programs and add more programs. We want to get really good at the programs we have, and we want to make sure that we're covering the different bases that the general trans population considers, gender affirming care for themselves.
It is so interesting and very fascinating to be looking at this from my point of view as someone who's been working with you before you really had any infrastructure.
Yeah.
And now looking at how fast a 2-year period, really.
Yeah.
From, the second year to the fourth year.
Yeah.
Of you guys expanding so fast and really learning how to operate as a functional nonprofit in that way and a large scale. I mean, the first 6 years that you guys were around, I think you had $600,000 raised.
Yeah, we definitely it was something along that. We were not $1 million or a $500,000 or $250,000. That's not
you
what
went
we did.
from a very small $600,000 combined for the first 6 years, and then in the first 6 hours we doubled it. Yeah, we doubled that.
Together, the community raised more money in the first 6 hours of your second year, right, than we had raised in the 6 years before.
My whole thought process when we started doing this, Aiden, was like, I know that this is really important. The trans community knows that this is really important. We just all have to point at a thing and say, that is what we're going to do.
Yeah.
And I think that's what we basically did with the fundraiser. We all know this stuff is important.
Yep.
People who are on board with trans people know this is a central thing within the trans community that we need to do. And we have to just run with it, and we needed someone to just point, and I think all I did was put a spotlight on it.
And I think what you also did is $1 million is a lot of money, and I think that you and together we were able to prove that we can raise $1 million for trans
No one thought we could.
No one thought we could.
No, I mean, to be honest, neither did I. Jory and I, leading up to that fundraiser, we called each other and we were like, I think we fucked up. I think I think we made an oopsie.
But now people believe, and now people understand the power of when we come together.
Yeah, it's wild when you can send out an email and I wake up and we have $50,000 already.
Yeah. So
that is insane.
And it's because now people believe it. Now people are like, oh yeah, we can raise $1 million. Oh, I donated $20 last year. I'm going to donate $40 this year. People believe it because they've seen it. And now it's like, this is something we can actually do. Every year we can raise this money and we can help hundreds of trans people get life-saving care. That's what it is. It's not aesthetic. It's not, it's like, it is life-saving. And the recipients that we talk to, they know that, you know what I mean? And their lives drastically change because of this care. And so I think that is always something that we're trying to also just communicate, is like, if you're trans, you know how important it is. You know what I mean? And like you were saying, the allies who donate, they usually have a trans person in their life and they know too. So we're not convincing anyone of anything.
No, that's always what I tell people, right? I'm not trying to convince you, because if you know, you know. If you don't, you don't. There just really isn't a lot in between here.
It's true.
Because when you see a trans person blossom and their personalities change and their postures change and their outlook on life. I mean, I remember when my spouse started talking about the future for the first time.
Yep.
that is a terrible. We didn't have a 401k because why would you? You know what I mean? And after their top surgery, maybe like 3 months, and then they started talking about our future and what we wanted to do together, and 5-year plans and 10-year plans. It's so deeply lodged in us that there really isn't a future in the same sense that I think it can be hard for us to invest time and energy and money into these causes. Yeah, it's hard. So when we do things like this, I think it galvanizes our allies who've seen this firsthand, from spouses, from brothers and sisters, and moms and dads and cousins and uncles, bosses, you know?
Yeah. I mean, you and I had the opportunity this past few weeks to go meet some recipients in person in Chicago. And when you sit down with them and you hear them talk about how life-changing it is. Right? It's like it's not that you forget as a trans person, right? But it's like
you do though.
Well, I mean, you do, but it's like you get when you talk to someone who just had care. It relights that candle inside of you that you've just become so accustomed.
It's always right on the surface.
Yeah.
Like it's always right there for us.
Yeah.
If you can walk into a room with like 10 trans people and you bring up gender-affirming care, and every single person in that room, regardless if they are someone who's participating in medical care or not, will have something to say about their individual like trans experience related to that. You know, it's like a universal experience. When you sit down with them, it's electrifying.
Yeah.
Like hearing someone's story and also hearing the through lines and how similar they are, but yet so different.
Right.
You know, there's so much internal struggle before we even get to this point where we're openly like living our lives to enough to the point where we're actually seeking the help that we need.
Right. Yeah. And I think that people need to be given more permission to seek the help they need. They need to be given more permission that they can want things.
Yeah.
You can want them and you do deserve them, you know, and I encourage anybody who is watching and, you know, apply for our programs, you know, continue to apply. There are many people who apply 1 year, 2 year, 3 years, and then that's their year. You know what I mean? And that's what we heard from the recipients too. So it's just, you need to believe that you can have a future.
Yeah.
Because that's when the possibility opens up for you. You know what I mean?
Aiden, it's been a blast talking to you. We talk to each other all the time.
I know.
But it's so rare
like
that we
constantly voice
actually
noting.
get to like talk to each other about the ins and outs of this. Usually I'm just giving you a hard time about everything that you do. So thank you, my friend, for coming on and talking.
Yeah, and thank you for using your platform to give back to the community in the best ways that you can. And thanks to everybody that follows you and everybody who donates, and it really is impactful, and you can go to pointofpride.org and you can see the impact. We are constantly updating. You can join our newsletter. You can learn about the people that we help and that you help as well.
Every single person who has a platform, regardless if it's 2 people and a squirrel, I don't care. Every single person who has a platform should be actively getting involved with change like this. I firmly believe that this type of aid is so extremely important that a part of me, and you know this, gets very mad when I had to chase down people to get a minor shout out.
Yeah.
You know, and you say thank you, and back in my head I'm like, it feels mandatory for us to be involved with our community. You know, regardless if I was trans or not, anybody within, if you're someone who believes in any leftist ideology and any progressive ideology that to try to fight change, now is the time to actively invest in that and connect with your community and try to make active change. People will follow. The problem is sometimes we just need a spotlight to show us the work that's already being out there. I accidentally found you.
Yeah.
I accidentally found you. I don't know if I would have came across you if I didn't just stumble, but I was looking for something to sink my teeth into, and Porn and Pride was right there when I was still fresh as a baby TikToker.
Well, I think that's also where we connected, and now we have a friendship, right? Because I think that I was an influencer. At one point, people knew who I was. You know,
weren't you on a cover of a magazine?
You know, I've done some things in my day.
Yeah, Men's Health.
You know. And so I relate to that. It's like I am only where I am because of my community. Why it feels mandatory to represent and stand up and to fight and to continue to build that community. Like what else is there to do?
Yeah, when we have a platform built around or even adjacently to our transness, it feels very dishonest sometimes to see. That's my feelings about it, right? Like I never expect anyone who doesn't put themselves out there, who is stealth, who I never expect anyone in those positions to do that fighting, because only do what you're comfortable with.
Totally.
Right? But if you're already out there publicly living your life as a trans person, I do think that's, putting some type of mouthpiece to these organizations that are already actively getting involved.
Yeah.
It really does matter.
Yeah,
so
it does.
Thank you, Aiden, for everything.
Yes.
And now let's just go and raise money or sleep, depending on when people are watching this. All right, bye-bye.
Hi, I'm Tyler Rodriguez, the Director of Programs here at Point of Pride. I'm so honored to share a little bit about one of our most impactful initiatives, the Garment Program. The Garment Program was created to make gender-affirming garments like chest binders and shapewear accessible to trans folks all over the world, completely for free. We know that feeling comfortable and confident in your body is a critical part of living authentically. For so many in our community, the cost of these garments makes them out of reach, especially when facing other financial barriers. Since the program began, we've proudly shipped over 26,000 garments to folks in need, reaching all 50 states and more than 127 countries around the globe. It's truly incredible to see how far-reaching this program has become. Just this year alone, in 2025, we've already sent out over 2,000 garments. But what really makes the program special isn't just the numbers, it's the sense of community and connection that it creates. We don't just package and ship garments. We put care, love, and encouragement into every single package. That's why we host garment packaging parties, where volunteers from all walks of life come together to carefully prepare each garment, making sure everything is just right before it goes out the door. And there's another beautiful part of the program that I love, our letter writing events. At these events, volunteers take the time to write personal, uplifting messages to include with every single package. These notes are often filled with words of encouragement, love, and support, letting the person receiving the garment know that they're not alone on their journey, and there's a whole community rooting for them. It's amazing to see how creative and heartfelt these letters can be, and we know they make a real difference. We've heard back from recipients telling us that these letters are often what they hold on to, long after they've received their garment. For many, it's not just a piece of fabric, it's a symbol of acceptance and love from a community that sees and supports them. What keeps the program going is the dedication of our volunteers and supporters. Whether it's helping us package garments, writing letters, or spreading the word about what we do, it all makes a difference. We couldn't do this without you, and we're so grateful for everyone who gets involved. If you want to learn more about the Garment Program, get involved, or support our work, visit pointofpride.org. Together, we're changing lives, one garment at a time.
Hello, everyone, and welcome. Thank you so much for joining us today. My name is Aiden Dowling. My pronouns are he, him, and I am the co-founder and chief advancement officer here at Point of Pride. We are excited to have you with us for this special conversation, which is part of our Trans Awareness Week programming. So happy Transgender Awareness Week, everyone. This week is all about uplifting trans voices, fostering understanding, and advocating for greater visibility and access to care for transgender and non-binary individuals. We're grateful to have everyone here as part of this important dialogue. Before we begin, I do want to introduce those who may not know what Point of Pride is and what we do. So we were founded in 2016. Point of Pride is a trans-led nonprofit organization dedicated to providing life-saving gender-affirming support to transgender and non-binary individuals around the world. We offer direct services through programs such as our free chest binder and gaff program, which we will be announcing later this week that we have officially given away our 22,000th garment, which is very exciting. We also allow recipients to have access to our HRT Access Fund, our Electrolysis Support Fund, our Thrive Fund, and currently open for applications, our Annual Surgery Fund. Our mission is to eliminate financial and systemic barriers to care, ensuring that every trans person has access to services they need to live authentically and thrive. Welcome, everyone. I'd like to first introduce our first co-host for today's virtual workshop. And first up, we have Ray Hill, pronouns they, them. Ray Hill is a trans non-binary fashion designer and co-founder of Origami Customs, a clothing line made in Montreal, Canada. It is a line of swimwear and lingerie for folks of all genders, specializing in gender-affirming pieces that fit all bodies and abilities. Each piece is custom made by a team of queer and trans people in their Montreal studio. Origami Customs runs a parallel community program that supports gender affirmation for folks with limited access. This program operates globally through a network of nonprofit organizations like Point of Pride to provide life-changing items for folks facing barriers to intersectional oppressions through a mutual aid framework. Welcome, Ray. Hi.
Hey, so glad to be here.
Thanks for coming. Our next co-host is Kai Jace. Kai Jace, pronouns he, him, is a transgender model, certified personal trainer, and personal training director from Louisville, Kentucky. He specializes in hypertrophy and bodybuilding with a passion to help people achieve their fitness goals and become the person they've always envisioned themselves to be. His content places an emphasis on mindfulness and mental health, inspiring his clients and followers to instill healthy habits and live a healthy lifestyle. Kai Jace began sharing his journey as a transgender male on his YouTube channel in 2017, which opened many doors to his success, including winning an LA modeling competition, working with Emmy award-winning actor and producer from ABC's The Bachelor, and creating content for brands such as Trans Tape, Tej Hanley. Am I pronouncing that right, Kai?
Tej Hanley.
Tej Hanley, skincare, and more. Look at that skin. He's actively relaunching his YouTube channel with his new podcast, Kai's Safe Space, which will give others from all walks of life an opportunity to share their story and spread hope and awareness to the LGBTQIA+ community. His next chapter is to get top surgery and start competitive bodybuilding. Awesome. Thank you both for being here to spread your experience and expertise for this event, Binding with Confidence. As a reminder to everyone participating, we will have time for questions at the end of this discussion, so please feel free to ask them in the chat or hit the Q&A box at any time. And until then, I will hand it over to you, Ray.
Hey, thanks so much, Aiden. This is very exciting. I'm so glad to see so many people here. What a wonderful week of events. So as Aiden said, I'm Ray. I use they, them pronouns, and I'm the owner and founder of Origami Customs. I've been making binders and a range of other gender affirmation pieces for people for 15 years, which we do all custom, and I've designed all those products. And I'm also a binder user myself, so I'm really happy to be able to be here and share some tips with you. The focus of today's event will be on how to choose the right style of chest compression for you. We will cover a range of binders, but also trans tape. And Kai will lend some amazing anecdotes and experience using these products. So just to start, chest binding can be a super transformative practice for many people with gender dysphoria. And when you're trying out chest binding for the first time, it's really important to find a binder that's right for your body. Binders, if you don't know already, which I'm sure you do, are a compression garment. And if they fit improperly or are made of materials that don't keep you safe, then they can cause injury or long-term health issues. So we just want to make sure that we give you all the information necessary to make really informed choices about your body. So to start off, and I am going to go through this information pretty quickly, but you will get a copy of this recording afterwards so you can go back to it. So About binding, there's tons of different styles of binders on the market. So let me run through some of the main different styles and their pros and cons. So first off, we've got short binders, also called half binders. These are kind of the standard. They're amazing when you're really active, when you're moving around a lot. They are more breathable than a long style. However, you may see the outline of these binders when they hit at the waist, quote unquote, giving away the fact that you're wearing a binder. Racerback styles can help with arm movement and mobility when you're doing activities, which can be really, really handy. And there are binders, like some of the ones that I make, which have a band that sits close to the body and will be a little bit more streamlined. Long binders that go all the way down, they can tuck into your pants and give you more of a smooth silhouette, and they can help to compress the hips as well if you're also experiencing hip dysphoria. The other side of that is that with some folks, they can tend to roll up, which can be uncomfortable. Closure binders can be really great for people with limited mobility or shoulder issues. They might have a closure down the front or down the side. They can be easier to get on and off, and they're really great for people with a larger chest and relatively smaller rib cage to ensure that you're getting properly snug fit around the ribs. They also, though, can come with less even compression, so you do need to be careful when you're putting them on. Strapless binders are another option that's out there. They are great for not showing under any outfit. They're just like a tube with no straps. They have a lower ability to compress, and you may need to keep adjusting them as they don't stay up that well on their own. But it's a fantastic option if you want to wear something a bit more open at the top. Swim binders are another style, but many different brands make different types of swim binders, but you should really be aware that they do need to be made with chlorine and salt resistant fabrics like swimwear, lycra, and not a cotton panel, which does come standard with some of the main binder brands, a non-stretch panel in the front. You need to make sure that there's no natural fiber contents in that, or they will disintegrate. They should be healthy, flexible bind to allow for heavy breathing and the mobility that you need when you're swimming. We make all of our binders swim compatible because we use stretch materials and chlorine safe materials in all of our binders. Another style that I'll talk a little bit about is like sometimes called a hybrid or flexible compression. There's a lot of new brands on the market that are offering something like this right now. And they might be like a lower to moderate compression level or called something like flexible compression. So you have a lot of range of options when you don't want something that's only a high compression level. And more when I'm speaking to people in my community or my customers, they're looking to get a different range of products instead of only having kind of your standard high compression binders. These also can offer more health benefits, greater safety, and are generally better for people who are more active or need to have a more fullness of breath or range of motion. Not everyone experiences chest dysphoria in the same way or to the same extent, and many brands like ours, we make options for people who want maybe a softer or safer, non-restrictive binding experience. Some binders also cater to people who with sensitivity issues. So there are a category of binders that are sensitivity friendly. I've seen a couple great options on the market. We also make one where the edges are totally hidden and they're made out of really soft material. So that can be really, really great for people that experience sensory overload when they're binding. One thing that I really want to talk about, which I find really, really important, probably the most important thing when you're looking at different binder brands and styles, is the difference between stretch and non-stretch. So I'm going to get a little bit technical here. There are two main ways to construct a binder. If you think about it, a binder is kind of like a sandwich, right? So it's squishing your tissue in the middle. And traditional binders, for example, like GC2B and others, they use a non-stretch cotton twill or similar fabric in the front, and then a very stretchy thin lycra panel in the back. And that means at first you're going to get a really, really good tight compression and a binder that hangs flat down the front, creating a super flat silhouette. Over time, though, these stretchy back panels kind of give out, meaning that you can't wear your binder for a really long time without it stretching to a point where it no longer compresses. Like I'm sure we've all heard of kind of like the binder pipeline where you're like, well, I wore this and then it stretched out and it's too big for me, so I'm going to pass it along to the next person who needs it, which is amazing and I love. But there are options for people that want to have a longer wear and keep items out of the landfill more. This style also has issues with the chest tissue coming out of the bottom of the binder sometimes, as there's no elasticized bottom edge to hold you in. So binders that are made with stretch materials, they offer a less flat front, but generally are a lot more longer lasting and even lasting like decades without giving out due to the high quality compression mesh materials. They also have a stretch band at the bottom, so it makes sure that the tissue stays inside the binder. It's a lot safer for exercising. Binders and stretch materials don't come with the same health risks, so you still do have to be cautious, but some stretch binders like ours can, for example, be worn for more than 8 hours safely if you're really like listening to your body and assessing the risks, and they can be used for things like swimming or sports or singing. You could sleep in them with some like caution without the risks of feeling unsafe restriction to your breath and to your rib cage. This, I find, can also be a lot safer for younger people who might want to take a risk-adverse behavior due to an increase of dysphoria at that age, or people who have a more active lifestyle, or for a lot of different reasons might have external pressures making them want to bind quite heavily. And feel free to ask me more questions about this later. I know it's like a little bit technical. I want to talk a little bit as well about the importance of proper sizing. So this is like one of the most important parts of safe binding is getting a good fit. So getting a custom fit binder is optimal to ensure that you're wearing a binder that fits you perfectly and you can wear for a really long time without pain. So you should never experience pain when you're binding. There might be some discomfort, especially when you're getting a new binder and it's not stretched out. You might have a period where those materials need to expand and flex a little bit. But we do design them, or at least when I'm designing binders, we do allow for that so that they're going to be a little bit tight when you put them on, and then they're going to relax to fit your body perfectly. And because those materials aren't stretching out, you're going to get a much longer lifespan on your garment. You're going to be able to wear them for years and years. And if you're curious about finding out more about taking your own measurements, getting custom sizing, we're going to put some links in the chat, and you'll get these as well at the end, where you can use my guide, or you can go online and figure out other systems of taking your own measurements, which you can then input into a company like mine that does custom sizing, or you can take those to other brands and make sure that you're comparing your body measurements with the size chart of that brand to make sure that you are getting a proper fit. So that's really, really important. So I'm going to hand it over to Kai for a minute, who's going to talk about another really awesome option.
Thank you, Ray. Hello, everybody. So, yeah, I'm just pretty much here going to cover taping and my experience with my taping. So, so just a little bit about myself. I've been using trans tape probably for about, it's been a couple years now. So just going to take my standpoint of, like my experience, the pros that's come from taping, and then the cons as well. And then, of course, safety tips, guidance for you guys who want to try taping. All right, so my favorite thing about taping is that it allows longer periods of wear. So with trans tape specifically, you can wear it up to 5 days, which is really helpful for me in my experience. Don't have to keep removing the tape day to day. It's pretty durable. You can sleep in it, you can shower in it, you can swim in it, you can work out in it, which is a huge thing for me. So that's my biggest taping background, is that being fit like 6 days a week. I need something that's very durable and won't be in my way, not compressing or anything. So that's been very, very helpful in my fitness journey. With trans tape as well, it's also customizable. So that's really, really cool thing here is that they have like different skin tones. They have different sizes as well that ranges from like 3 inches to 7 inches. So, you can find one to help fit your chest. They also do have a measuring guide as well on their website to help you determine which size of tape would be best for the size of your chest. And then also a really cool thing here is that it's more than binding. So you can also use it for play, for tucking, for lifting, working out, as I mentioned. Um, and then again, about swimming and working out, it's better for this reason because it's also breathable. So it's sweat proof, which is really great because I sweat a lot during my workouts. And so, it allows you to release the fluid so you don't get any buildup, help avoid acne. And then another benefit is just like no extra layers. So not feeling like I'm wearing too many layers, especially like while I'm working out. I want to feel as breathable as possible. So another thing about taping, so you want to use tension rather than compression because you want to avoid over stretching, pulling of the tape. So just use that pressure, the tension, and rather than the compression, like you're never going to get the perfect flat shape that you're looking for. Like think of it more as you want to use it as to contour your chest, not just flatten it. So that's one thing that I wish that like I had like really grasped onto when I first started taping, because I would get so overly frustrated, like, oh, like it's not flat. I can still see some roundedness on my chest. Like, but in all reality, like you're still going to see that roundedness, but it's just more of a masculine contour that you're building with trans tape. All right. So it's also less obvious under certain clothing, like an open shirt. This is my favorite because I love wearing button down, half open or fully open. Really seeing that chest, the lines of your chest. And then also with tight fit clothing as well. So this allows me to be more stealth. So, I don't have to worry about, someone seeing. I just feel more stealth and, more secure. So, but especially under the tight fit clothing, under my gym clothes, my dry fit, it just fits really well with it. It's also less restricted breathing. So it's safer for people with asthma and health conditions. I have asthma myself. Go figure, being a fitness junkie. All right, but that's pretty much so like an overview of the pros of taping, especially from my experience. And then to dive into the cons, some safe guidelines here. So it is generally known to work better on smaller chest sizes. That's not to say it's not beneficial for people with larger chests. Like I mentioned earlier, trans tape has different sizes you can choose from. You can have sensitivities to the glue. So it's not ideal for people with sensitive skin. So I do want to go ahead and throw in here to always do a test strip before you just go and fully apply a full piece of tape to your chest, because then you got a whole thing to worry about versus a small patch if a reaction was to happen. So do that test strip, but trans tape also does have a new adhesive that it rolled out. It used to have those issues beforehand, but they worked very diligently and carefully with upgrading their adhesive, and there's been like virtually no adverse reactions going on, especially for me, because like back then I absolutely did used to have those reactions, and I thought it was just, dang, I'm allergic to this, I can't use trans tape. But simply since they changed the ingredients, and I mean, I've had virtually no reactions, even from like accidentally overstretching, because I still do it, time to time, just on accident. We're not perfect. It's still going to happen. But I've noticed just a significant reduction of irritation, even if I do accidentally overstretch. So that's been amazing. So in the short term, taping can be more expensive depending on how often you use it. But in the long term, it is safer and it does, curb some of those side effects of binding, such as rib cage damage, the muscle damage, and acne. But so again, it does kind of depend more on how often that you do use it. Um, and then again, just really, really, really be mindful of how to apply the tape. So the improper stretching that can cause irritation. So when that skin is pulled to the side and the tape is too taut, it'll overstretch the skin and cause too much friction, which that friction can lead to burns and damage to the skin, blisters, scarring. So yes, just do definitely be mindful of how you apply the tape. That's huge. So speaking of how to apply tape, so TransTape does have various resources of support for application. So there's a live chat on the website, and there is now a live video as well for people over 18. And then they are also doing in-person informational sessions for schools and for faculties. There are blog posts, there's user manuals with each roll. Yeah, actually with every kit that they deliver with a roll of tape, a nice little card and manual shows you how exactly to apply it. So you virtually can't be lost, when applying the trans tape. And then let's see, there's also video applications, like I just mentioned, the measurement guides on their blog posts. The kits also come with repair salves and massage oils for recovery and nipple guards. So I do want to say, please, like whenever you first start taping, please make sure that you use nipple guards. And then also when you remove the tape, never just remove it without using the oil. Like that's just asking to rip some skin off. I've been there, done that, trial and error, or just being impatient, just want to get it done and over with. But, be patient with yourself, give yourself some grace, follow the proper precautions so that, you can keep your skin safe here. And then, yeah, just reiterate, try the test strip first. That's something that I wish I would have done early on. But yeah, that's pretty much everything I believe in regards to taping. Make sure I'm not forgetting anything here. Okay, yeah, I think that's it. So Ray, I'm gonna turn it back over to you.
Yeah, cool. Thank you so much for that. It's so
Okay.
nice to have all that firsthand experience. I've done a little bit of taping, but not too much. And you just have such good tips. And I'm like, oh, I was definitely doing this wrong. I
Trial and
did
error.
not do all that stuff. I'm gonna know a lot better now.
Yeah, I'm glad
I
that-
only do it every once in a while. Yeah, I mean, there's so many good options for people out there now. It's really amazing to see, and so we just want to make sure that we cover all the bases and give you some really good examples of why you might choose to try or keep using different strategies to alleviate dysphoria, make yourself feel really at home in your body. Before we hand it over for questions, I'm just going to go through some of the safety guidelines for binding. As Kai mentioned, some of the stuff for trans tape. We just want to make sure that you are listening to your body, that you're not doing anything that's A, like painful when you're doing it, and B, that's not going to give any long-term damage, because we've all heard of someone or know someone that's done improper binding and has long-term damage, and we really just want to make sure that that doesn't happen as much as possible. So the biggest risk with binding is that there can be long-term musculoskeletal damage. This usually happens in the rib cage and the surrounding muscles and tissues, and usually it's because of improper binder use or an improper fit. So following safety guidelines is going to ensure that you mitigate the risk as much as possible when you're binding. I can't emphasize enough to listen to your body. I know it's really tempting to push past those guidelines, push past a little bit of discomfort and pain. And yes, like I was saying, at first, as you put on a binder for the first time, there might be some discomfort, but we really don't want people going out there wearing a binder and thinking, it's okay that I'm in pain all day and it's worth it to get this flat front. It's really not going to be. So here are some I don't want to call them rules because everybody's going to be different, but some things that will help you follow safety. So when we're talking about non-stretch binders, the general consensus is to not wear them for more than 8 hours continuously. Like I said, if you have a binder that's like a lower compression or more flexible materials, that might vary. We don't have a lot of data on it, to be totally honest. And we also want to avoid sleeping in those non-stretch binders. We never want to wear 2 binders or size down in a binder. It's really important that we're getting a good fit for safety. And if you do have respiratory conditions like asthma, wearing a binder might be riskier for you than it is for other people. So just check in, either like do your own research online or check in with your doctor and make sure it's right for you. Never wear a binder that you don't feel like you can take a deep breath in, it's really important that we're still getting like a full diaphragm worth of breath, of their full lung capacity, and that'll still allow for movement of the rib cage. And we don't want to wear a binder that makes you have any rib pain. Again, this should not be a painful process. If you're having any sort of like continuous sharp pain, please stop. You can contact the person who you got the binder from. You can go online to a forum. If you have a care practitioner already or a doctor, hopefully that they will be supportive of you and you can ask those questions there as well. Also, please make sure that you're washing your binder after every time that you wear it. It is a piece of underwear and it's sitting right against your body. It's going to help with a range of skin issues that might come from something that's really just absorbing sweat and sitting really close to your body all day. Also, when you take your binder off, you might want to do some light stretching and massaging in those areas. Definitely doing some like rib cage openers. I'm sure Kai knows all about all of these things, and I'm like, yeah, just stretch. But I'm sure that that Kai has some really, really good information, more specifically. Also, taking a shower after you take your binder off can be really helpful. In yeah, yeah, go to Kai's page afterwards. I'm sure that there's great information there. So yeah, to reduce things like acne and skin irritation, you can just like have a rinse, just like as if you were at the gym. You know, that'll really mitigate some of the things that we just don't love that come along with binding. You know, and acne is already pretty prevalent if you're like starting hormones or anything like that. So we just want to try to eliminate that as much as we can, which is never going to be entirely, and this is going to be a process, and our bodies are always evolving. So yeah, definitely this is not comprehensive. There's a lot more information out there, but I'm going to leave it at this for now. And we do have some links for you for like a deeper dive if you want to get more specific. And yeah, I think Aiden, if we're doing good for time, we wanted to do some questions for the two of us. So actually, these are some questions that I thought I'd ask Kai based on your experience. So I hope that you feel comfortable sharing. And you know what, if there's other people who are following along and want to input their experience as well, feel free to chime in. But I was curious what your experience has been like using the tape. Why did you end up choosing it predominantly over binding?
All right. So I use tape mainly because, again, just really for the freedom. So like I don't wanna like feel like I'm having to wear an extra layer, especially like because again, I mainly tape honestly like going to the gym or like yeah, because like really like when I'm working or just like day to day. I used to in the past, I used to tape like nonstop. But now, so that somehow my experience has changed is that I mainly just tape going to the gym. I just feel more confident. You know, I don't feel like, I mean, of course, like in the gym, like not everyone's judging, but you know, you're kind of always just, you know, peeping each other, looking at each
You're
other.
just aware.
Yeah, yeah, there you go. You're aware, you're aware.
Yeah.
I just feel more confident in myself when I do tape, when I am working out. So
Yeah.
that's been the biggest drive behind why I tape over bind is because my fitness background. So I've been, you know, all throughout middle school and high school, I ran track, and then I started weightlifting after high school. And since then, I've pretty much, you know, been on my fitness journey, weightlifting, and you know, trans tape just fit perfectly into my experience of wanting to make my chest more masculine without having to wear something else to compress it. So
For
like
sure. That
that's
makes so much
kind of,
sense.
yeah, because like all
With
the
your lifestyle.
sweating, yeah, yeah.
Yeah.
So that's been my biggest reason for taping instead of binding is fitness junkie. I'm always in the gym. Like
I'm sure
they,
that resonates with so many people out there for a lot of different reasons. And if
yeah,
you are ready, I have a follow-up to that
of
because I'm
course.
curious. I'm curious if it was
Yeah, I
always
love
this way.
questions.
Okay, amazing. I'm super curious if it was always this way for you or how that experience of choosing binding or tape has shifted along your gender journey.
Um, so it's kind of always been the same, honestly. But like I said, like before I started taping, I was just running a sports bra.
Mm-hmm.
And so I guess in a way, like I kind of coupled, that dysphoria with having to wear a sports bra
Mm-hmm.
with having to wear a binder because I'm having to wear something to compress my chest
Definitely.
versus the tape, it allows me to I can just throw two strips on and there you go. I can go shirtless if I want to, or, because it also has that ability to like blend. I mean, I'm definitely still, pretty self-aware, like self-conscious, like whenever I am in my tape, of course, just being trained is just for it.
Yeah.
But I just definitely feel more free and more like myself whenever I am wearing tape
Yeah.
versus having to wear another garment to get the same appearance. Yeah. But starting out, but I will say like, so I guess I can say I haven't like truly, I don't think I've tried a binder. Again, it was just a sports bra.
Yeah.
And then straight from the sports bra, I was like, what? Tape? I tried KT tape at first.
Right.
And it wouldn't stick. It was popping off during my workouts. And I was just like, dude. And then that's when I just happened to find trans tape through trying to
Yeah.
find an
That's
alternative.
actually a really good point. That's something that I forgot to mention earlier, is I know some people when they start off taping, they find K-tape before they find like a brand that's specifically made for this. And I think there's probably a pretty strong consensus that it's not made for this and not optimal. I think also like the glue is also pretty intense to be wearing for that long a time and on such a sensitive area. So that's definitely something that I would caution against.
Absolutely. And I don't even think with KT tape, it can't even hold that long either. Like I remember
Not made for purpose.
exactly, yeah, it's made for athletic performance,
Yeah.
injuries, stuff like that. Like because I wore KT tape when I ran track for my shin splints.
Right.
But it's yeah, definitely not the same.
Mhm. I think it's a confusing thing at first. I think when I started using tape, I didn't really know that there were like different brands for different things. So I just want to make sure that people are clear that like trans tape and other similar brands are like specifically for this.
Yes, huge. Yeah, I tried the KT tape. Like there are different types of tapes and brands and companies, but trans tape is literally is specifically for binding. So
Mhm.
like
Mhm.
that's huge. That's a huge takeaway. Because I had that same, idea, all tape was created equal, just
Yeah.
to flatten my chest, contour my chest,
Yeah.
but not the case
There's not a ton of
at
info
all.
out
Not the
there.
case. There's
Cool.
not.
Well, thank you for
There's
sharing
not.
that. It's really
Sure.
fascinating to hear how you've evolved and what your experience has been like. I think, Aiden, if you want to help us take some questions.
Yes, I love it.
Yeah. See what people have to say.
Yeah, so you can drop your questions in the chat or you can drop them into the Q&A box right now. Really quick before we get into some more questions, if you do feel inspired by today's conversation, we encourage you to make a donation to Point of Pride. Your support allows us to continue providing free gender-affirming services like binders and gaffs and HRT access to trans individuals in need. Donations can be made at the link that I will be dropping into the chat right now or by texting trans futures to 44321. So we can get into some of these questions. We've got a lot coming. We've got a lot on the back end, and then we've got a couple coming up just in our Q&A box. So we'll start in the Q&A box first. So it looks like this is for you, Ray. Do you plan on ever adding long binders to your repertoire?
It's a really good question. I actually sold long binders for maybe 10 years, quite a long time. I think there's still a really, really great option for so many people. But the ethos of my brand is that I don't make anything that doesn't work for everybody. And so what I found was that long binders on people with bigger bodies, especially who had like more tissue around their hips. They were rolling up, and it wasn't something that I could like fix or make the binder better. It's just going to happen. It just doesn't work on that particular body type. And so I didn't feel comfortable selling it across the board. If I had to say these are only going to work on a more thin body type, that didn't fit with my value system. But they are amazing on some people, and there's tons of brands out there that still do them.
Awesome. You know, I'm actually going to jump to a back end question because it kind of goes into that question. So I'm a larger chest size. What option should I choose if I want to get a really flat chest?
There's a ton of different options. Maybe I should clarify. Are you specifically talking about binders, or is this someone in the chat, or is this?
Yeah, this is like when people first sign up, they can ask a question, and so this came in beforehand. So I think if I'm assuming this is like, should I choose a binder or tape?
Yeah.
But maybe you can answer in both ways. I'm unsure.
Yeah.
If you ask this question and you're here, drop us something in the
or if you have a similar experience. I would say that there's going to be options on both sides that will work for you. And I think we've probably gone over a lot of the different reasons why binders or tape might be good for different people, different sizes. I don't think anyone with a particular like chest to rib ratio would be excluded from the benefits of either binding or taping. I would say from my experience with binders, you'll probably want to get something that's like sold as a higher compression, and a shorter binder might work better for you. Specifically, I'm thinking of like in my line, we have a racerback double mesh half binder that works the best for people with larger chests. And if in your body it's difficult to get binders on and off because of that, or like getting them over the chest tissue is really challenging, then you could look at getting something with a closure down the side or down the front. That might be helpful for you. But it's quite body dependent too, like where people's tissue is, like the other factors that are in play. I don't have enough information to give like a 100% this is going to be the right thing for you. It really depends on like how long you're okay wearing it and where you want to wear it. And of course, like on the other side, there's so many reasons why you might want to choose tape instead of a binder. So I hope that helps.
Yeah, I definitely do want to chime in right here. So in regards to taping, especially for large chests, so Bo from Trans Tape, dude was like a double D before top surgery. So it's definitely a learning curve, but you know you can definitely help again with those live chats, live video support on how to apply it. Like I'll be honest, he's even helped me in applying for my chest, and I mean I'm significantly smaller, but yeah, that's definitely. I just wanted to chime in from the taping aspect. Like if you struggle with a larger chest, definitely reach out to Bo for that support. He can definitely help from the taping side, sharing his experience, his knowledge on how to help support you on taping a larger chest.
That's amazing.
I know, right? He's so cool.
Really cool. Thanks, Bo.
Awesome. Next
Yeah,
question is, sorry, I cut you off, Kai. What's up?
Oh, no, I was just saying thank you, Bo.
This is an interesting question. I've heard a lot of questions. This is a new one. Are the sensory binders softer / less constricting than regular binders? I get pain from wearing constrictive clothing on my chest. Would taping be a better option?
A great question. Again, there's a lot of factors at play here. You let me know, Kai, if you have any advice on this, but I think it's kind of depending on like what the sensory issues are, because like there's just different sensations with binding and taping. You might not want the restriction of a binder, so in which case taping might feel more like freeing, but the sensation of having something on your skin might be what irritates you or annoys you. Yeah.
Yeah, I want to like ask off of that question, like what
Mhm.
exactly like is the sensitivity or that you're having is what
Yeah.
that would boil down to.
Yeah, a lot of people I find when I'm designing binders for what they don't like is having like the seams on the edge of the binder, especially if they can feel like the threads on the back of it. They can find it to be really irritating against the skin, in which case I would say like a sensitivity friendly binder, which doesn't have those seams, might be a really good option. But if the sensitivity is just generally about having something like really tight, that might not work and they might want to move to tape.
Yeah, yeah. If that is the case, that's part of my reason again. Yeah, taping would definitely be a better option in that case. If that is the situation in regards to the sensitivity, that way you don't have to worry about any fabric or any irritation that might come from that or sensitivity issues. It's just right across the chest. Boom.
Yeah, definitely. That I think would make sense.
And if you are the
Yeah, I
person
feel
who
like I was
wrote
in a really
that
good.
in, feel free to comment in the chat. We can
Yeah,
get more specific. We can get as specific as we
we
want.
can clarify. Please let us know.
Yes, let us know. I think that Ray, I think this is for you in the beginning of this webinar today. Could you? They're requesting that they got a little lost in the beginning, but they felt what you shared was important. I want to remind everyone that this will be on replay, but also I don't know if you already have the service, Ray. So definitely a question. Do you have any type of short, concise list with all of the different binder kinds, like a one pager or something already created?
Yeah, it's one of the links that you have handy about how to choose a binder. It should be listed under our resources at the end, and we can drop that in the chat. And it goes through the different compression levels and the pros and cons of each type of binder, at least the ones that I
Is
sell.
it the choosing a binder link? Okay, I'll drop that in the chat right now. There we go. Awesome. So
That should be helpful in understanding some of the differences in like the cuts and styles and materials that I offer.
Amazing. Great. Thank you so much. Again, if you have more questions, drop them in the Q&A. Here, this question came in earlier. It says, how tight should a binder feel? How do I know if it's too tight or not tight enough?
Yeah, that's a really good one. Like I said, you shouldn't have any pain, specifically, you shouldn't have any pinching pain, especially like kind of under the armpit area here. That's a common point to get pinching if your binder is too tight across the top of the chest. And you shouldn't have any pain in your muscles or your rib cage. You might feel discomfort, especially when you get a new binder. What we offer as a tip is if you get a new binder, you can use the back of a chair to kind of like stretch it over and give it a good yank a couple of times, and you'll definitely see. And you can even throw it in the washing machine when you first get it, and that'll help it loosen up. We find after like 1 or 2 wears, they'll like settle into their like final form. That can be really helpful. But then if you've been wearing it a little bit and you notice that you're feeling more than just discomfort, then you probably got something too small. And too big is like fairly obvious. You won't have a flat front. You might have like gapping through here. Like you'll be able to kind of like see it hanging loose from the body. It won't be touching the rib cage. You'll feel like your chest tissue just kind of like falls out the front. Things like that will let you know that you've got something too big. And especially if you've had something that you've worn for a while and you feel like it might have expanded over time, you might start to feel like it's getting to that point, in which case it's probably not doing a lot. I've heard lots of stories of people getting to that point and then like wearing 2 at a time. That's probably the point where you just want to get like refit and get a new binder. Yeah, probably not having its desired effect.
Awesome. Thank you. I think this is, I don't know if either one of you have an answer to this, but I plan on getting top surgery. I wanted to know if binding or taping negatively impacts top surgery results.
I'm not actually sure. Kai, do you have any answer to that?
Well, I haven't had top surgery yet, so that
me
is a
neither.
great question. Honestly, I'm not 100% sure. I don't.
Yeah, I haven't heard any
think-
feedback on that specifically either.
I
Sorry.
bound, I guess would be the bounded. I wore a binder for
Uh-huh.
like, I think just under 4 years before I had top surgery. I was like a nice size B cup, just like for clarity on like how much breast tissue I was working with. I personally, I didn't think it didn't seem like there was any difference. So I don't actually know, but I haven't ever like had someone say my doctor said because I bound XYZ. So I don't think it negatively impacts if I had to just guess, but of course, no one here is a doctor. None of this is medical advice. We're just giving thoughts, opinions, feelings.
I will add something to that in that, yeah, I haven't personally heard of any negative impacts of either. But if you are on testosterone, it might make your chest reduction significantly easier because it does already lessen the amount of tissue before you go in for top surgery. So on the other side of things, tangentially, that might be something that affects your top surgery results.
Yeah, and to add in on the taping aspect, I don't, like I said, I haven't had top surgery yet, but I don't foresee it like bringing about any negative results because, again, it's not constricting or anything, and not really any adverse reactions outside of just overstretching. But
Yeah.
it's a great question though. But
Yeah, these questions are amazing. Thank you, everyone. They're like very nuanced. It's great.
Next question. I experienced profound dysphoria while running because of the bouncing sensation. Suggestions: layered sports bras are not enough compression, and wearing a binder is not recommended while running. Some folks have said they didn't run until post-op. Has anyone solved this struggle? I'm not ready to give up on running.
I mean, this sounds like a great case for trans tape.
yes, a huge case for trans tape. So again, like Bo just keeps coming to my head because there's a picture of us running down this hill, both in our tape. And again, Bo was the one he had double D's. And when I say this man had like zero movement, but again, because I didn't tape enough or compress enough. And so I had a little bit of the bounce, and I just definitely remember that feeling. And I'm like, oh, I hate that sensation. So, but yes, so taping applied correctly, absolutely. Like you should have no motion. Like I was so jealous of Bo that day. I was like, dude, like how do you tape so well?
Sounds like if you're doing it right, it's
Having a
really
much
incredible. Yeah.
Yes, yes. So absolutely, trans tape would be a huge benefit for you to help get rid of that motion, especially being a runner. Yeah, because you definitely want to
I will
have the
note.
room to
Sorry.
breathe and everything. So no, you're good. You're
Yeah.
good. Bro.
I was just going to add a note that some binders you don't want to run in, but there are a lot of binders that are fine for exercise. I would say like most of the binders on the market, especially if you're looking for something with stretch materials, are totally fine for exercise. It sounds like you want something more compressive than a binder though. So it sounds like in this case, tape might be a really good option. But if you did want to try a binder, that there are definitely styles that would offer like quite tight compression and would be totally safe.
Amazing. It sounds like the best thing that ever happened to Bo was getting top surgery, and the worst thing that ever happened to trans tape is Bo getting top surgery. Putting that out.
Spot on. It's fine.
I have one more question I definitely want to get to, but then it also looks like the person who had asked about the sensory issues kind of gave some more information. So let's do that one. And then unless there's a lot of other pressing, I have got one more lined up. So in response to the sensory issues, they're saying that it's hard to explain, haha, but I have sensory issues with things pressing in on my body and things that push into my body, like wires or bras. I don't have a lot of fat tissue on my chest. And so if something is pushing in on my chest tissue / lymph nodes, it can feel achy or painful. Also, if you know anything about lymph restriction due to chronic illness, I get swollen lymph sometimes during flare-ups, which contribute to the discomfort. It's okay if you don't know the answer. I'm just trying to learn what options I have.
Yeah, totally. I mean, Yeah, I don't know specifics about all those things, but it sounds like a binder might actually sit along some of the lymph nodes in your armpit area, which might be a sensation that's not good for you. So in this case, I would probably suggest to try the taping instead.
Yeah, just to bounce off of what Ray said, yeah, I definitely would recommend the tape, especially I don't know much about the lymph nodes and everything, but if that's in the armpit area, if you tape correctly, you're avoiding that entire armpit area. So just make sure again, following those video applications, fully following the pressure of the chest. But yeah, I think that would be a better option for you. Definitely just take precautions and, even see the doctor and everything. But I think that taping, and plus even the small size tape as well, it sounds like, because you say you don't have a lot of tissue on your chest. So if you just go with a smaller roll, I think that would be a great option for you.
Awesome. And last question for the day. How do I care for and wash my binder to make it last the longest?
Yeah, I got this. So like I mentioned before, binders are underwear. You want to wear them wash them every time you wear them. But they are a little bit more sturdy than people think. I would recommend washing them cold and hanging them to dry, but they don't have to be washed by hand. And even if they do accidentally go in the dryer, it's not going to ruin them. It's fine. There are no materials that a binder is going to be made out of that will shrink. So you don't have to worry about that. Like I was explaining at the beginning, there's two different types. Some will have like a cotton non-stretch panel. In which case, any brand, you're just going to want to make sure you check the tag and follow the instructions. But yeah, keeping things out of the dryer generally helps keep the fibers from breaking down, which means you're going to get a longer lifespan out of your garment. But still, yeah, make sure you wash it every time you wear it, and then just hang to dry is always the safest option. I think for a lot of garments. But yeah, you don't have to put them in a lingerie bag or hand wash them. They're pretty sturdy. They're made out of materials that are meant to be pretty robust because we're really yanking on them a lot. They're meant to take a lot. So you should be pretty safe with that. I also have a full blog about that on my website if you want to go into more detail.
Fantastic. Well, thank you so much, Ray and Kai, for this awesome event. Thank you to everyone who asked great questions, and just thank you all for your attendance today. If you'd like to stay connected, I've dropped Ray and Kai's information in the chat. We will also have this event on replay on our blog, which will also include all of the information and resources mentioned here today. I encourage you all to stay connected with Point of Pride by following us on social media at Point of Pride ORG, and subscribe to our newsletter to get information about all of our programs, including our free binder program and our annual trans surgery fund. We are projected to give away over $500,000 in 2025. So if you are somebody who is looking for gender affirming care, definitely check out Point of Pride. If you'd like to support our work, donations can be made at the link that I will drop in the chat. You can also text one word trans futures to 44321. And as I said, if you're in need of a garment, you can go to pointofpride.org and apply today for a free binder. Before we all leave, I do want to remind you of our other programming continuing through the week. Tomorrow we will be hosting with Dr. Fakay a masculinizing facial surgery. So if you want to see all of our programming for the rest of the week, check out our socials or our blog at pointofpride.org. Thank you so much, Ray and Kai, for joining us. I really do appreciate it.
Thank you for having us. This was awesome.
Yes, thank you so much.
Of course. And also shout out to our interpreters, Kevin and Mackenzie, for helping all of those who need it.
Hi, I'm Dylan Holloway, otherwise known as Dylan and the Moon. But I haven't always been. I'm also a transgender guy. I used to release music under my old name, Lots Holloway. For as long as I can remember, I knew there was something different about me. Music was my way of trying to make sense of it all. I wrote songs before I had the words to explain who I was. I was terrified I would never find love, that I'd never be accepted. But then life happened. Change happened. And now I have the words. More than that, I have a voice. 2, actually. Now I make music with the person I used to be. I sing duets with my old self because every version of me matters. I use old recordings and old videos to harmonize with my former self because I want other people to know that it's okay to embrace who you've been. That person brought you here today, and every version of you matters. So, my music is for anyone, especially anyone who's ever felt like they didn't fit in. For the ones who have changed, for the ones who are still changing. Don't leave your past behind. Carry it forward. That's freedom. Welcome to my world. Welcome to my stories. Welcome to my music. Be who you are. Love who you love. We're in this together.
When you said you were wasted, drinking drunk all my life, tried to cocoon yourself in my body, falling into my eyes. You couldnbe without me. You never wanted a good night, let alone a goodbye. Then you said we were changing, that it's not what you want. Not a single thing changed on my body, but I stopped turning on. And when you said we were happy, were you telling me lies? 'Cause you're left with goodbye. And now I can't seem to get you off of my goddamn mind. And to be honest, I'm not alright. And now I can't seem to get you off of my goddamn brain. And to be honest, it's driving me insane. Because there you go again. And I can't seem to get you off my brain. On the east side of our town, there's a new liquor bar. I can see it from my window at night, and I think that's where you are. With somebody that's not me, with someone who thinks cool. I hate a fictional fool. On the overground westbound, saw someone with your hair. In the street I smell perfume and dye. It's the one that you wear. When I'm ordering coffee, and any date I go on, is it all just a sign? And now I can't seem to get you off my goddamn mind. And to be honest, I'm not alright. And now I can't seem to get you off my goddamn brain. And to be honest, it's driving me insane. Because there you go again. And I can't seem to get you off my brain. I'm blaming you from a distance, but you ain't doing this to me. That you ain't got a clue I'm twisted about the way we used to be. You're entitled to a good life, and if it's not by my side, it's okay, you change your mind. So I can't seem to get you off my goddamn mind. And to be honest, I'm not alright. Because I can't seem to get you off my goddamn brain. And to be honest, it's driving me insane. Because there you go again, and I can't seem to get you off my brain.
Hello, everyone, and welcome. Very excited to have everyone in attendance. Thank you so much for joining us today. My name is Aiden Dowling, and my pronouns are he, him. I am the co-founder and chief advancement officer here at Point of Pride, and we're excited to have you with us for this very special conversation, which is part and the kickoff of our Transgender Awareness Week programming. This week is really all about uplifting trans voices, fostering understanding, and advocating for greater visibility and access to care for transgender and non-binary individuals. We're very grateful to have everyone here as part of this important dialogue. Before we begin, I do want to introduce any of those who may not know what Point of Pride is or what we do. So Point of Pride was founded in 2016, and we are a trans-led nonprofit organization dedicated to providing life-saving, gender-affirming support to transgender and non-binary individuals around the world. We offer direct services through programs such as our free chest binder and GAF program, our HRT Access Fund, our electrolysis support fund, and our currently open for applications annual surgery fund. If you want to know what our mission is, that is to eliminate financial and systemic barriers to care, ensuring that every trans person has access to the services they need to live authentically and thrive. So as you can see to my left here, I'd like to introduce our guest for today's virtual workshop. So everyone do a virtual wave hello to Dr. Zara Lay. Pronouns are she, her, they. Dr. Zara is a board-certified plastic surgeon who's recognized expert with vast experience and knowledge in all aspects of transgender and gender-diverse surgical care. She is the only transgender woman of color to offer a full spectrum specialization in gender-affirming surgery, including top surgery, bottom surgery, facial surgery, and body contouring. Prior to joining the team at the Gender Confirmation Center in 2022, she worked as an assistant clinical instructor of plastic surgery at the University of Utah and had her own private practice in Arizona. So as I was told earlier, I should refer to you as Zara. So hello, Zara, welcome, and thank you for being here to spread your expertise for this bottom surgery fireside chat.
Of course, thank you for hosting me.
Of course, excited to have you. So as a reminder to everyone here, we have time for questions at the end of this discussion. And for those of you who asked questions ahead of time, we did take some of those into account and put them into our chat box. We have Abby, who is here for Point of Pride, to be answering some of those questions ahead of time if she is able to. And then, of course, we have some interpreters here. So thank you to both of you also for coming, Wina and Mackenzie. I hope I pronounced your name correctly. Please correct me if I did not. Awesome. So
Wanye.
Wanye, there we go.
Yeah.
Thank you. And thank you for interrupting
No
me.
worries.
I appreciate that. Too
No
many
worries.
people let it go. So thank you. Okay, awesome. So our subject overview. So just really want to remind people why we're here and what we're going to talk about and what is transgender bottom surgery. So this fireside chat is going to focus on transgender bottom surgery, both FTM, so female to male, and MTF, so male to female procedures. So bottom surgery is a vital gender affirming option for many transgender individuals, helping align their bodies with their gender identity and alleviate gender dysphoria. FTM surgeries often include procedures like phalloplasty and metoidioplasty, while MTF surgeries typically involve I always pronounce this wrong, Dr. Zara. Can you help me? Vaginoplasty, is that it?
Yeah, that's right.
Oh, okay.
Vaginoplasty, or vulvoplasty.
There we go. Vulvoplasty. I always put an A. I don't know. I'm pronouncing it incorrectly. So these surgeries can significantly improve mental well-being, self-esteem, and quality of life, though the journey is deeply personal and complex. So thank you again, as I mentioned, Dr. Zara, for being here. And overall, just wanted to give you an opportunity to start off with answering the question of like, what first inspired you to specialize in gender affirming surgeries? I think that you have such a unique story being a trans person yourself. Would love to just hear a little bit about that backstory of what got you here today.
Yeah, well, let me just say, for those who are taking time to join us in this chat, thank you for setting aside the time to listen to us. But that the answer to that is pretty interesting, and I couldn't answer it without sharing some of my own experiences as I basically came out and started going through that journey of becoming my true self. And so as a surgeon, I was going through all the different portions of my training. And what I now find very interesting is that in none of it, of course, things are different now. So I'm much older than I seem, but back in the day, right, like an old person, back in my day, there was literally zero mention or training of anything related to gender healthcare. There was one chapter in one of the plastic surgery texts that had gender surgery care in it. And so I would flip through it and just be amazed at all of this. I actually learned a lot from YouTubers and websites as I was closeted and just trying to get information on what was happening to me, what was going on, things about hormones, things about people's journeys. And I'm very grateful, even today, to the YouTubers that were brave enough to put their stories out there, because it really helped me as a person to finally get the courage to basically just become me. And as we all know, those in the community who choose to go through this, in terms of like for me, surgery was the right thing for me. So it really helped me to see what the changes were and what the possibilities were. But during that time, I thought to myself, like, how do I get training in this? And there weren't that many centers. Certainly, again, back then, there weren't official gender surgery fellowships. These are extra years that doctors tack on to their already long training in order to specialize in something. That's what a fellowship is. And there weren't any until recently, actually, for gender care. And so I was thinking, where do I go? Should I go to Thailand, which was very well known for gender surgery. And then there's also Belgium. But I couldn't possibly take the time off in my long educational and training career to do that. Plus, my own journey was moving much faster than that. I couldn't wait for me to finish to go ahead and do that. So the short of it, I'm sorry, it's like it's a long answer.
Fine. That's what we're here. We're here
But
to hear you.
basically, I'll make it short. Basically, as I was seeking to have bottom surgery in particular, you know, now everybody knows what my bottom is. I went to Dr. Meltzer in Arizona, and of course I did my research. I looked through everything, and I had seen his name and had known about him much sooner than that. And so on my consultation for my bottom surgery, I never, in the whole process, I never pulled my doctor card like, I'm a doctor, I should get special privileges and get a sooner appointment or, you know, anything like that. I just went in as Zara, as myself. And as we started the consultation, he just, you know, he wanted to like get to know me. And so he asked, like, what do you do? And I'm like, I'm a plastic surgeon in Tucson, which is 100 miles away from where he was practicing. And you should have seen his face. He was like, what? Like, that's amazing. And then he got really excited and started asking me like, you know, like, where did you train? And I listed the million things I've done in terms of my training. And by the end of the consultation, he literally offered me a job.
Oh, wow.
Said, I'll
You're
train
gonna
you.
get a
And
surgeon
then,
and a job.
yeah, that's right. You know, I basically, you know, I came out of that, you know, with the promise of a vagina and a job. So
I love it.
that was fantastic. And my friend and I, you know, came away and we were driving back to Tucson. And I was like, did he just offer me a job? And she's like, yeah, I think he just did. And it was the weirdest thing, right? Because all I wanted was surgery. And if he hadn't brought it up, I would have just been like, you know, like, I don't care. Like, I want my surgery. And I would have gone on and done my own life. But basically, he trained me. So it's, you know, and I thought about it, and I thought, how cool would it be for someone like me to go through it and then be able to train and then be able to offer this to others. And so that's what's special to me about this job. I didn't dislike my job before, but this was like 100 times, 1,000 times more deeply satisfying than anything I had done before. And I still feel that. I still feel that it's very special. In my position as one of the very rare trans persons dedicating our surgical career to this, that it's just wonderful. It makes me super happy to be able to do that.
I love that. And I think it's very aspirational for those sitting, you know, in the chair right across from you, so to speak, right? This metaphorical chair, to be able to see someone like you in that position, right? Being a surgeon, you know, having gone through your own process. I think it's really awesome and inspiring. And I think that I'm sure that you've not just physically changed people's lives, but emotionally as well, and the possibilities. So I love that. I love hearing that story. Thank you so much for sharing it. So I know that you had mentioned that for you, you know, surgery was something you wanted to do. And, you know, one of the questions we have is, you know, what advice do you give to patients struggling with the decision of whether bottom surgery is the right step for them?
People do ask me that, and I of course hear many different angles and feelings and fears about proceeding with surgery, but ultimately, yes, I know I'm a surgeon. I don't I really don't push people one way or another. I really want each individual to make that decision for themselves. And of course, there's always other things at play, right? It's never an isolated thing. And so I certainly don't try to pressure patients into any surgery, but even within any set of surgeries, such as, body stuff or facial stuff, where there typically is more than one procedure, I'm not trying to like sell them on everything, right? I'm not a used car salesman. I don't. Yes, this is how I make a living, but I'm also not like trying to take advantage of people and tell them like, this is what you need to pass, or this is what you need. And there's no other way. And as a surgeon, I feel like our community is definitely a vulnerable community. I'm in that community, and I know I'm still vulnerable to a lot of things. You wouldn't think so, but I am. But I feel like there are certain places, which I frown on, that sort of prey on that, and take advantage of our community. So you have to make that decision for yourself, and don't get pressured into things that you don't necessarily want. Because I do see it. I hear people go to certain places. Most places are fine. But certain places they really just want to do as many surgeries, for the sake of financial gain. So but that's basically it. I do say it sometimes where I'm like, I literally say, I'm not a car salesman. I'm not here to tell you that you need this or need that, or if you choose this part of it, you also have to have this other part. I do staging and things, but I never say like, you have to come back to me for the stage. This is a contract. It's not like that. And I do also bring up other options of things that I don't do in terms of that technique. And I will do my best to refer patients to the places that they need. But yeah, I really just try not to like force my own personal opinion on anyone.
I love that. Do you have any sounds like a warning sign is if you go in for one thing and you come out with 4 things?
Well, that's not necessarily wrong, because sometimes patients aren't sure about other things, and so they'll be like, especially something like facial surgery, they may not like their jawline or their forehead, but then they're also not really sure what else could be done. And so if they ask, then I systematically go through the options, again with the sort of disclaimer that, okay, I'm going to mention a bunch of things. This is how I see it as a surgeon, but that you're not obligated to be like, oh my gosh, I need to get this. It's just, educational, and certainly, of course, my professional opinion on whatever it is, whether it's bottom, whether it's body contouring and whatnot.
Is it possible to do more than one surgery at a time? For instance, if someone wanted to get stage 1 of phalloplasty and body contouring, or any other combination, or do you suggest doing one surgery at a time?
I don't. It is very possible to combine several surgeries or sets of surgeries. There is a time limit that is considered like safe for surgery. And the hospital or surgery centers have these sort of rules of, I think it's like, it depends on the center, but 9 to 10 hours is about as much surgery as you can do on someone, and that's what they allow you to schedule. Now, of course, if there's a complication, not necessarily a complication, but maybe it took a little bit longer because of some unforeseen anatomical thing or something, and it goes over, then fine, that's okay. But yeah, it's also very personal how many things you want to combine, like face surgery with breast or face with bottom. And if it's a lot of things and they want to have it combined as close to each other as possible, I can do head to toe, depending on what the procedures are. 2 days of surgery, 2 days apart.
Wow.
It's a lot, and it's not for everybody. I certainly didn't go through, I've had head to toe surgery, and I certainly didn't break it up that way. But again, it's about education, right? Telling folks like, okay, if you combine it, yes, it's a huge hit. For one, you have to obviously qualify for it. You're healthy, you don't have a lot of comorbidities, or things that one would worry about, your health and your safety. But if you're pretty healthy, and you feel like you're pretty strong, you can get through it. And many people do that way. It's one anesthetic, one sort of relatively short period of recovery, right? 2 days apart, some very acute recovery during a short period of time. But then you're mostly done or completely done, rather than, sure, you can take any set of procedures and break it up into 6 or 8 procedures, but then it's 8 anesthetics, 8 recoveries, and then more time.
Yeah.
So very personal.
Yeah. Thank you. When it comes to like what are the most common that you find when it comes to male to female bottom surgeries and then female to male bottom surgeries?
For the trans femme individuals, face and bottom is pretty common, or face and breast is pretty common. And of course, breast with bottom is also very, very common. For the masculine patients, the set of surgeries and the combinations tend to be more limited. It's very rare for me to do facial work, although that is available. So it's typically body contouring and bottom surgery. And of course, there's top surgery. So you can combine top surgery with something like a simple metoidoplasty. Body contouring is a bit different because it usually means liposuction. And if I'm doing bottom stuff, there seems to be, like, sometimes, again, depending on exactly what procedure, too much swelling that will pull down to the, gravity wins. So that pulls down to like the groin area. And so you don't want to do that. Work on some big liposuction thing, and then worry about how your metoidoplasty is going to heal with all that swelling from the surgery itself, but also the swelling and the pooling down to the groin area.
Is there any words of advice you could give to all of those listening and participating today to just about the expectation management of the outcomes, whether that is related to how long after a bottom surgery or a stage of bottom surgery, or even just functionality, kind of if you could take a minute or two to kind of help people with their expectation management, I think that would be a great benefit.
Yeah. So expectations, you mentioned a lot of facets of expectation, right? So there is certainly, the aesthetic facet, and then the functional facet and recovery facet, specifically for femme patients, the dilation portion, if that's something that they're going to have to do. And so it really is through education. Certainly office paperwork can cover a lot more than in one or two consultation sessions. I try to be pretty well-rounded in terms of my consultation with covering all those things. But also being pretty transparent about what my complication rates are for each set of procedures, so that the patients can truly be well informed in the process.
When you think of, I think a lot of people think about aesthetic and functionality when it comes to bottom surgery. Could you speak a little bit about the realism that could come with a bottom surgery for a trans femme and the bottom surgery for a trans masc? And then could you talk a little bit about the functionality between both?
Yeah. So gender surgeons, including myself, our goal is to obviously do our best to create through surgery, the basically set of genitals, right? Speaking of bottom surgery, the set of genitals that best fits the patient's wishes. And so for those that either want female basically genitalia or male genitalia, but we also have to remember that even within those two groups, there's the in-between, the gender neutral, non-binary gender neutral options as well. And so based on my experience and through education and going through different professional meetings regarding this, I feel like I certainly have a pretty good idea of what is achievable. And so what I can say is that in terms of appearance, again, depending on the procedure, let's say vaginoplasties, the vulvas that we create are actually pretty darn good, I have to say. They're pretty darn good functionality-wise. If everything is healing okay and patients do follow all the recovery and dilation requirements and they heal well, in the long term, they also have to maintain it. But in the long term, it's quite functional. Sensation should be intact, and it is in the vast majority of patients. The functionality of the vaginal canal is also good, but that is heavily dependent on the patient dilating, certainly initially, and eventually using it can also play a role in the maintenance of it. Now for the masc patients, again, whether it's an actual phalloplasty or just a metoidoplasty, there are differences in the success rates of sensation, and I do bring that up during the consultation. Metoidoplasty, none of the nerves that go to the glands of the phallus are altered in any way, so full sensation in those cases. Whereas for the phalloplasty portion, it depends on what phalloplasty option they're going for and whether that option carries a nerve that can be connected to an erogenous nerve, basically a clitoral nerve, through microsurgery. That I have to admit isn't perfect. the success rate is much more variable than, like I said, a metoidoplasty where the nerves aren't touched. So it's just as good as it was before.
Right, right. Awesome. I think that will give a lot of clarity for some folks who are here today. Awesome. So
things to bring up though, that's the thing.
Yeah. Yeah.
You know, sorry. Things to bring up with your surgeon, whoever you go to, you know, clarify, you know, that kind of thing. Be well informed.
Where would you say, besides places like, you know, what we're hosting today, and where would you say is a good place to go or places to go to get some more information about any of the bottom surgery options that someone may be interested in?
Yeah, so again, the way I did it was YouTube. Now, you know, you can certainly get a lot of information on YouTube, but you can also get not necessarily intentionally misinformed, but sometimes some of the stuff there isn't as accurate or as true. So be careful with that, but it's at least an easy starting point. The other way to do it is, you know, look regionally or locally, like who are the gender providers? Look at their websites, because most of us have information posted on our website about all the different procedures and some pretty basic things to expect. And that's another way to find out. That is certainly much more accurate information. Academic centers and private centers is another place to go. The other place that is also very popular is Reddit, but just like YouTube, you have to be careful about some of the stuff. But overall, I think it is pretty informational. And any sort of questions or doubts, you know, obviously, you know, bring them up with the actual provider, and ask them about that, and have them clear up, you know, whatever that is.
Is there a question that you kind of wish people asked you more often when they were getting a consultation with you?
Some patients do ask me that. You know, they ask their questions and then they say, is there something I didn't know to ask, but that I should? And depending on what it is, I kind of bring it up. But I guess there really isn't one. The biggest one that I think patients should ask is the particular surgeon's experience in whatever procedure it is. And don't be embarrassed to be like, well, what complications have you had and how did you handle it? What are your actual numbers, and not just quote some paper of like, well, this paper says the complication rate is, I don't know, 5% for, you know, for whatever the complication is. But the actual surgeon's rate is 10%, then that's kind of deceiving.
Right.
So I think that's important, is to know who you're going with and what their rates of things are. And hopefully they're truthful and accurate about what their experience has been as a surgeon providing this.
Awesome. Thanks so much. So I know that we have a Q&A section of today's talk. So for everybody who has been listening, as just a quick reminder, you can drop the questions into the Q&A. If there's anybody that would like to potentially come up and ask, you can be unmuted. No pressure, just more of a if I have If you'd like to, you can let us know when you answer the question. But before we jump into that, oh, and you can also upvote a question. So if you maybe see a question that you are like, actually, I do want to know the answer to this, you can just click the little thumbs up button on the left-hand corner of that question, and that will bring it to our awareness. Before we begin questions, however, though, if you do feel inspired by today's conversation, we do encourage you to make a donation to Point of Pride. Your support allows us to continue providing free gender-affirming services like bottom surgery, binders, gaffs, HRT, and HRT access, as well as electrolysis and laser hair removal to trans individuals in need. So donations can be made at the link. Abby will drop that in the chat, or you can also text the word trans futures to 44321, and every contribution makes a big difference. So thank you so much. So we are going to move on to some questions. So I'm going to start, Zara, with just the ones that have the most thumbs up. So I'm just going to start on this first one from Santiago. It says, can you elaborate on the pros and cons of rod versus pump? Thank you. I'm assuming they're talking about phalloplasty, if I'm...
It sounds that way. That is a good question. I think Santiago is referring to erectile devices for someone who has had or is considering having a phalloplasty. Now, currently, only those with a phalloplasty with a flap, as opposed to metoidoplasty, can have these erectile devices done. And so the rod is basically just what it sounds like. There's malleable rods, but there's also firmer type of rods that you can place within the penis in order to make them stiff enough to allow for penetration for sexual purposes. The pumps are devices that require pumping fluid into a chamber, typically, in order to inflate and make the device hard, for the same purpose. I personally use hydraulic devices, so pumps that use saline as the sort of the filling agent. The pros of the rods is that it doesn't depend on, you can't have like the mechanism fail, like the pump or the tubing or a leak, because it's just a solid, it's a solid device. The downside of a rod is that one of the criticisms is that sometimes it can't basically fold down enough so that there's always a bit too much of a bulge in the crotch, right? It's one thing to have sort of the male sort of bulge there, but when it's not, it can be hard to conceal, and patients can be feel self-conscious or think that people think that they're they're perverts, kind of thing, and that's a real sort of concern. And then with a pump, like I said, it can malfunction, which then requires to have to replace it.
Awesome. Thanks so much.
That's brief. It's much more complicated than that, but yes.
I'm sure, right? Like we could probably be here all day. So this is another one. This got a couple of upvotes as well. So let's see. So it says from Anonymous. So it says, do you have any tips for establishing or maintaining health neovaginal microbiome? Like what to expect, what to avoid doing?
That's a good question. So once you have had a vaginoplasty, I think part of it also depends on what type of vaginoplasty lining you have had. So very briefly, I do skin-lined vaginoplasties. There's peritoneal lining vaginoplasties. There's tunica vaginalis vaginoplasties. And of course, there are the intestinal options, whether it's a portion of the colon or small bowel options as well. The non-intestinal options, I think that in general, having one myself, it kind of takes care of itself. And so I do think that frequent douching is important in maintaining the natural flora or the bacteria that builds up in the vagina of peritoneum, skin, or tunica options. I think that's helpful. And of course, being aware of things that can happen. So our vaginas that are non-intestinal can get yeast infections. You can get bacterial infections in there. And of course, for those, you need medications, no differently than any cis vagina having the same issues. Intestinal issues, of course, it's intestine, right? So the intestine will come with its own set of bacteria. But I think the need for, say, douching is less because the intestinal mucosa does sort of shed. And it's kind of, in a way, self-cleaning, like, natural vaginal lining does as well. But you can still get infections in there as well, only because it's been basically separated and detached from the main gut system.
So many words I could never pronounce if I had to read them. So I'm so happy, thank you so much. So this other one, okay, so this question is also anonymous. So it says, if you get a minimal depth vulvoplasty, is it possible to then get vaginoplasty with a canal at a later date?
Very good question. And that is a point that I do bring up to patients who come in asking for a vulvoplasty. Again, I don't try to push people, from one to the other. And so if they come in and they ask for vulvoplasty, that is a point I do bring up. And the answer is yes. Going back to the misinformation, there's a bit of misinformation going around that you can't. Once you choose a vulvoplasty, like that's it, you can never have a vaginal canal, and that's simply not true. Yes, you can still have one, and the options for building the new vagina, you can still have a skin-lined vagina. Of course, the skin now would have to come from, for me, someone who's had it, a vulvoplasty, all the excess skin has already been basically used up and tossed. And so I take skin from the groin crease, hip area, and I can still make a vagina. Of course, peritoneal lining is totally an option for someone who had a vulvoplasty. The only one that gets eliminated is a tunica vaginalis, which is part of like the scrotal kind of tissue that wraps around the spermatic cord and the testicle that has basically been destroyed in performing the vulvoplasty. So you can't go back and say, hey, I want tunica as my lining. So yeah, the answer is yes. And then the other thing I bring up, aside from yes, you can still have it done, is the risk of making the canal is the same as any first timer. This is not the same thing as a redo surgery. A redo surgery carries much, much higher risk of significant complications.
Thank you. This question says, Does size in phalloplasty play a factor in sensation?
It certainly does. And even in phalloplasty, for me, it's anywhere between usually 5 to 5.5 inches, whether it's a groin flap phalloplasty or a ALT or a radioform phalloplasty. I aim for about 5 to 6, but mostly 5 to 5.5 inches in length. And so when I put the nerves together or put a nerve inside a phallus, the more tissue it has to grow through, it's not usually 100% growth. And so the larger space it has to kind of grow through, obviously it does carry a lower chance of full sensation. It could be patchier maybe, or a little bit less. But it can lead to patients being orgasmic through their phallus.
Fantastic. Sorry, I'm looking through some of these to see which ones got upvoted so I can make sure that we get to the best ones because I do know we're coming at time. So let's see. For vaginoplasty, do you often have requests for cosmetic revisions after the initial procedure?
I do. I get them from my own patients and I get them from other centers around the world actually. And depending on what they consider being deficient in, there's many things that can be done, such as clitoral hood or clitoral column, and usually more commonly labia minora, the definition of the labia minora. But yeah, there are options to improve the aesthetic results.
Awesome. So I have, is there a good time in someone's life, like age-wise, to get any type of bottom surgery? Like, is it better in your 20s than in your 40s, or does it not really matter?
I don't think it really matters. As long as you're healthy, right?
What about?
Statistically,
Yeah, go ahead.
I mean, I've done surgery in 60-some-year-olds, like almost 70. And yes, they obviously cleared the medical issues, but they do have more issues. Blood pressure, maybe some low-level kidney disease, that kind of thing. So between 20 and 40, no, not really.
Okay, great.
Just be healthy. There's young people that aren't healthy, unfortunately, or have comorbidities, and it doesn't mean it's a no. It just means that we have to make sure that any person at whatever age is in good condition to proceed to have surgery and anesthesia, not just surgery, anesthesia safely.
I know the answer to this one, which is the first of all of the questions, but I want you to answer it. Is electrolysis required before a vaginoplasty?
It is not required. I highly recommend it. And there are patients that simply, because of their anatomy, their pelvic dimensions, just don't have enough of the tissue that I use anyway, especially since I'm one of the skin only surgeons. In those cases, again, I go to the groin crease, hip area to take any additional skin that I need. And typically there isn't hair in those areas. And so they end up with basically no hair inside the vagina by doing it that way. But otherwise, I highly recommend it because the last thing you want is a lot of hair inside the vagina. Now, a few hairs or even a little bit of hair is not an issue. I've only seen one patient, which wasn't even my patient, who had a severe, probably the worst I've ever seen, of hair inside the vagina. And I'm talking like full on hair inside in the shape of a vagina, right? So it's a closed space and it was just full of hair. And as one can imagine, there were so many other things matted in there that it was pretty bad. And all I could do at that point was to pluck out all the hair. And, you know, it probably regrew, but it's very, very hard to find a laser person or a electrolysis person to have the right equipment and the willingness to do intravaginal hair removal. So I highly recommend it. I don't require it. I do thin the graft if it's a skin lined thing. I do thin the graft so that most of the hair follicles are eliminated. If you choose peritoneum or tunica, there's zero hair. To be fair, or colon, obviously.
It sounds intense to have to get that taken care of. For all of those who are interested, we do have our electrolysis and laser hair removal fund opening in January. So if you are somebody who is in need of that in preparing for potentially a bottom surgery, you can definitely apply. Just a little shout out to you, Zara. It says not a question, but yay. I'm so happy you featured Zara. She is a real inspiration and idol for me, both surgically and personally. So wanted to give you a little,
That's very sweet.
yeah, a little shout out there.
Any insults?
No insults. No insults. So there are so many questions here we are not going to get to. So thank you everyone for your questions. We will answer this one next. So is it possible to have a phalloplasty after giving birth as an FTM individual? Thank you for your time and sharing your expertise with this community. Which is your
absolutely.
Boom. Done. Love it. Awesome. Well, you know, all in all, thank you so much. I feel rude not calling you Dr. Zara. I
told you this before.
I know, but it just
Zara. We're within our community. It's a safe space.
Yes. Well, thank you.
And it's old convention, right? That's like.
Well,
I know I'm old, not that old.
Well, not that old. Well, thank you, Zara, for this awesome event. And again, thank you to everyone who asked questions. Thank you to everyone in attendance today. If you like to stay connected, we'll drop the information for GCC in the chat. We'll also have an event replay on our blog, which will also include some more information on how to get a hold of Zara, or if you're interested in getting any type of services. And every resource that we mentioned here today will be in that blog post. I also encourage you all to stay connected with Point of Pride by following us on social media at pointofpride.org and subscribe to our newsletter to get information about those programs when they open for all of our applications. Again, if you are looking to get bottom surgery and you are somebody who has barriers to accessing care, our annual surgery fund is open right now. And if you are in the position to support our work through donations, you can make them in by texting trans futures to 44321. And before you all leave, I want to remind you of some other programming that we have continuing throughout the week. So tomorrow we will be hosting our gender-affirming voice coaching workshop with Renee at 4:30 p.m. Eastern. To see all of our program for the week, you can check out our socials or our blog on pointofpride.org. Again, Zara, thank you so much for coming today. It was a pleasure having you. Thank you everyone who attended, and happy Trans Awareness Week.
Thank you, everyone.
Hey everyone, it's Aiden here, aka Donation Daddy. I am the co-founder and Chief Advancement Officer, which is just a fancy way of saying I do a whole bunch of stuff at Point of Pride, including help Mercury and the team run this Stream-A-Thon. I'm so excited that you're here today. Thank you so much for joining us. We've got a lot of hours and a lot of work to do, and I'm so proud of you for joining us and helping us in our mission to help save trans lives. So I want to take a minute or two and give you some information about where your donation is going and what we've done in the past, and really thinking about, you know, you're taking your time to be with us today, to share this stream, to comment, to like, and also, if possible, to donate. So here's some information you might be interested in hearing about how we here at Point of Pride take your donations and put it back into the hands of trans and gender diverse folks around the world. I brought my handy dandy notebook to go over some of the stats because there's a lot of things you should know. And first and foremost, the number one thing I want to share is that our average donation over the last few years has been anywhere from $35 to $45. So every dollar counts, and I want you to know that. Also, I want you to know that over 10,000 people, 10,000, that's a lot of people, okay? 10,000 people donated under $10 last year. Amazing. Every dollar counts, and we appreciate you. Also, we supported 4,457 people around the world in 2024 with the help of your donation. We have many different programs here at Point of Pride, and one of them is our annual Trans Surgery Fund. Last year, we were able to help 47 recipients and give over $724,000 to trans folks for their gender-affirming care. Do you remember Atlas and Catless? Well, Atlas also got his surgery, his top surgery. It went fantastic. He's so grateful, and he wants you to know that he is so thankful for your support in our work here at Point of Pride. Also want to share a quote with you from Samantha, pronouns she, her. Samantha says, "I was persecuted in my home country for being queer. For me, this surgery doesn't mean vanity. It means freedom." And that is so true for so many trans folks around the country. Another one of our programs is our amazing HRT Access Fund. Last year, we were able to give over $244,000. I mean, these numbers are crazy to me, y'all. They are legit crazy. And we were able to award 117 recipients. That's over 100 years of HRT for trans folks in 1 year. And that's all because of the work that y'all do to comment, to like, to share this stream, and for those who can, to donate. Another quote from one of our recipients, Ryan, pronouns he, they. Ryan says, "I can now access consistent HRT, which helps me feel in control of my mental wellness and confident in my appearance." That's all we're trying to do, folks. Let people feel confident, feel loved, feel supported, and together we do that. It's amazing. I love doing this. The work that we do is so hard and so meaningful and so impactful to so many people, over 4,000 people last year. Another one of our programs is our electrolysis support program. So we were able to award over $376,000 to 191 recipients. Amazing. A quote from Robin, pronouns she, her. She says, "I feel so much more confident and beautiful in my skin. I can finally be more of the woman I know I am." This is what y'all do. This is the work that we put in for these 30, I don't even know, it was like more than 30 hours the year before. It was like 31 hours, 34 hours. I don't know. I got a cake in my face one of these times. I lost a twister embarrassingly last year. So it's so much fun to be here with y'all. It really truly is, and I'm just so happy for it. So let's continue to share some of the things that your donation does. So another thing that we had this last year because of donations from y'all is that we were actually able to start a pilot of a new program. And so this program is called the Thrive Fund. Gender-affirming care looks like many things for many people. And it might not look like one of the
funds that we already have. It might not look like HRT. It might not look like electrolysis. It might not look like surgery, right? It might look like a wig. It might look like getting your name changed. It might look like, you know, getting certain types of care for you that you feel align you better with your body. And we listened to the feedback from so many people, and we started the Thrive Fund. Last year, we were able to award $55,000 to 45 different recipients. And this quote is from Manola, who I got to meet, and it was so awesome to meet her. So if you're watching this, Manola, shout out. I love meeting you. I hope we get to meet again. And she says, "A wig is more than just a piece of hair. It is a symbol of my resilience, my identity, and my right to exist as I truly am." And this is so true. One thing that we really stand behind at Point of Pride is that we believe trans folks. We believe that you deserve the gender-affirming care that you feel you need, and we want to help you get that. And we can only do that with the help of everyone here today who is liking, sharing, commenting, and donating. So you may already know, but I want to remind you that Point of Pride, it has a platinum status at GuideStar, which is so hard to get. It is harder than getting into Harvard, in case you were wondering. And we also have 4 stars, which is the highest stars on Charity Navigator. I really, really always appreciate you. I love doing this work. It is something that I have always wanted to do. And for those of you who don't know, you know, I got my top surgery because I started screen printing t-shirts in my living room, and I would sell them, and I would go to Walmart and I would buy a t-shirt for, you know, $4 or $5. I would screen print it at home. I would mail it for $3, and I would keep the $6 or $7. Because of community organizing, I was able to get my top surgery. And I'll never forget that. I will never, ever forget every single person who bought a t-shirt from me. And that is why Jeff and myself decided to take that t-shirt company and turn it into a nonprofit. We want to help the community. And with your help, we can do that together. Hello, everyone, and welcome. Thank you so much for joining us today. My name is Aiden Dowling. My pronouns are he, him, and I am the co-founder and chief advancement officer here at Point of Pride. We are excited to have you with us for this special conversation, which is part of our Transgender Awareness Week programming. So happy Transgender Awareness Week. Hi, Dr. Cherie, how are you?
Hi, I was just figuring out why my camera wasn't coming on, so excuse me, I'm old. So
no worries. Happy you're here. This week is all about uplifting trans voices, fostering understanding, and advocating for greater visibility and access to care for transgender and non-binary individuals. We're really grateful to have everyone here with us as part of this important dialogue. So before we begin, I want to put a disclaimer out that this information is provided for educational and informational purposes only, and it is not intended as medical advice. Please always consult a qualified healthcare provider for personalized medical guidance. I'd also like to take a minute just to introduce those who may not know what Point of Pride is and what we do. So we were founded in 2016, and we are a trans-led nonprofit organization dedicated to providing life-saving, gender-affirming support to transgender and non-binary individuals around the world. We offer direct services through programs such as our free chest binder and GAF program, our HRT Access Fund, our Electrolysis Support Fund, our Thrive Fund, and currently open for applications, please take a note, our annual Surgery Fund. Our mission is to eliminate financial and systemic barriers to care, ensuring that every trans person has access to services they need, like living authentically and thriving. So I'd like to introduce Dr. Cherie, and then I will also be happy to introduce Bram, our co-host. So Dr. Cherie, I'm pronouncing your name correctly, am I?
yes, perfectly. Yeah.
Fabulous. Okay. So Dr. Cherie is committed to reimagining the cosmetic surgery experience.
Inspired by her own experiences and the patients she's met, everything she does is directed towards one clear objective: to help you achieve your health and beauty goals. Dr. Cherie understands the power of change and that freedom comes from knowing you can choose to make changes to your body that make you feel more like you. She believes everyone should be able to create an image which makes them feel comfortable or inspired or just seen for who they are. And next up is our host, Bram, pronoun she, her. My apologies. Dr. Cherie's pronouns are also she, her. Bram is a Kansas-based retail manager with a deep passion for fashion, LGBTQAI+ rights, pop culture, politics, and country music. When she's not working, she's dedicated to advocating for her community and expressing her unique style. Bram brings warmth and inclusivity to everything she does, making a positive impact both at work and in her personal life. So thank you, Bram, for hosting this event, and Dr. Cherie for being here to spread your experience and expertise. As a reminder, we do have times for questions at the end of this discussion, so please feel free to ask them in the chat or the Q&A box at any time, and I will make sure that they get handled appropriately. And for right now, I'm going to go off camera. I will be in the chat, and I'm going to hand it over to Bram. And of course, I'll be here if you all need anything.
Thank you.
Hello. Hi, Dr. Cherie. How are you?
Hi, I'm well. How are you?
Good. I'm great. Okay. So before we get started, I'm unaware. Is it orchiectomy? How do I say that surgery?
Yeah, so it is. You're saying it perfectly. It's orchiectomy, but you
Okay.
know, I've also seen there's also a term orchidectomy. It's an
Okay.
older term, but you might see that out there. Also
Awesome.
means the same thing. Yeah.
Okay, so our chat today will explore two gender-affirming surgeries, breast augmentation and orchiectomy. Both procedures are crucial components of care for many transgender and non-binary individuals seeking alignment between their physical appearance and their gender identity. Breast augmentation involves the surgical placement of implants or fat grafting to create a more feminine chest appearance. The procedure can be vital to trans feminine individuals in reducing dysphoria and enhancing body confidence. Orchiectomy is the surgical removal of one or both testicles. It is often pursued by individuals assigned male at birth who no longer wish to produce testosterone, or those who prefer to stop hormone replacement therapy without the use of blockers. These procedures not only alleviate gender dysphoria, but can also improve mental well-being and provide trans individuals with greater control of their medical journey. Thank you, Dr. Cherie, for being here.
Well, thanks for the invitation.
Yeah, of course. How are you this evening?
I'm probably as well as anyone is in the current climate, but yeah.
Right. So what inspired you to begin working with transgender and non-binary patients?
You know, I'm old. So for many years, I was a general surgeon, and I was in the Air Force, and I did a lot of general surgeries. But believe it or not, the military was pretty good about letting me just kind of like do whatever I wanted as long as people were happy. So I got a little taste of doing things like loose skin for weight loss, gynecomastia for the cis guys, things like that, right? Then after I got out and I experienced the corporate hospital culture for a while, I really didn't like it and I wanted to do my own thing. I went and did a cosmetic surgery fellowship in Seattle, Washington with Tony Mangabat, and he did some top surgeries and gender-affirming surgeries. And I loved it. I loved the community. I just think it's so powerful to be able to change what you see every day. You know, your home, your body is your home that you can't ever leave, you know? And so I think that that's just so important. And definitely I had instances in my own life where I wanted to change something and it meant a lot to me. But anyway, when I moved back to the East Coast to be closer to my family, I wanted to be within a day's drive. I moved to Charlotte, and I at first my practice I moved here in 2013, got the practice all set up and built and all that, and opened early 2015. And at first we offered everything, but I particularly highlighted, some of the gender affirming surgeries that I did, and the business really grew. And as soon as that started to happen, we decided to exclusively focus on that. Because there are plenty of people out there offering your standard mommy makeovers and everything else. And I just really liked this niche, and I really liked seeing people just feel more emboldened and feel, so yeah, I've really appreciated the community. And honestly, I think if you have something that you love to do and a place you like to live, you're already in like the 1% of happiness. Like, honestly, I really think that whatever comes, like, I'm very, very grateful for that, for having that opportunity.
Absolutely. No, that's actually really beautiful. I was trying not to cry. That's why I was muted. That was really beautiful. What do the surgeries entail? So could you walk us through the surgeries and what that all involves?
Yeah, sure. And if you want more detail, less detail, just let me know.
Give me the bullets, and then if somebody wants more, we can do it. Yeah.
Right. Yeah. So let's start with just breast augmentation. Basically, somebody would have a consult. Most people that we see are not going to require anything extra. I use informed consent. So, unless someone has recent issues that might mean that they need to talk to a therapist, I don't automatically ask for any kind of therapy note or anything for gender affirming surgeries. So with the breast augmentation, you have a consult. If you needed to do anything, we'd let you know. We'd talk you through the options. The primary options that you're going to be thinking about if you're looking at a breast augmentation are the type of implant. And the ones that are available in the US are going to be either saline or silicone. Personally, I prefer silicone just because it's softer. And you're less likely to see any little ripples under the skin. Some people just feel safer with saline, but it is harder because you're basically taking a shell and filling it with a fluid. So it's kind of like a water balloon. The type of implant, of course, the size, and people do this different ways, but what I like to do is have people come in and spend a few minutes in our exam room just trying on different sizes. We've got a bunch of different shapes and sizes that people can try on. And then, so once you've chosen that, under the muscle or over the muscle is the next kind of thing to think about. And there are pros and cons of each of those. And then how to put them in or where to put them in. Options are basically at the lower chest, like at near the fold of the breast, the underarm, or around the nipple. And I prefer to do the underarm just because it's hidden and you don't have to have a scar on your chest. But those are basically the four big things that we decide during a consult with someone. The actual surgery is done under general anesthesia, so you're completely asleep. If we're putting it through the underarm, I'll numb both areas. We'll make a little incision. It's usually a couple of inches long. And we have actually these things, if we're going to go under in a small incision, called Keller funnels. And what it looks like, if you imagine, those little, those soft pipette things that you would use if you're doing cake icing in a fancy thing, it's like that. It's that shape. So it's wide at the top and narrow, and it's like slick plastic inside. You put the implant in and you kind of push it in like that. So it kind of goes in like that and then opens up. Yeah. So that's what I use if I'm going under the arm, that funnel. And if we're going under the muscle, if I'm going that way, which is the most common way that I do breast augmentations, you're never even touching the nipple or the breast tissue. You're going right under the pec muscle right here where it forms the underarm and just putting it in there after you've made a pocket for it to fit into. And then honestly, I love breast augmentations because it's like instant gratification. I can be an impatient person. And so it's nice, like it's
I think
surprise,
you and
like
the
you
rest
see
of
it
the
right
world
away.
you and the rest of the world might be a little impatient. So yes, you get the
Right.
satisfaction of the
Yeah.
surgery right then.
Right. A couple of little things that I like to do. I use, so when we do liposuction, use tumescent fluid. And what it is lidocaine and epinephrine. The epinephrine kind of constricts the blood vessels and decreases bleeding. The lidocaine helps numb and decreases pain afterwards. I like to put that in the area that the implant's going to go and let it sit for a few minutes. And then the other thing I like to do is to put a small dose of a neurotoxin like Botox or Xeomin in each pec muscle so that afterwards, you don't have as much tension and tightness and pain. You can still do everything. It doesn't paralyze your whole muscle, but it kind of just helps it relax a little bit. Because at first you're going to feel really tight and weird because, something's under your skin and under your muscle. And after that, it's just really a matter of time. For most people, you're going to be smaller at first. Your skin has to stretch to accommodate the new size. Your muscle has to stretch. And so at first they'll look higher up because that bottom skin below the nipple needs to stretch out to allow it to settle, or some people will call it like fluffing or fluffing out. But that's kind of the basic mechanics of it. Is there anything that I missed or that you wanted to ask about?
Not specifically on that. I don't have specifics on that right now, but what about orchiectomy surgery? What are those kinds of ins and outs of that?
Right. So orchiectomy, same kind of thing. If it's gender affirming, I don't require a therapy note. That's the one surgery that I do ask for a therapy recommendation in some cases, and that's for cis men, because believe it or not, we get quite a few of those requests.
Yeah.
And sometimes it's
Did you hear that,
specific.
everyone? Cis men do these surgeries too. I just
Yes,
want that
yes.
noted.
Yeah, yeah. And if it's for chronic pain or something like that, I understand. Sometimes people literally do want to decrease the effects of testosterone on things like their libido and things like that. But the reason that I asked this guys to do a therapy note for this is just because occasionally it is because people are influenced by a specific religious practice or specific relationship that they're in. And I don't want people to do something for someone else, and then regret it later if the relationship ends or if they leave that church or whatever. But if it's gender affirming, it's kind of obvious why somebody would want to have it done. So I don't ask for anything there. But the actual surgery itself, there are two ways to do it. You can do it through the groin by making an incision on each side, basically pulling up the whole cord where it exits from inside the abdomen and goes through the canal into the scrotum and taking it that way. I prefer to just do a transscrotal. So I offer two ways. One is with scrotal excision, one is without. So if somebody plans on possibly having vaginoplasty in the future or any kind of thing, you want to leave your skin. And so for that, I just make a little incision, again, about 2 inches long in that little midline of the scrotal skin and remove each thing that way. And I take the cord very high up near where it enters the body. So afterwards, it just retracts back. Now, the skin itself will look less after the surgery, and it'll make tucking easier and things like that because it kind of draws up because there's nothing weighing it down. But it's all there. So if somebody decides to have vaginoplasty later, you can stretch it out, see it, it's all there. If somebody's like, yeah, this is it, I'm not going to go any further, and they want to be just smooth, we'll just do the whole thing. So we'll take the scrotum and the testicles and the cords, and it'll basically be just smooth in that area. Anything that you think of with that you wanted to ask about?
Who or what advice would you give to patients who are seeking either one of these surgeries? Where to begin? What's the first, before they get to you, what's advice that you would have for them?
Honestly, I think most people kind of worry themselves too much. Like they think that they have to do something special to qualify for surgery or something. Um, I mean, I think it makes sense if you plan to take hormone replacement therapy and you've just started it, you might want to give it 6 months or a year to get the shape, especially for breast augmentation, the shape that you're going to have and the size that you're going to have, so that if you get an implant or fat grafting, you don't later get more breast tissue and it's like more than you wanted or something like that. But other than that, there's nothing super special that you have to do to prepare. If someone's using nicotine, it's not like a contradiction to surgery. We won't cancel you for smoking or using nicotine. But if you can stop, it definitely helps with healing and decreases complications. And the whole reason behind that, if anybody's curious, nicotine is a really powerful vasoconstrictor. So it decreases your blood flow. So every time you have a cigarette, it decreases your blood flow out to like your fingers and toes and nose and like to the outside of the body for about 15 minutes. And so that's the main reason. It actually doesn't have much to do with the lung part. But yeah, other than that, I would just say, you know, if you think about those options that you have and, you know, kind of get an idea. And then I think honestly, just starting with a consultation is a good idea, because then you'll have more information, you'll know about your options, and you can go from there. But there's not a whole lot that people have to do before surgery, honestly.
Awesome. I did not know that. So that is good information to learn. Thank you so much. What is your most enjoyable aspect of performing gender-affirming surgeries? I know you said that being able to see people become who they are. What, for you though, what is your most enjoyable aspect of it?
Yeah, I would say seeing people come back and just like, I also do like top surgeries for trans masked people, and like seeing their pictures on the beach without a shirt on, or yeah, people after breast augmentation, like sending their bikini pics the next season, or just feeling more comfortable. Like it's really nice, you know. We have a joke sometimes that our surgeries make people taller because the posture is different when people come back.
Of course, they're at home in their bodies. So for patients undergoing HRT, how do breast augmentation or orchiectomy interact with their hormone regimen? Are there any adjustments that need to happen before the surgery, or what's up?
Yeah, so for our practice, for either surgery, you don't have to stop your hormones, except we just ask people not to take meds on the day of surgery. So, or the morning of surgery. So you can either take it that night, or if it's like a weekly shot, if it happens to fall on your day of surgery, you can do it the day before, or the day after. With breast augmentation, it really should not affect your actual hormone status. You know, it shouldn't change anything. I noticed that one misconception that's out there, especially amongst some of the people who are more ignorant and against, you know, gender affirming surgeries, but they think that the breast makes hormones. It doesn't. The breast responds to hormones, but it doesn't make any. So anything you do with the breast tissue, it's not messing with your hormones. With orchiectomy, it's pretty instantaneous. So it will stop almost all testosterone production. And the reason I say almost all is because our adrenal glands make a little tiny amount. So there'll always be that little bit, but sometimes it's so small it doesn't